Very good morning to all. Before we begin the program, I just want to let you know that this program will be recorded. I assume that you have consent to do that. If you have any problem with that, let us know. Very good morning to all. I am Sivanand, a PhD scholar at the Institute of Public Health, Bengaluru, and the University of Transdisciplinary Health Sciences and Technology, Bengaluru. I'm extremely delighted to welcome you all on behalf of IPH Bengaluru to our first ever annual PhD workshop 2022. Institute of Public Health is the premier institute for training and research in health systems in India. The education cluster at IPH organizes various need-based capacity building programs, and in the direction of which today's workshop is the example that we are witnessing. What started with an informal talk 3 months ago regarding the idea of bringing PhD scholars from different organizations and provide an opportunity to build their capacity and form a strong research community today has taken the shape in the form of a workshop. Behind the screen, I must acknowledge the continuous and tireless work by all the PhD scholars at IPH for this wonderful platform of first annual PhD workshop 2022. This year's workshop is being supported by the Karnataka Science and Technology Academy, Bangalore. We thank KSTA for the support. We have a vision to organize this workshop on a yearly basis henceforth. With that background, I extend my hearty welcome to the chief guest of the inaugural program, Dr. and Professor S. Ayappanna, Karnataka Science and Technology Academy, Bangalore. Unfortunately, because of his illness at the last minute, he could not join. In his absence, we thank him for the entire support that he endured on us. I also welcome guest of honor, Padma Shri Professor Darshan Shankar, Vice Chancellor, the University of Transdisciplinary Health Sciences and Technology, Bengaluru, the Director of IPH, Dr. Upendra Bhojani, Assistant Director Admin, IPH, Dr. Pragati Habbar, Assistant Director Education, Dr. Prashant Dinesh, and the IPH Education Team Lead Vamsi Krishna, and other staff of IPH, and all the participants of the workshop. Now, we shall begin the inaugural program of the workshop. To begin with, may I invite Dr. Upendra Bhojani, our beloved Director, Institute of Public Health, Bengaluru, to deliver the opening remarks. Dear sir, we are very happy to have you for the inaugural function, and we extend our hearty welcome to you for the workshop. I request you to address the gathering. Over to you, Upendra Bhojani.
Thank you, Shivanand. I hope I am audible.
Yes, you are audible.
Yeah, namaskar. Good morning to all of you who are joining from India, and my greetings to others who I believe are in different time zones for making it today for this workshop. I'm glad that Institute of Public Health Bengaluru, in collaboration with Karnataka Science and Technology Academy, is organizing today's workshop, the annual Public Health PhD workshop. At IPH, we used to have such opportunities, to reflect on PhD journeys and to help PhD students, but this is the first time that a more formal and structured program has been put together and also has been opened up to folks beyond IPH. So Institute of Public Health Bengaluru is an academic research institution. While we are not a university setup, thanks to the formal partnership with the University of Transdisciplinary Health Sciences and Technology, the TDU in Bengaluru, and I'm very glad that the founder and Vice Chancellor, Professor Darshan Shankar, has been able to join us now. Welcome to you, Professor. It's this partnership between the IPH and TDU, but also IPH's collaborations with other universities, both in India and abroad, that we have been able to host and mentor PhD students at IPH. At IPH, we do give a lot of importance to the higher education in public health. We believe that that's one of the ways that we at IPH can make some positive influence on public health scenario in the country in some sustainable way. So I'm glad that a lot of efforts that has been put in by PhD students, scholars at IPH and TDU under the leadership of Dr. Prashant, who is my colleague and Assistant Director Research at IPH, has come to fruition. So on behalf of IPH, on behalf of KSTA, I welcome you all. I'm glad to notice that participants beyond IPH and TDU also include participants from other universities as well as non-university setups, the organizations that I have quite high respect to. I'm also glad that being one of the, being somebody who has gone through the PhD journey, I can relate with the importance of such a workshop, to have a time where you can pause, you can reflect, you can share with others who are also going through the same journey, and also listen from those who have completed the journey. So I truly hope that you all find this workshop useful. I also noticed that there are colleagues, that there are participants who are not PhD students, but who are trying to explore whether to do PhD or not. And I hope again this workshop will give some good idea to them in terms of what to expect on this journey. I also looked at the program. It looks quite interesting to me. So while there are some of the really interesting skill-based and skill-building session, I'm glad that there are also, spaces in the program to reflect, to debate around issues of ethics, issues of inclusive science, the issues related to mental health in times of doing PhD. These are very important aspects, and I think it's good that you all are going to deliberate on this. Sometimes we don't really talk about some of these aspects more formally in PhD journeys. So my thanks to many of the resource faculties beyond IPH who have contributed generously in putting together this program. So on behalf of IPH and KSDA, I welcome you all. And I wish you all a very fruitful deliberations in these 2 days. Thank you. Back to you, Shivanand.
Yeah, thank you so much for your encouraging words and support and setting the stage for this first annual PhD workshop, Dr. Rupendra Bhojani. And I thank on behalf of all the workshop participants and workshop committee, education clusters from the IPH. Thank you so much. Moving on to the next part of the inaugural function, addressed by the guest of honor. It is our privilege to have with us Padma Shri, Professor Darshan Sankar, Vice Chancellor, the University of Transdisciplinary Health Sciences and Technology, Bangalore. He has won several national and international awards, such as Commonwealth Award in the year 1976, Norman Borlaug Award in the year 1998 for his contribution to the conservation of wild populations of medicinal plants, Columbia University's International Award in the year 2003 for complementary and alternative medicine, and in 2011, the Government of India conferred on him the Padma Shri. Currently, he is the Vice Chancellor of the University of Transdisciplinary Health Sciences and Technology, Bangalore. Dear sir, we are very happy to have you for our workshop as a guest of honor, and we extend our hearty welcome to you, all of you, on behalf of IPH and all the participants. I request you to address the gathering. Over to you, sir.
Thank you. Is my voice audible?
Yes, sir. Yes, sir.
So I'm happy to be here. I have a great admiration for the Institute of Public Health and the work that it has been doing over the years. And, its commitment not only to design and implement important public health initiatives, but also to have an academic and research culture. I also appreciate the fact that it is PhD students who have taken the initiative to organize this particular program. And I think it's a very good initiative. And I'm glad that IPH has encouraged the students to take this initiative. And my good wishes to see this event happening annually, because I'm sure that it will provide good insights and sharing of experiences amongst researchers who are currently engaged, as well as those who have, as Upendra said, completed the journey. I'll just make very brief comments about my own thoughts about PhD programs. Usually PhD study, the study frameworks that are used in PhD programs are generally a single discipline. Sometimes they could also be, these days, interdisciplinary. Nevertheless, these frameworks, because of their relatively narrow, focused disciplinary orientation, have limitations, because the changes that are being studied are in fact due to complex and multiple factors which may not fall within the study framework, within the disciplinary study framework of a single discipline or even an interdisciplinary framework. The factors are complex and multiple. Nevertheless, this narrow framework that we use for PhD is okay, because a PhD thesis is not intended to throw up complete solutions. It is an training exercise for a student in systematic research methods, and therefore the current approach to doing framework, to doing PhD within specific disciplinary framework has a value. As I see it, there are two big learnings anticipated. Firstly, a focused way of study, that's very important, and so you narrow it down, you do it within a certain framework. There is discipline involved in even implementing a disciplinary framework. So focused way of studying, that's one big learning out of a PhD. The second is, which is I think very important, is to realize the limitations of one's study. No matter how much hard work you may have put, how much focus you may have put, it is very important to realize the limitations of the framework that you have utilized, the limitations of your study. And you know, PhD is not the end of, is the beginning of a research journey. And realizing the limitations is going to be very, very important. Critically realizing the limitations is going to be very, very important to advance one's research career ahead. So these are the two big learnings to my mind, from a PhD program, focused way of studying, and secondly, realizing the limitations of one's study, notwithstanding the discipline with which, the focus with which one may have done all the hard work. So my best wishes to all of you for this excellent initiative, and my good wishes, of course, to the Institute of Public Health for encouraging this kind of research culture. So all the best. Thank you.
Thank you very much, sir. That was a really very encouraging and re-emphasizing on the transdisciplinary or interdisciplinary science of research. And the two important messages that I again take it from your speech: a focused way of studying, and at the same time accepting the limitation and advancing our research. It's wonderful to have you again for this kind of program and having that motivation in front of us. Thank you so much on behalf of IPH and the organizing committee, and also from all the participants. Thank you so much, sir. Moving ahead with the next aspect of the inaugural function, I request Meena Putturaj, PhD scholar at the Institute of Public Health, Bengaluru, to deliver the concluding remarks of the inaugural function. Meena, over to you.
Thank you, Shivanand. On behalf of the Institute of Public Health, Bengaluru, I thank Dr. Ayyappan, the chairman of Karnataka Science and Technology Academy, Bengaluru. Though he is not here with us today, I would like to thank him for his support in organizing this workshop. A special thanks to Karnataka Science and Technology Academy for its enthusiasm and passion to cater to the needs of the early career researchers, such as the PhD students. Thank you, KSTA, for providing the financial support to organize this workshop. We are very grateful for that. Dear Professor Darshan Shankar, it is an immense pleasure for us that you joined our event and bestowed us by being the guest of honor. We are really inspired by your thoughts and your presence, sir. Dear Dr. Upendra, Dr. Pragati, Mr. Vamsi Krishna, Dr. Prashant N.S., as always, your involvement and interest is a great support to us. Thank you very much for that. A big thanks to Mr. Shivanand and Dr. Ketki for taking the huge responsibility of coordinating this workshop right from the beginning. Thank you, facilitators of various sessions. Your contribution to this workshop is commendable. We also remember and are thankful to all the efforts and the backstage work of the support team and the IT team at IPH. And dear participants, wishing you all a wonderful, enriching experience at the workshop. Good luck.
Thank you so much, Meena, for that concluding remarks. And we also thank you for your participation and encouragement to all of us being involved as a facilitator as well. So with that, we conclude the inaugural function. We will begin the formal sessions. I again thank guest of honor and director sir for being over here. And if you would like to be there for some more time, it is your wish. Otherwise, you can have your own time for other activities. Thank you, Darshan sir, and thank you, Pedro Kojani. So now we shall begin with our formal sessions. So in the agenda, we have the first session. So it's a time for all of us to again come to the mode of learning, and that is in the form of this workshop. So we shall begin the formal sessions now with one of the interesting way of introducing our topic being introduced in this workshop is the Pick Your PhD. I request Meena Putturaj, a PhD student studying implementation of patient rights in Karnataka. Her PhD is enrolled in Maastricht University, Netherlands. She is primarily a nurse by background. She has done MPH at the Institute of Tropical Medicine, Belgium. She has the experience of working in the area of health governance. She has kindly agreed to facilitate this session. And I request Meena to take over the session for the next 1.5 hours. Thank you.
Okay. A very good morning to all of you again. So, have you ever struggled as a researcher to communicate your research just in 3 minutes? It is quite a challenge, right? But here we have a bunch of doctoral students who have pulled up their sleeves to pitch their research projects to us. Welcome to Pitch Your PhD competition. To evaluate the pitches, we have 4 judges with us. So I welcome Dr. Aditya Pradyumna. He is a faculty member at the Azim Premji University at the School of Development, Bengaluru. He works in the broad areas of environmental health and public health. He is also a steering committee member of Pesticide Action Network India and an executive committee member of Sochara Bengaluru. Welcome, Dr. Aditya Pradyumna. A warm welcome to Mrs. Kranti Vyasaraju. Kranti has a background in life sciences and has an MSc in molecular biology and immunology from John Hopkins University, and MSc in medical biotechnology from the Manipal University. Welcome, Kranti. And I welcome Mr. Achyuta. He is a project officer at the Institute of Public Health, Bengaluru. He has vast experience in the field of policy advocacy for tobacco control in India. And we have very special guests as well. We have Dr. Janet, who is joining us as a judge for this session from Mexico. Welcome, Dr. Janet. Janet is a medical doctor. She holds a MSc in Health Policy and Systems Research. Currently, she works at the Medical Education Department for the Mexican Ministry of Health. Hello, Janet. She has experience in youth organization management, high-level political dialogue and advocacy for sexual health, reproductive rights, mental health, and youth participation. So we have a wonderful panel to evaluate the pictures. So I'll briefly introduce the format of the session. So the format of the session goes like this. We will play the pre-recorded video of the pictures of the contestants. Following each video presentation, the contestant will receive 1 question from the judges. The pitches will be evaluated on the basis of 3 criteria, that is content, clarity, and charisma. Audience can use the chat box to express your views and perspectives on the pitches, but please don't unmute the mics. So straight, we start the competition now. So the first pitch is from Mr. Chetan R.
Good morning, one and all. This is Chetan from Tumkuru. Today I am going to present on my PhD topic, that is prevalence of fluorosis and effects of fluorosis on pregnancy and pregnancy outcome. So to know about fluorosis, we should know what is all about fluorine and fluoride. Fluorine is electronegative element which is present on water, earth and soil. When fluorine is combined with other element, then it leads to a compound known as fluoride. Excessive intake of fluoride, that is more than the normal requirement, more than 1 ppm per liter of water. If we consume fluoride, then it leads to fluorosis. There are mainly 2 types of fluorosis, dental fluorosis and skeletal fluorosis. Dental fluorosis, which means there will be a yellowish and brownish horizontal discoloration on teeth, which is known as dental fluorosis. Skeletal fluorosis means there will be skeletal deformity. When we consume this fluoridated water for over a period of 5 years or 10 years, then a skeletal deformity will occur in our body, which is known as skeletal fluorosis. 5 years, then a skeletal deformity will occur in our body, which is known as skeletal fluorosis. So, I am going to study in my PhD topic whether this consumption of fluoridated water, whether it has any ill effect on pregnancy and pregnancy outcome. So my study objective is to know the knowledge of pregnant women about this fluoride and fluorosis. I want to know their dietary pattern as well as the prevalence of fluorosis among pregnant women in Tumkuru district, as well as what are the practices they are practicing to overcome this fluorosis at their level. So for this study, I have selected the study area will be fluoride endemic area, fluoride endemic taluk, as well as fluoride non-endemic taluk. I am going to select 2 taluks in our district, where the data will be collected from Rural Water Supply Department and the Water Supply Department of Jilla Panchayat, as well as the health related data in our government department, that is HMIS data. This study will be probability proportional sampling technique will be considered in this study. Then pregnant women's HB percentage, urine examination, and the water fluoride level, what they are drinking, what they are consuming, these levels, these examinations will be done at district fluorosis laboratory, and analysis can be done by SPSS software. This study will helpful to know the relationship between fluorosis and pregnancy, and may helpful to make strategies to overcome fluoride related complications in pregnancy. Thank you.
So that was Mr. Chetan. Judges, please note. And this is the time for asking question to Mr. Chetan. That one question to Chetan. Judges, please feel free to unmute yourself and ask the question.
Can I go first, Mia?
Yes, please, Kranti.
Thanks, Chetan. This is quite a new topic for me. I'm just wondering what is the knowledge about fluorosis among the medical professionals, whether it's the doctors or whether it's the ASHAs or ANMs. What is the familiarity with fluorosis?
Actually, being a health professional, which where I am working in health department only, we have already trained our medical professionals, as we told ma'am, ASHA workers and also health workers. We have been already trained them under this fluorosis, and before going to study, I'm going to train them once again by giving the tools or annexures what data exactly I need to collect from them. So after giving training only, I'm going to start the collection of data.
Thank you, Chetan, and thank you, Kranti, for asking that question. Next, we have the video picture of Mr. Ranjoy Gupta.
Few years back, on a festive occasion, I visited an old remote village located in mountainous valley of Jammu region. There I had a random conversation with an old man, which to this day I am extremely grateful, because that inspired a chain of reactions which resulted in my PhD. Hi, I am Ranjoy. I am a PhD student from Department of Social Work in Central University of Jammu. I am doing research on local knowledge of food and health in food system. Food is a source of health. Food is also a source of pleasure. Food can also be a source of illness. These are one of those remarkable significant words said by that old man to me few years back, which left a profound impact on me. As soon as I joined my PhD program, I started exploring existing literature on food and health by various disciplines. I found that a lot has been covered in terms of traditional food, their nutritive values and associated practices. I also found that the way local knowledge has been expressed is quite rudimentary to me. The terms used are taboos, perception, beliefs and myth. I found this as an untrue reflection of reality, so I took it upon myself to understand the situation in a local context. I visited few villages in Jammu region, and as a result, after subsequent discussion with villagers, I found that their knowledge is not simply a quantitative expression of food. Rather, it is a profound and a dynamic relationship with entire ecology and food system. This served as a foundation for my research. So I am doing this research on local knowledge of food and health in district Kathua of Jammu region. The uniqueness of district Kathua lies in terms of 3 agroecological zones. Its regional landscape varies from quite snowbound to dry land to fertile region. It is also rich in terms of medicinal plants, wild and cultivated domesticated crop diversity. I am using exploratory mixed method sequential research design, which includes 2 phases. The phase 1 includes discussion with traditional knowledge experts, some village elders. Out of phase 1, a particular framework would be developed on local knowledge of food and health. Based out of phase 1, I will lead to phase number 2, which purpose is based on to understand the contemporary utilization among the larger population group. So a pre-tested schedule will be used to understand its utilization among the youth. So this PhD would focus on 3 things. First, local knowledge of food and health. Second, it would give us contemporary utilization and associated factors. And third, it will help us to understand knowledge, food and development dynamics.
Thank you, Ranjoy, for pitching your project from a beautiful location. Now it's time for question. Judges, please take turns to ask questions.
Okay, should I go?
Yes, please.
Right. Very nice presentation. Thank you, Ranjoy. You made an interesting comment that the words that have often been used, such as taboo and perceptions, you find this inadequate. I was not able to fully understand why. Could you explain further?
Yes. Yeah. Am I audible?
Yes.
Yeah. So actually, I am primarily belong from a social sciences background. So we see the literature which revolve around the disciplines from anthropology. So a lot of stuff which has been done on first tribals and then on rural folk knowledge. So knowledge as in itself has not been discussed, but their habits, their practices, that has been represented first as taboos, second as myth, and mostly as their perception of something, which is not the reality, which I do not found as reality. But if you go to these rural areas, you discuss with people about what are their practices and how do they understand the relation between ecology and their health, how a change in minor agriculture practices, inclusion of urea in agriculture has changed their appetite, has what they have observed. So that is not, I found that is not perception, that is little beyond than that. That has to be studied.
Thank you.
Thank you, Ranjoy, and thank you, Dr. Aditya. It was nice. And next we have the video pitch of Mr. Sarin Enes.
Hello everyone, my name is Sarin and I am a doctoral student at the Institute of Public Health into the second year of my study, and I am married. By the way, why am I talking about my marriage? I'll let you know in a short while. How would you define marriage anyway? If you ask me from experience, I would say it's purely coexistence. Coexistence of differing values, ideals, perspectives, principles, perceptions, and so on. As complicated and as tricky as it may sound, there is also a way of navigation. I'm sure all of us who have gone through this experience understand that. But yes, there is a certain degree of preparation involved. There is a certain degree of flexibility and adaptability involved to make this a success. Preparation in many ways is like identifying an ideal partner for you, looking at your own background, your own milieu from where you arise, and the external environment around you, and who would be a good fit. And once that partner arrives into your life, you also then start looking at how best you can accommodate that partner and what is the space you can give, and how best you can forge a bond that exudes and provides happiness to both of yourself as well as the external environment around you. Why am I talking about marriage? It seems a little ridiculous. But I am forced to think of marriage when I keep thinking about my own PhD topic, which is regarding the mainstreaming of Ayush. Ever since this has been rolled out as a policy directive through the NRHM in 2005, you can see from published data that there is a lot of chaos happening on the ground. Many states in India have taken it up in different ways, and there is no clarity. There doesn't seem to be any standardization in terms of what needs to be done and who will be given what role. So you can see a lot of confusion and a lot of ambiguity prevailing. Despite all this, there are certain states which have taken certain stands that add meaningful value to the direction provided by mainstreaming. How have these states come to such decisions? Have they been motivated by the cultural legacy of Ayush systems that have been prevalent in their landscape? Or have there been other non-state actors who have sort of instigated this process to be taken forward? This is very interesting to me as a question, and this is what I try to delve into through my study on the mainstreaming of Ayurveda by taking a case study example of two different states, one in the southern part of India as well as one in the western part of India. Thank you.
Thank you, Sarin. That was very nice. And I request the judges to ask a question to Sarin. And Sarin is with us here today. And contestants, please switch on your video when you give your response. Yeah, question time for Sarin.
I would ask I would like to hear more about the objectives of his research.
Thank you, ma'am. The primary objectives of my study are to capture the journey that individual states in India have undertaken towards the policy objective of mainstreaming traditional systems of medicine in India, which are acronymed as Ayush. And what are the larger social, cultural, and political contexts that serve as a background for the state governments to have adopted or embraced such a pathway. So this is what I try to seek out through my study.
Thank you.
Thank you, Janet, and thank you, Sarin. Next, we straight move into the video pitch of Ms. Pooja Gaikaware. Judges, please note, this is Ms. Pooja Gaikaware.
Hi. Myself, Dr. Pooja Gaikaware, Tata Institute of Social Science, Mumbai. I would like to take your attention to non-communicable disease of diabetes, the complexity related to reproductive decision-making among diabetic women. We know a lot about reproductive health and the importance of preserving it, but the link between reproductive decision-making and the non-communicable diseases is rarely studied. There are quantitative studies and clinical trials which are there about the contraindications and indications of use of contraceptives among diabetic women. But this study focuses on the reproductive decision-making post-diagnosis of diabetes. In my MPhil dissertation, the woman expressed blame and self-doubt about the causation of diabetes. These findings helped me lay the foundation for my PhD, which will be focused on women. Among the most common complications of pregnancy, the diabetes counts one of the most complications, which increases the risk of pregnancy to the child as well as the mother. This influences the motherhood decisions for the woman as well as the family. A woman who does not desire for a child does not necessarily use the contraceptive, which proves that the intention are not always translated into behavior. There is lack of evidence about the predictors of psychological and social factors about the contraceptive use among women with diabetes. Hence, we would study the women's available information to the women and their preference for the contraceptives, their role in the decision-making process in different social contexts. We would translate the theory of planned behavior and study it through gender lens. The study will provide information related to contraception behavior among women with diabetes and factors influencing it. It will give a worldview with the diabetes women and their knowledge about contraception. For instance, where do they get information about contraceptives? What information do they have? Who dominates while choosing any contraceptive? And how is the decision made for using any contraceptive? or continuing the pregnancy, and so on. It will be a useful evidence about the peer influence and involvement of women in the decision-making process. It will give a fruitful evidence to build a culturally appropriate solution while handling diabetes mellitus, and it will be a policy level improvement evidence to focus on individual counseling for women with diabetes in the NCPDS program at national level. Thank you.
Thank you, Pooja, for your pitch. And now question time for Pooja.
Okay, can I?
Yes, please.
I just had one clarification or more like a question. What is the geographical area that you're looking at to work on this study?
Yeah, I will be conducting it in the government hospital of Navi Mumbai.
Okay. Okay.
So
great.
basically, I'm focusing on urban women. We are in Navi Mumbai, migration and people of various socioeconomic status reside. That is why I'm focusing on Navi Mumbai region.
Thank you both. Now we move on to the video pitch presentation of Ms. Meena Putturaj.
Hi, I am Meena Putturaj and I am a nurse. So when I read a newspaper, things like this gets my attention. Lack of access to healthcare for poor people. Medical ethics gone into the winds. 1,700 complaints on the private hospitals for overcharging. Doctors persuaded rural poor women to get their uterus removed. I was very much disturbed by reading all these media stories. So I was thinking of one promising idea that could attempt to redress all these issues, and that's how I landed up in the concept called patient rights. Patient rights are nothing but these are the rights that can be attributed to care-seeking individuals like you and me. So in a country like India, where the idea of patient rights is not very clearly defined in the policies, how it is understood and implemented on the ground, what kind of implementation arrangements are in place to protect patient rights? So with these questions in my mind, in the first year of my PhD, I critically examined the available literature on patient rights implementation, and I found that the implementation arrangements puts the care-seeking individuals at a very disadvantaged position when compared to the medical profession during the dispute resolution processes. In the second year of my PhD, I critically analyzed a case of patient rights violations that was widely covered in the media in the state of Karnataka. So using this case, we were able to demonstrate the power struggle between the dominant, powerful medical profession and the bureaucracy with the collectives of care-seeking individuals. So we were able to show that the processes and the outcomes of the grievance redressal is completely dominated by this medical profession and the bureaucracy, and justice was compromised for the care-seeking individuals. This idea of patient rights is a contested one. Yes, for example, you see, what needs to go into the list of patient rights, even that is debated a lot. So if this is the case, then how do we pull up a dialogue between the stakeholders on this contested idea called patient rights? So that is what I'm exploring currently. Friends, the first step in identifying a solution to the problem is to understand the problem clearly. And my PhD is doing that. It is really shedding a lot of light on the idea called patient rights, especially in the context of Karnataka. I think by doing so, we will definitely come up with practical recommendations to better implement patient rights in health facilities. Don't you think so? Thank you.
So I'm available there for the questions. So that was Meena Putturaj.
Okay, should I go?
Yes.
Okay, so you have already read quite a lot about patient rights, and you have been exploring the literature and speaking to people. So straight off the bat, let's go to the recommendation and say what do you think? What sort of rights should patient have? If you can briefly tell us.
Okay. So, as I said earlier, that is a very contested one. What needs to go into the list of patient rights? But as for the literature, as well as when I speak to the different stakeholders, the common rights that come up are right to information, right to dignity, and sometimes it is much broader, like right to access to healthcare. It is formulated as some kind of social right, patient rights. Sometimes it is viewed as consumer rights in the eyes of the stakeholders. So right to quality care. So such things are also can be included in the list of patient rights. And sometimes this idea of patient rights is seen as individual rights. From the individual point of view, it is also seen as collective rights. So it's a lot of there is no one meaning. It's a social concept and it's socially constructed, and there is different understanding among different stakeholders. So that's the challenge here. But I see the healthcare providers mainly focused on right to information, right to privacy, right to informed consent. Such things gain prominent in their eyes, whereas the care-seeking individuals, for them, what matters is right to access to healthcare. It's not just financial access, but access to quality healthcare. There is still no consensus on that, even in the literature. Thank you. Okay, I was lost for a moment. Thank you, Aditya, for the question. And next we have the video pitch of Ms. Priyanka Bandwall. Judges note, this is Ms. Priyanka Bandwall.
Good morning, everyone. My name is Priyanka. I'm a psychologist by profession, and I'm currently enrolled in Manipal Academy of Higher Education for my PhD. I plan to focus my research on tobacco control initiatives. Now, people ask me, why tobacco? I say, why not? India is one of the leading producer in consumer markets for tobacco. And yet, sadly, it is these very products that are currently being the biggest burden on the healthcare system in India. To say it point blank, there is no safe amounts of consuming this highly addictive substance. Retrospective studies have clearly established that exposure to smoking in childhood and adolescence is clearly and strongly associated with smoking patterns in adulthood. Recent data from GYTS, that is the Global Youth Tobacco Survey, has clearly stated that children are as young as 10 to 11 years when they try their first cigarette, hookah, or any other SLT product. Alarming, isn't it? Understanding the need of the hour, the government introduced the CODPA laws, that is, Cigarette and Other Tobacco Products Act, and the NTCP initiatives, that is, the National Tobacco Control Program. Now, what really got my attention is that how, despite existing provisions, there are still tobacco companies that are actively trying to persuade the youth to try their product. An impressive study called The Tiny Targets was done in 2018 across 20 cities in 6 states of India. Their conclusions were that 1. Despite the active provisions of CODPA and NTCP, the tobacco companies and vendors are still selling their products to students by making it more appealing, keeping it probably at the eye level of the child, or by selling it alongside sweets and candies, by not giving health warnings, etc. This shows that children are extremely sensitive and vulnerable population, and it is important to empower them with the skills to combat the current situation. Now, peer pressure is usually one of the reasons why kids start these products. The first hookah, the first cigarette is usually under the act like, try it, nothing will happen. My aim is to introduce an intervention that can help these students in effectively battling out these peer pressure and give them an opportunity for a healthy life. After all, a healthier youth is the backbone for any country's progress. Thank you.
Achita is already ready with question.
Yeah, because that's my field of work. So hi, Priyanka, good topic indeed, because that's what we've been working for the last 8 to 10 years now. But I think somewhere probably I lost something, but we didn't get the objective of this of your PhD. I mean, what kind, what is the what is it that you want to bring out?
Sir, so I am still in the initial phase since I joined very recently. I'm yet to register my topic. Tentatively, my idea is to develop an intervention that can help the students in managing the peer pressure that they face when it comes to being with the friends.
Okay, that's an interesting topic. Great, thank you so much.
Thank you, Priyanka, and thank you, Mr. Achyuta. Next, we straight move into the video pitch of Ms. Ketki Shah.
You must be aware that consumption of tobacco is harmful to health. But do you know that production of tobacco and tobacco product is also harmful to health of the workers? People working in the tobacco sector, especially those who handle tobacco directly, such as tobacco farmers or BD rollers, not only have to face the brunt of physical ailment arising out of handling tobacco directly, such as tobacco toxicity or breathing problem, but also have to face the brunt of exploitative practices in this industry, such as poor working condition and poor wages. You must be thinking that the solution is easy. Let's shift these workers to alternative non-tobacco livelihood. This would serve two purposes. First, you would protect the workers from occupational hazard. Second, you would also reduce the supply of tobacco, thereby aiding tobacco control. However, as easy as the solution it may sound, the problem is more complicated. Despite the exploitative nature of the work, there are 7 million people who are still employed in this industry. There are many factors that influence workers' decision to work in this industry. For example, for a home-based BD roller, rolling BD at home is safer and convenient alternative wherein she can manage both household as well as employment responsibility. The tobacco industry has a far reach. It captures remotest village, providing employment where other opportunities are very limited. Thirdly, entering into this industry requires minimum skill. So workers tend to seek employment in this industry. So, in order to promote alternative non-tobacco livelihood, it would be essential to understand why workers continue to work in this industry. Evidence capturing these factors is very limited. So, my thesis or my research aims to understand and uncover these dynamics and drivers of working into tobacco sector and identify factors that shape workers' decision. I plan to do this in 3 sequential phases. In the first phase, I plan to build a conceptual framework from the available literature. In the second phase, I plan to identify who the workers are and where they are based in Gujarat by mapping the supply chain of BD in Gujarat. And in the third stage, I plan to do primary qualitative interviews with former and current BD workers and understand from their perspective how they perceive their livelihood and how they experience or envisage shifting to alternative non-tobacco livelihood. I hope my research informs processes that guides workers into alternative safer livelihood and protects them from occupational hazard and livelihood loss. Thank you.
Thank you, Ketki, for your pitch. And now it's the question time for Ketki. Kanti, we can't hear you. It's very musical.
Yeah, Ketki, that was really. Is it any better now?
Yeah, much better.
Okay, I just wanted to ask Ketki what led her to be interested in this area.
Thanks, Kranti, for the question.
Ketki, you have to be a bit louder. We can't hear you.
Am I audible now?
No, still feeble.
Hello?
You are supposed to increase the volume, I guess.
It's at the max. Let me just try again.
Am I audible now?
Yeah, very clear, loud.
Yeah, so basically, what led me to this were a couple of things. First, while I was having a talk with my supervisor when I was selected for a pre-doc fellowship, there were a couple of topics he suggested, and this was one which I looked at into more detail, and I thought it would be a great topic for me on multiple purposes. First, it would make me go beyond my discipline of public health and take into aspect of labor and livelihood into consideration. Secondly, I can use this topic also to build on my qualitative research methodology, so which I am particularly interested in. So these were two main motivations for me to select this topic.
Thank you, Ketki.
Thank you, Ketki and Kranti. Next, we move on to the video pitch of Anika. I hope audience are enjoying the pitches. Now we have the pitch of Ms. Anika Juneja.
Hi everybody, my name is Anika Juneja and I'm a PhD fellow at the Institute of Public Health in Bangalore with the Health Equity Cluster. And for my PhD, my research question is how neighborhood disadvantage shapes access to healthcare for two Adivasi communities living in central and southern India. So my research question is mainly grounded within health inequities and social determinants of health. And I have tried to choose neighborhood disadvantage as a lens and as a concept to examine access to healthcare because I think that access to healthcare in the literature that I have seen till now is seen more from a lens of healthcare utilization and availability of resources within hospitals. But I am trying to locate it within a broader access to public services and how services are organized within a neighborhood, especially for vulnerable communities and marginalized communities like Adivasi communities in India. And try to look at that. So I'm trying to so neighborhood disadvantage is a Western concept and it has not been explored much within Indian literature. So I'll be conceptualizing it from a Western lens and then applying it to Indian tribal health literature on access to healthcare. So I will be doing this in 3 parts as part of my PhD. So the design is that first would be in 4 parts, sorry. So first would be critical interpretive synthesis of existing literature on access to healthcare within tribal health in India and applying a neighborhood disadvantage lens to it. Then I will be getting some stakeholder perspectives from these particular 2 sites. One is the Bega community within central India in eastern Madhya Pradesh and Chhattisgarh, and second is the Solega community in Chamarajnagar district in southern India, and get site-specific insights on neighborhood disadvantage and access to healthcare from stakeholders there, such as the government, the forest department, civil society, NGOs, etc. Then this will be followed by case studies of people who are living with sickle cell disease from these communities to get in their lived experience with respect to living with the disease and accessing healthcare for that. And I've chosen sickle cell disease since it is common in both the communities. And then the 4th part would be applying a gender lens to the data which comes from case studies to see if there are differences between genders in terms of accessing healthcare and how it plays out with neighborhood disadvantage. Thank you.
Thank you, Juneja. Any questions for Juneja?
I could go.
Yes, please, Aditya.
Janet, please go ahead.
No, it's fine if you wanna ask. I forgot my question. I'm sorry.
Okay, maybe I'll come in then. So Thanks for your presentation. I see you're sitting in the same place where you did your recording. Is that right?
Yeah.
I see, from what I understand, we already know that these communities are disadvantaged in access to healthcare. So what is it new that you are bringing to this particular study?
Okay, thank you for that question. So I think the lens of neighborhood disadvantage that I'm talking about and that I'm trying to conceptualize as part of this PhD and then apply it to lived experience and to stakeholder perspectives, that is a new lens which I think will be something new to look access to healthcare from, because currently how access to healthcare is looked at is more in terms of availability of hospital resources or staff, HR, and a physical distance or physical remoteness. But I think neighborhood disadvantage is more of a structural lens, especially for Adivasi communities in India. So I'm trying to look at access to healthcare from that lens. So I think that will be a new aspect to it.
Very nice to hear, Anika, and thank you, Aditya, for the question.
Yeah, thank you.
Maybe if Janet remembers her question, she could ask it now.
Yes, please, Janet.
Yeah. My question is that why not to focus more on the patient's perspective or patient's journey than the stakeholders analysis? My question is because I studied something like this, but it was about mental health, and the science has studied pretty well how the health systems live or how we conceptualize healthcare barriers, but there are few research about the user's perspective, of the patient's perspective. So that's why I would like to know, why did you decide to focus more on stakeholders and the health system perspective than the user's perspective?
Yeah, thank you for that question. So yes, in fact, the stakeholder perspectives and literature will be the first part of the PhD. But in the second part, I will be talking to people living with a particular disease, in my case, sickle cell disease, people from tribal communities, and bring in their experiences and try to fit those experiences within the literature that I have studied. So yes, that is an important part of my study. I'll be doing it as well.
Thank you, Janet, and thank you. Okay, so I see there are some questions in the chat box also. The contestants, please take note of it, and you can respond to them in the chat box only. In the interest of time, we move on to the next pitch of Mr. Shivanand.
Very good morning to all. My grandmother once told me that she uses nagadari, dodipatre, tulsi, ginger, garlic, etc. to treat minor health conditions like fever, cough, cold, etc. She feels that it is not necessary to go to hospital for these kind of conditions. She mentions that we should use at least 2 to 3 days. If at all the conditions are not curable, then we can go to hospital. My dear friends, more than 80% of such families in low and middle income countries use traditional medicine, and that contributes immensely to primary healthcare conditions. The underlying philosophy of traditional medicine approach is self-reliance because of its emphasis on culture, traditions, customs, etc., and also the localization. Self-reliance in a simple language could be understood as the responsible behavior and the ability of an individual to take care of one's own health using his own resources. In the context of health policy and systems research, this concept is used in a wider context with a limited understanding. I found a very limited information about the self-reliance in literature. Terms like self-care, self-efficacy, self-management are used interchangeably in the health literature, creating ambiguity and vague uses of these terms in health policy context. Hence, my interest rose in unpacking this concept in my PhD in relation to traditional medicine and primary health care. Therefore, I visited an organization called Foundation for Revitalization of Local Health Traditions in India. This is an NGO which had documented traditional medicine practices in SD Kote, in Mysore district in Karnataka, and in Alva Taluk in Kerala. So I decided to purposefully select these two study sites in order to investigate the phenomena of self-reliance using case study method. My study will come out with the framework that locate the factors influencing the practice of traditional medicine and how could these factors also enable the self-reliance in the context of primary health care. We all know that health is viewed as a social goal in the context of health policy and system research. Therefore, my analysis will also produce a report on integrative approaches that will help in designing the policies and programs in relation to traditional medicine and primary health care. And I believe that my study is highly relevant to the current context as well because there is a larger emphasis on responsible behavior in situations like COVID-19 as well. Thank you so much.
So judges, please note that was Mr. Shivanand, and Shivanand is here with us for your questions.
He's also the operator.
Okay. Any questions for Shivanand? Okay, I think we have a question from the audience this time for Shivanand. I saw Pragati raising your hand. Pragati, would you like to unmute yourself and ask question?
Sorry, I think that was a mistake. I hadn't intended to raise my hand.
No questions for Shivanand?
No, not at this point.
Okay. Anybody from the audience would like to ask a question to Shivanand?
I think Kranti has.
Meena?
Yes, Kranti, we missed you. Please go ahead.
Yeah, sorry, I'm unable to turn on my video. But very nice pitch, Shivanand, very relatable, I feel. I wanted to ask you, what do you think is the self-reliance of today's generation? Have you had any conversations like the one you've had with your grandmother? And just what do you feel about today's generation?
Yeah, one of the objective of my study is to explore that kind of the gap between the generation that you are mentioning. So there is always a tendency that when I narrate to the younger generation, they try to identify the loopholes that the earlier system had, and now they want to enjoy with their life. But when I ask the same question to my grandmother, they relate in terms of their enhanced physical activity, they consuming the food which is being grown in their own field, and that's how they were able to live for longer than what the current generation is living. So there's a lot of ambiguity surrounding about this, and also this is also the fact because we have not taught people what is exactly that self-reliance means. Most often the literature also speak self-reliance in the resource-intensive purpose. I mean, the moment they earn a certain amount of money and financial incentives, they feel that they're self-reliant, but that is not the case, which is very narrow understanding of the concept self-reliance, because there are so many factors that involves in terms of going at the agency level to get the culture, traditions, localization. So all those factors are also involved, which are not being spoken so much in the context of self-reliance that they currently. So if I answer to your question, there's a vague understanding, and it is very highly individualistic as well. But there is need to define in a comprehensive way so that people understand it in a more better way. Is what I would like to answer to your question. Thank you.
Thank you, Shivanand.
Okay. Thank you. Thank you, Kranti. Kranti, and thank you, Shivanand. So we have the last pitch, but before that, I see the chat box is quite active with comments, feedback, and questions, which means you are inspiring each other with your thoughts. That's amazing. And that's the very purpose of having this competition. And now the last pitch of the day, Miss Fatima Khazi. Judges, please note, this is Miss Fatima.
Breast cancer is the leading cancer among Indian women. More than 2 lakh new breast cancer cases were reported in 2020 by Globocan. Breast cancer accounts to 24.5% of all cancers among women. 1 among 24 women is at a risk of developing breast cancer in her lifetime. Early detection is essential for its treatment and management. Due to fear, ignorance, stigma, and delay in clinical diagnosis, most of the women are diagnosed at stage 3 or 4, which requires surgery or extensive treatment. I am Dr. Fatima Khazi, research scholar, JNMC, Belgavi. Let me share with you the plight of breast cancer patients in India. Let's say Priya, she's a middle-aged woman and she is diagnosed with aggressive form of stage 3 breast cancer and she has to start a treatment immediately. There is no time to apply for her available schemes and the family has to go through the burden of extra expenses. As the treatment progresses, she is susceptible to the treatment-related side effects along with the social embarrassment and stigma due to hair loss. And then the socialization decreases, there is family life is disrupted and she feels she is a burden to the family. All these physical, social and emotional factors are, they decrease her quality of life. Quality of life is further declined if she has comorbidities or if she has no emotional support and she is financially weak. So an in-depth understanding and exploration of the socio-demographic and clinical factors which affect the quality of life of breast cancer patients is the need of the hour. This is the gap my study is going to address. A convergent parallel mixed method design will be used. Both qualitative and quantitative data will be collected. Quantitative data will be collected through standardized questionnaires and qualitative data through in-depth interviews. Both the data will be collected in parallel and they will be analyzed separately and they will be merged to have a greater insight to understand the factors which affect the quality of life of breast cancer patients. EORTC, QLQ 30 and BR 23 are standardized and validated questionnaires which provide accurate assessments of the well-being and functionality of breast cancer patients. Utilizing these questionnaires by the physician will help to make psychosocial interventions and optimal treatments. Our study is expected to develop a holistic approach at breast cancer treatment. Thank you for your attention.
Thank you, Fatima. Any questions?
I could ask one.
Yes, please, Aditya.
Sure. Thank you for your presentation, Dr. Fatima. Just wanted to ask you, it seems like the focus of your study is on individual women and the quality of their life and the psychosocial support and rehabilitation in the context of the care that they're receiving as individuals. What is the public health implications of your thesis, if any?
Unmute yourself, Fatima. Your mic is muted.
I am looking at a breast cancer patient through a holistic approach, like all the factors, all the socio-demographic factors as well, because I presented to you a story, a plight of those women. Those women, when they come there, they are at the stage, like because of the delay, they're at a stage where they have to be started with the treatment immediately, because I have done half of my data collection. So they say that even though they have BPL cards, they cannot avail those schemes because the doctor says we need to perform the surgery immediately, like tomorrow. So for that, they need some paperwork. which takes 2 to 3 days. So that is a burden. And then being a woman, she has so many responsibilities, and then she is not able to take that. So I'm looking at all the socio-demographic factors. Along with that, I understand that there is no patient-doctor communication, and the doctor focuses only on the clinical part. So if these standardized questionnaires, if they are made a part of the clinical examination, and if the doctor goes through that, he will be knowing exactly what are the things that are affecting the patient, and that would be like he will know more about their well-being, their functionality. And sometimes if the patient is going through any psychological or distress or something, we could raise a flag, and what I want to implicate through my study is that there should be a social worker and a psychologist in the team of this, in the oncological team, to make it complete.
Thank you.
Ask one question.
I see somebody has question.
Yeah, ma'am,
Yeah.
what is there any particular mental health component that you're looking for, like in the
Pardon me?
Is there any particular mental health component that you're looking into in these questionnaires?
Major?
Mental health component. Is there any?
Mental health, no. Mental health component is just, are you stressed? Are you worried? Do you feel depressed? These are the questions. And there is a scale from 1 to 4 where she says that is the psychosocial, that is the only thing that is present there. Do you worry about your future? And all those things. Other than that, we have a specific questionnaire for only breast cancer patients, and QLQ 30, that is a generic for all cancer patients.
All right, thank you, ma'am.
Yeah. Thank you, Priyanka. Any questions from the judges? I think it's done. Yeah. So we had altogether 10 pitches. That was very amazing. And congratulations to all the contestants for your enthusiastic participation. A big round of applause for all of you. Winning is not important, but what is commendable is that the effort you put in, the energy you invested in crystallizing your thoughts and preparing for these pitches is really amazing. And thank you, judges, for patiently evaluating the pitches. We still have 7 minutes, so we'll make the best use of the time. I request the judges who have been watching the video pitches to give some tips for the participants on preparing these pitches, not just your PhD ideas, but also even a general project idea. How to effectively communicate science. Any tips on that? Yes, Prati.
First, so that I don't, none of my points are stolen. So for me, I think what really stood out from, so I'm not going to comment on what I saw, but I think in general, I guess when I'm listening, what I'm really looking for or enthused by is body language. I think that is first thing, right? So you should look like you're interested and you care about what you're doing. There's a good reason why you're doing it, and being able to project, first of all, give some background to why this is a problem, whatever it is, because most people don't even know, whatever you're studying is a problem. So I think just introducing with some relatability, not like with throwing a lot of jargon, which I think most of you did wonderfully in terms of keeping the language simple. And secondly, when you end, I think being able to project, like, why is this even important? Why are you spending 5 or 6 years of your precious life on studying something so deeply? So I think I'll stop there. I have a lot to say, but I will stop there.
Yes. Yeah. Thank you, Kranti. So maybe you can put your tips in the chat box. Still we have time. Aditya, Janet. Aditya, yes.
Yeah, firstly, I congratulate all of the participants for participating, because maybe I'm just speaking from my own perspective, but researchers are sometimes, they hold themselves back. If this is not like a typical sort of a scientific presentation, there is some fear about doing things a little informally. and there may be some hesitation in speaking to broader audiences. So I think breaking this shell is definitely very important. And public health is a field where you take up political issues. Health is a very political issue, and inevitably, as public health researchers and practitioners, you will have to take public stances. You will have to take the public stage to give clear messages on what is right from a public health perspective. And I think the more of these sorts of opportunities that you take up is beneficial. I can be very frank, I did not participate in these kinds of contests, for example, when I was doing a PhD, and there was something holding me back. And the more I've seen, I feel that it was very important that PhD students and even master students should improve their communication skills, not just to one type of audience, but to multiple audiences. And doing it clearly and succinctly with interest is, I think, an important skill. It's not something that everybody is born with, but it is something that can be learned, and you must invest time to learn this. And I think you have more and more such workshops and short courses being offered in communicating scientific research. I think it's worthwhile taking these up, and do participate in these sorts of opportunities so that you can become more and more confident as you go along. Well done, everyone. Thank you for participating.
Thank you, Aditya, for those tips. Janet?
Okay, I will add, I agree with Kranti and Aditya, and I will add like that. I think it's important to highlight why are you doing this research. I mean, like, how are you gonna change the reality with this new knowledge? Not only it's nice to talk about the problem and why you are interested on, but I think we have in the last years we have overstudied some phenomena. So it's important to be very clear about why this is important to change the reality. For example, I will do this thing because I want to change the law, that is because this law is unequal or something. So I think all of you will be, you will improve your pitch if you add this component. And that's it. Congratulations to all of you.
Thank you, Janet. Thank you for those tips. And Achita, you have any tips?
Almost kind of a summary of all what all the three people have said. My just a kind of a tip or a concern is this should not, I mean, all your PhD work should not just stay in your in papers. It should really materialize. Whatever recommendations you do, whatever the studies you have done, should really come into society, and I believe they should bring about some changes in the field, whatever the study you have done. So that's the tip or suggestion
Yeah. Thank you, Achita. We are in time. Thank you very much for sharing all your insights and thoughts with us. This is definitely helpful. I think this is an amazing way to start the workshop with power-packed pictures of the participants. Thank you again to all of you. We will announce the winners of the competition tomorrow. So till then, stay tuned. Thank you one and all.
Thank you. So should we leave now, Meena?
Yes, is Aditya? Thank you.
Should we leave now? Leave the meeting?
Yes, feel free to join for the rest of the session. No problem for us.
Good luck with the workshop.
Thank you so much.
Thank you.
Yeah. Thank you, Janet, for joining us from Mexico.
Thank you, Janet, and thank you, Kranti. If you wish to be there, you can feel free to be there. Yeah, thank you, Meena, for that. Was a wonderful, innovative way of competing, and I'm sure all the participants who have participated had put a lot of effort in making this, and we were worried really at the 11th hour we were not getting any videos whether the participants are going to participate or not. But at the 4:30 exactly on 18th, we start getting messages and we start getting uploaded videos, and that was wonderful motivation to all of us. And so this is quite an formal way of introducing the participants. I request all of you to turn on your video if that is fine with you, and take a group photo of our own. I request our IT team to take the snapshot and make it look good. And for those who have not participated in the competition, we have a very interesting way of understanding their topic as well. I meanwhile hand over the floor to Katie. She has some interesting way of asking you to come with an idea of introducing yourself and the topic of your PhD as well. So I request the IT team to meanwhile have more than one snapshot, so as many as possible, in order to cover every moment, and including you also turn on your own video and be a part of this group and take a pictures. Yeah, very nice to see you. I'm missing all your presence in the office. We tried hard till the end to make it in person, but situation could not allow us to be there. Yeah. Kiki, over to you for the rest of the session.
Thanks, Shivan. Am I audible?
Yeah, perfect.
So should we take a break for 10 minutes and then rejoin at 11:10 to continue the session?
11:10 you suggest?
Yeah, we'll take a break from 11 to 11:10.
Okay.
Let people grab their tea, coffee, water.
Yeah, just to stretch your legs.
And yeah.
And we'll definitely have some innovative way of understanding this topic as well. So we'll meet in 10 minutes exactly. Please speak.
The session is concluded.
Thank you.
Okay, bye. I mean, see you.
See you. Hi, Shivanan. Can you confirm if I'm audible?
You're audible, Ketki.
Yeah. Thanks. Okay, so since most of us are here, let's begin a small session. What I'm going to do is I'll just ask you a few questions. You can type in your response in the chat box. Randomly we'll pick one response and the person has to unmute and explain in detail what they mean by that. So I hope the rules are clear. So let's start. The first question is, can you just describe yourself in one word? You can type in your response in the chat box. Describe yourself in one word.
Yeah, you can type that word in the chat box, and Katie will randomly pick it and call you through. And once it has been called, you turn on your video and introduce.
Thank you, Priyanka and Smita. Come on, people, type in. Yeah, Pragati, the question is to describe yourself in one word. Come on, everyone, just type in. Okay, thank you everyone for your response. Let me just call in Smita to see what she means by hope.
Actually, I need to write it hopeful rather than hope. But yeah, hope means like hope for but like there are so many things happening around us. Hello, I'm audible?
Yes, you're audible, Smita.
Yeah.
If possible, you can turn on the video also.
Okay. Yeah. So I mean, hopeful is for because there are so many negative things recently happening around us, and we are always looking for a problem. And like being a PhD fellow, I'm still searching my research question, and I hope I'm going to find it soon. So in that sense, it's like hopeful for any step, like take a step one step at a time kind of hopeful.
Thank you. Thanks, Meeta, for that explanation. And yeah, we all should be really hopeful for a better future. Thank you all for your wonderful answers in the chat box. I see quite some interesting answers. Priyanka, do you want to come in by what do you mean by effervescent?
Hi, I'm Ned. Yeah, hi. Effervescent means very lively, very joyful. My friends and family members always say that I bring in the life whenever there's some conversation happening or some event going on. So I think that's one of the first words that people also associate, and I also think about it.
Thanks for your answer. You did indeed add your effervescence to the PhD pitch also today.
Thanks.
So, okay, moving on to the next question. I would like everyone to describe their PhD or their aspiring PhD topic in one word. You can type in your answer in the chat box.
Ketki, that's difficult. Yeah, full research question and proposal in one word.
Just one word which comes to your mind immediately when you think about your research question.
It's more difficult than the pitch. Holistic, okay.
Great. I see a lot of points in the chat box. Aishwarya, do you want to come in and explain what you mean by confusion?
Thanks, Ketki. Yeah, confusion, by that I mean that I still don't know what I'm doing. So in essence, I'm still confused about what my PhD is or what exactly my research question is. So in that sense, it's a confusion.
Thanks, Aishwarya. I think that's a everlasting problem with the PhD, I guess.
Yeah.
Thank you. Okay. Praveen, do you want to come in and say what do you mean by intersectorality?
My research is actually, I don't have a research question yet, but I'm just trying to frame few research questions in the space of intersectorality. I have been working in UNICEF in Northeast since last nearly 3 to 4 years, where I'm trying to understand a lot of government programs which are being implemented, especially in the nutrition area, requires support from different sectors. See, for instance, when I speak of under 5 children nutrition, it is not only the health department's issue. It's also the social welfare department comes in, then education department comes in, and a lot of different sectors do come in. And then to implement properly any nutrition program in poor performing states like Assam and other northeastern states, it requires a lot of support from other sectors. Whenever there is a support, then only program implements properly. So whenever there is no support, we don't tend to see the great outcome. So my research area is in that how these different sectors collaborate each other to bring in some shared goal of reducing malnutrition in Assam. So that's where I'm trying to understand. That's why my broader one word, if I want to describe in my PhD, which is difficult, but I would say that it's an intersectorality. Thank you.
Thanks, Praveen. I think it's important to look at the topic from different point of view. Okay, so moving on to the next question. Since this is a virtual workshop, and I guess most of us are based in different cities, so I would like all of you to describe the place where you are based in one word. Thanks. I guess Smita and Anika have the same answer, that their place is very chilly. I hope that's somewhere in North India.
Yes, I am in Delhi, and I think Smita is in Haryana. So it's
Rewari,
very
yes.
cold. Yeah.
Rewari, Haryana. It's more colder than Delhi.
Yeah. Angel, do you want to come in where you are based in?
Yeah, I'm in Bangalore, the garden city of India.
Nice, Angel. Pragati, do you want to talk about what do you mean by perfect city?
So yeah, weather-wise, and every-wise, I think, and especially for me personally, also being safe and sound at home, and so it's perfect that way. Yeah.
Yeah, home is the perfect place, I feel. Home city. Lena, do you want to come in and say where you are based in? I see a very nice answer.
Yeah, even I was wondering, are you on the beach? If you can show us.
No, not at the moment, but I'm based in Goa.
Oh, wow.
And beach is very close from where I stay and from my office. So yeah, every evening it's sunset at the beach.
That's a great place to be in, near the beach.
Yeah.
Praveen, yeah, Guwahati is actually one of my dream place to visit once.
Please do come. Who wants to come and go? I'm ready to host all of you guys here.
Yeah. Shriyuta, do you want to come in?
Oh yeah, I'm based in Gadchiroli, and I think it's really serene, regardless of what the media says. It's really peaceful and serene.
Thanks. By any chance, are you based at Surge in Gadchiroli?
Yeah, I'm working at Search.
Thanks.
That's so great, Shriyuta. Sorry, Kirti, I'm interrupting, but
No,
there are
please,
so many
please.
memories I have.
Please do
from
interrupt. I
Gadchiroli
think
Search.
no, I think this is this is the session which we thought we would like participants to come to know each other, and please feel to come in wherever you want to. So yeah, thank you all for participating in this. Just one last question, and then we can close the session and move on to the next one. So the one I would just one word to describe your workstation or your work table right now. And if possible, you can just share your workspace through video. Risky. Yes, Shivanand, this is a risky place to be in right now, considering the situation. I see there are many answers which says that the table is messy, mine is messy as well. So Lena, can you just show us your colorful table?
Yeah, it's messy, but I'll still try. This is my workstation right now.
Yeah, a lot of colorful pens, I see. Thanks, Lena. I think minimal is the way to go forward, Aishwarya. Shivanand, do you want to come and say what do you mean by disaster management?
You could see the n number of 11 laptop and already on their screen, and there is one facilitation, and the mobile also are getting messages from all participants. So n number of things I'm just managing, and sometimes Meena is tapping me like, what are they doing? I'm asking
Come to
many
reality.
questions. Come to reality.
It's lost. What next?
So that is the way I'm managing things. So I felt disaster management is what I'm meant for.
Yeah, I think not a very great place to be at right now. But otherwise,
perfectly. I'm enjoying it.
Okay, so thank you all for participating in this, and hope you came to know each other a little bit more. Like in person, it would have been a different experience, but we thought virtually. Let's start with a bit of networking. So I hand over the session to Shivanan to take forward.
Okay. Thanks, Ketki, for that innovative way of introducing. And we have left anyone in the group. If we have left by mistake, Vaibhav, I guess, in my immediate mind, could you come and introduce yourself to the panel, and then we can move to the next session.
Yes, Shivanand. I'm very sorry. I won't be able to switch on my video. I'm using mobile data. Yeah. So hello everyone. Very nice to be part of this workshop as an observer. I'm Vaibhav. I've worked with IPH, faculty and team lead. I've been part of IPH for more than 2 years now. Yeah, that's me. Thank you.
Okay. So anyone we have missed in the list?
I think Yogesh has raised his hand. Yogesh,
Yogesh,
please come in.
Please come in, Yogesh.
Yeah, sorry, I think I have missed the introduction. I was in a bit away from the. Yeah, I'm Yogesh. I work as a team lead in Healthy Tea Cluster with the Institute of Public Health. I'm associated with IPH almost for 4 years.
Yeah, thanks a lot, Yogesh. So I hope we have covered everyone over here, and they got an opportunity to speak about their work and themselves. So thanks very much to Meena and Kitki for that kickstarting this workshop. And we will move on to the next session of the workshop. That is the learning from the experience. No university can teach us as much as an experience teaches. It's always best to listen to the experience of expertise to learn in quick time. So here is a session that brings you the vast experience of PhD holders. To facilitate this session, I invite Dr. Pragati Hebbar, PhD scholar, Assistant Director, Admin, IPH, Bangalore. To say about Dr. Pragati Hebbar, she is a dentist and is currently pursuing a PhD in Health Systems Research at Maastricht University, Netherlands. She is also DBT Wellcome Trust India Alliance Early Career Fellow. She aims to understand the implementation of tobacco control policy interventions in India in her PhD. She also co-leads the chronic conditions and public policies clusters at IPH, and she is also the president of the Gender Issues and Sexual Harassment Committee at IPH. And she is also the Assistant Director of Administration at Institute of Public Health, Bangalore. So with that, I invite Dr. Pragati to facilitate the session and lead us into the session. Thank you so much. Over to you, Pragati.
Hi, Shivanand. Hi, everyone. Great to be here virtually, at least. So I think what has been quite an energy-packed and interactive session so far. As Shivanand said, we'd like to now hear mainly from people the experience of having gone through this journey of PhD. And for this, we had reached out to 2 experts, and I think it was really nice that both of them have made themselves available to join us. So the first part of the session, we would like to listen to their journeys. And in the second part of the session, we'll break into small groups of 3 to 4 members and do some group activity. So to start with, I'd like to welcome both Karishma and Rahul to our session. And to start with, I'd just give a very brief introduction of Dr. Karishma Kaushik, whom I actually got introduced through Twitter because being a woman in science and, the very interesting work that she's been doing the several public outreach things like the Talk to a Scientist series, and it's very inspiring. So I think that's how I got in touch with her. Although this was more like a public health PhD workshop, I thought that the life skills, the skill sets required to complete any PhD, there would definitely be overlaps, and we'd gain a lot from her journey. So I would like to invite you to share your journey with us, and following this, we'll be inviting Rahul. Thank you so much, Karishma. Would you like to share the slides, or
Perfect.
Ketki?
Perfect.
Okay.
I can share. Perfect.
Okay. Great.
Yes.
Thank you.
I hope you can see them now. Just
Yes.
give me. Yes. Perfect. So that was a very, very, very nice introduction, Pragati. Thank you so much. It's really nice that we can introduce each other in a informal way as to how we met, and everyone knows that we're doing science, and everyone can look that up and know what we're doing. All right. So good morning, everyone. Great to see you all. I'm trying to see everyone. I can at least read the names, but great to see you all. In another time, another age, it might have been in person, but we will hope that happens. So I have been given, I think, 10, 15 minutes, and I promise you my session is going to be full of pictures with lots of, I hope, informal interaction and discussion, and I can share my journey with you. So I'm Karishma. I'm currently based at Savitribai Phule, Pune University, which is my background. And I actually started out as a medical doctor. And so how did I land up leading a research group at a state university? So let's talk about a large part of my PhD journey, which will be relevant to you all, and career journey in general. Okay, so you can look me up. That's our lab, and we're very active on Twitter. So let's zoom back. I won't tell you how many years because I don't want to date myself. I don't want to think of me like some dinosaur. But how did even biology happen? If we go back to that, I was actually till my 10th standard in Mumbai, I was thinking of engineering. I don't know what it was. I was thinking of engineering, and I was really looking to take PCM, that is, physics, chemistry, mathematics. I think it may be similar in other state boards as well. And then I don't know what happened. I got really poor grades on a history exam, which ended up making me, which lowered my overall grade in my 12th, I believe it was in my 10th. Yes, it lowered my overall grade. And that meant to get into a good junior college, I had to take biology. So I wanted to focus only on 3 subjects. I ended up having to focus on 4, but it was really a blunder maybe that made me take biology in the first place. Who knows what would have happened if I had dropped it after my 10th standard. So then I did my junior college at a pretty good institute in Mumbai. And it was 3 months before the medical entrance, which happened in March that year, that I was fascinated by biology illustrations in the biology coursework. As you can see, I had pushed it right up till the end, saying I'll focus on biology just to get enough to pass. And then as I started looking at the illustrations, I was absolutely fascinated. And 3 months before the medical entrance, Maharashtra State medical entrance, I told my mother, who is also a physician, that I think I'm going to do MBBS. I'm going to try for the entrance. And I don't know what I unleashed on her, because she was looking back. She doesn't even want to think of those times. She says, I can't imagine people study for years for the medical entrance. And here 3 months before you were saying, go get the medical entrance forms. Let's see what happens. Anyway, the stakes were low because it was only 3 months preparation time, but it worked. So that was the first year that Maharashtra rolled out a medical entrance. So much of our fortunes, our destinies, our career paths are just dictated by administrative changes that we have no hand in. Till then, it was 12 standard marks for medical entrance. That year, Maharashtra introduced an entrance exam for medical entrance. So I gave the entrance exam. And then I got a pretty good rank. Which could have got me a certain option of medical colleges in Maharashtra. So maybe not the top government colleges in Mumbai. I was not going to get that. But I was possibly going to get a medical college in Karad, which was a well-known college. But I decided against it because, I said the food in Karad is too spicy. I can't stay in the hostel with that spicy food for 5.5 years. The other option was Pravra, where actually Rahul Shide, who's going to speak next, is working. And I was 18 at that time. So please be kind on me. I said of Pravra, it's middle of nowhere. It's going to destroy my social life. Having said that, 20 years down the line, trust me, my decision-making parameters have improved. Nevertheless, I chose a private college in Pune, also because I knew my parents were going to shift from Mumbai to Pune. So the point here is a lot of our decisions are dictated by our family situation. We want to be close to home, and it's all right when we are young to be making these calls. And it was really that made me say no to other medical colleges that were more established than the one in Pune. But nevertheless, I took it. It turned out to be a very good decision because I really did enjoy the security of being able to do such a demanding professional course at home. So I finished my medical degree in 2004. And what I think happened overall is it was a young medical college. They were growing and they were very involved in reaching out to the community. They wanted to establish themselves in this little suburb of Pune. And so it gave me a chance to get involved in a range of activities, such as conduct a talk show with BBC for HIV/AIDS awareness in that Pimpri-Chinchwad Municipal Corporation, conduct pulse polio vaccines for a couple of years on behalf of the medical college. I also did well academically, and it was recognized with state awards and things like that. So all in all, life is a mixed bag, and all our decisions are as well. So if you look at wanting to be close to home, but a private young medical college, it all worked out. I got a range of opportunities, and I got to spend some extra years with my parents that I would have otherwise had to leave. So it all worked out very well. In 2004, after I finished medical college, I transferred to do an internship in a government hospital because this is what we all wanted at that time. Wanted clinical experience, hands-on. And it was, well, to me, it was an understatement to say there was clinical experience. I mean, there was no time to think when you're working in a government setup like that. It gave me the breadth of experience from, parasitic infections and infestations, cholera outbreaks, which happened when we were posted to work at this rural health center in Alandi, where you have a lot of pilgrims coming. So what possibly a private college couldn't give possibly enough clinical experience, I got all of that in the 1 year that I worked at this government plus primary health center at Alandi, which is on the outskirts of Pune. Also rotations through surgical wards, gynecological wards. What all of that told me at the end of 1 year, it was really hard to chew, but it did tell me that I don't think I was cut out for clinical medicine. And it was just that I didn't feel very satisfied. I didn't feel very excited putting those long hours. And it was quite repetitive also. If you think of a surgical residency or a gynecological residency. So at least that was my personal reading of the situation. And at that time, I decided to give the medical entrance for MD entrance, the residency entrance exam. So again, I applied all over India, and these were the options that I had. So, this is a joke that I always say to young people when we have to write for PhD entrance exams to Europe and especially United States. They ask us, what made you want to do this subject? What was it? And sometimes in our country, when you have thousands of people applying for hundreds of seats, it's pretty much like, I did it because I got it. I mean, let's be honest about it, right? I don't know if it was my burning passion, but I got it. And the seat crunch that we deal with, sometimes we just have to make practical choices. So these were the choices I had. The CMC Vellore gave me a pathology, but it said it had to be a 4-year degree. And AFMC Pune gave me an MD, opening an MD clinical microbiology, which was a 3-year degree. I would be a civilian in the Armed Forces Medical College. Again, while MD microbiology was not very high on my choice list, it was Pune. It was a premier institute in India, and I decided to take it up. So I went in for the MD in clinical microbiology at Armed Forces Medical College, Pune. Again, I wouldn't say the decisions were very clear-cut that I want MD microbiology or I want to be working in an army institute. But all in all, it worked out in the end. And I think that is a brilliant part of looking back on your career journey. So it was a top-class institute, and it is AFMC Pune. They were also at that time pushing towards, they were one of the few medical colleges that had reasonable funds for research and often sponsored by DRDO and other organizations. So I landed up in the right place at the right time. When they told me for my MD thesis, I had to take up a project which was being funded by the Armed Forces Research Organization. So they had noticed outbreaks of chickenpox, also called varicella zoster. The virus is varicella zoster, amongst young adult men, soldiers, who were living in barracks and serving in the Indian Army. And there was a mixture of history of vaccination. Some were not vaccinated, but chickenpox is typically a pediatric infection. It's a childhood infection. So it was possibly the overcrowding, the closed living, that was causing outbreaks amongst young men. And before rolling out widespread vaccination in the army, they wanted to genotype circulating clinical strains in India. And they also wanted to see whether they were the different or similar to the vaccine strain, which was the Oka strain. So the vaccine strain is a Japanese strain, and it has certain genotypic features unique to it. And then strains in Europe and North America and Africa and Asia have different features. So I landed up with this project. I said, great, I could do it. It was well funded. And here I was, a medical doctor with absolutely no bench science experience, taking on a project which had to kind of give the army an answer whether they should roll out vaccination in India. So I remember my PhD advisor then, he was a lieutenant colonel in the Indian Army, and said, you know what, we can do this together. This opportunity is once in a lifetime. So we rolled it out, and we basically started with collecting vesicle fluid from the lesions of these patients. We had 100 patients all over India, more than 100. We extracted varicella zoster DNA, we amplified it, and we identified restriction enzymes that would help differentiate it from the vaccine strain. And so this went on for 3 years. Throughout the duration of my MD, we published it. In fact, we could later, I started innovating. I could, towards the end of the project, actually bring down 2 restriction digestion reactions to 1. And now one was able to make this distinction between the vaccine and the virus in circulation. So slowly, from learning molecular biology, basics of bench work, to being able to innovate and come up with ideas to optimize the technique to differentiate. So what we did determine was that the strains were completely different in circulation compared to the vaccine strain. I believe at that point, they had started rolling out vaccination only to high-risk individuals, what they classified as high risk. But we were the first large-scale study to genotype circulating varicella strains in India. So this was 3 years, and at the end of which I received awards for this work. So I could see I was being recognized for the bench work, the laboratory work that I was doing. So when I finished my MD, I was quite convinced that I wanted to move into becoming a physician scientist. What my 3 years at AFMC also taught me is that to really do research as a career, I would need to be formally trained in it. What I learned on the job was not going to be enough. During this time, after my MD, some major life changes also happened. I met my husband. He was a techie. He is a techie based, at that point, he was based in California. And so lots of changes. I was finishing my MD. I had decided on a career path, meaning I wanted to train as a physician scientist. I was getting married. So given that I was a civilian at AFMC, I was able to leave. And I moved to California with my husband in 2008. And then started my journey to apply to PhD programs. 2008 was also the year, maybe all of you are too young, but this was also the year that major recession had hit the United States. And here there were Americans who were losing jobs and going back to school, going back to grad school. And here there was a huge crunch when it came to resources for immigrants, right? So we were on visas. There was no green card, nothing. And because my husband we were based in California, I applied to all the schools in the California region. Now, if you do know, these schools are the UC system. UC Berkeley, UC San Francisco, UC Davis, UC LA, Stanford. These are top grad schools in the United States, right? Coupled with immigration issues, recession, for the first 2 years that I applied, I did not get into a program in any of these UC system schools. The recession also meant that they wanted people with their own funding, like who could apply for NSF, NIH funding. And as international students, we couldn't apply for it, right? So it was a toxic kind of heady mix of many things not working out. So 1 year, I enjoyed newly married life. I did all the things that we aspire to do, when you're making a life change like that. And then at the end of 1 year, I started getting fidgety. I started getting itchy. Nothing was working out. I was applying. I was getting rejection after rejection after rejection. I was at home. And yes, I was enjoying setting up the house and all of that. But I also had my education behind me. And some ways it was eating into me, And then my husband said, you know what, let's do this. Apply and go and work for free. Just work as a volunteer researcher in any good lab. And let's at least start understanding the academic system in the United States. This was hard, right? But here I was, an MD, saying I'm going to work for no pay. It was really tough, but tough in terms of coming to terms with it, right? Financially, my husband had a job and we were quite secure. It was more about accepting that even after my MD, this can happen. And then, of course, you have to look at it in light of you moved to a new country. It's going to be difficult to make inroads in that ecosystem. You need to understand it better. So why not do something that is mutually convenient for you and a professor and keep the stakes low so that you can actually learn? So looking back, I mean, this was not a bad decision. I did this for 1 year at UC Berkeley. I worked on C. elegans, a nematode model system. To be very honest, I don't think the science excited me that much, but I did get to learn some techniques and tools. Importantly, I got to understand how academia in the United States works. With colleagues, with researchers in the lab, I could understand what is needed for a statement of purpose. What are they looking for when you give a PhD interview? And then next time, 2 years later, I applied everywhere. This time my husband said, we've tried for 2 years, apply everywhere, we will make it work. So we fixed a few cities in the United States where even he could move if a PhD worked out. And one of the institutes that gave me an interview call was University of Texas at Austin. So I went there, we interviewed. Austin was also then a booming tech city. So his job transfer would also be possible. And it was a wonderful city, wonderful city. I never thought I would think of going to Texas and come out of it saying it was wonderful, because you know the stereotypes associated with it. Anyway, I kept telling myself we'll be out of Texas as soon as the PhD was done. I started the PhD in 2010. So you see, it took me 2 years after moving to the US to actually secure a PhD position. It was a PhD in molecular genetics and microbiology. Then the program that I was in at UT Austin had a system where we had to undergo 3 rotations. And at the end of the 3rd rotation, you would find a fit with a professor. Another thing I must say, that though I worked for no pay at UC Berkeley, the recommendation letter given by that professor was very important. And I'm sure it played a very important role in getting the PhD position. So sometimes at some stages in life, we work for different things. And when you're young, and if you have the support system, one has to start thinking of it in a different way. That letter was useful. So I started then my PhD with these 3 lab rotations. And as you can see, I was moving very much towards working with microbes, microbiology, microbial communities. So these were the kind of rotations I did. And they were all very high profile laboratories at UT Austin, extremely well funded, very successful. PIs were very well known. And at the end of the 3 rotations, for whatever the reasons, I couldn't find a fit. I mean, none of the 3 of them were open to taking me. At least 2 of them said they were not open to taking me. And the 3rd one said, I've already taken somebody else. If you had come to me earlier, I could have worked it out. I thought you found something else. So the lesson is, when you're working with non-Indian or foreign PIs, they expect very casual communication, right? We wait for the PI to say, oh, you're doing such a good job, please come and join me. They would have rather I go up after 1 month of the rotation and say, hey, I really like your work, take me in. So this is something we learn. We are still, ingrained in the Indian system of let them tell me whether I'm doing well, then I will talk. Actually, they just wanted me to go and speak. So for whatever reasons, I couldn't. At this time, I petitioned the PhD program to say, give me a 4th rotation. And this was possible. And they said, think about it carefully. This one should work. I said, all right, give me a 4th rotation and let me see if it can work. So my 4th rotation was with Professor Vanita Gordon. She was a new PI. She was only a few years older than me, actually. She was a new PI who had finished her postdoc and started her lab. She was also a biophysicist, and she was looking to build a microbiology wing in her lab so that she could do biological physics and microbial communities. And so again, the science wasn't something that was up my alley. I hadn't any training in quantitative biology, data science, coding, none of that. And yet we talked and we said, you know what, we can try it. So I tried the rotation. It was highly interdisciplinary. So we chemists, mathematicians, engineers. But most importantly, I think as a medical doctor and microbiologist, I could bring something unique. So I was also her first PhD candidate, as it turns out. So it was an opportunity to tailor make my PhD. And Pragati, please stop me if I'm going over time. I have lost track of time, actually. Please stop me.
Sure, last maybe 3 to 5 minutes. It would be great.
Yes. Yeah, I'll wrap up. It also correlated with other life goals because I was also expecting a child at that time and my son was born in the 2nd year of my PhD. Interestingly, Vanita was also having a child at that time. So we delivered our babies a week apart. During my PhD, I had the opportunity to teach at UT Austin, and it was an excellent opportunity because today I teach a lot at Savitribai Phule Pune University, and it helped me lay the foundations of curriculum development. It was also important to note that on many semesters, this teaching assignment paid my stipend, because Vanita was supporting many PhD students, right? So there were semesters she made few of us teach so that she could use the money for someone else. This is important to know because this is where time management and things like that really matter, because you have to do the research as well as serve as a teaching assistant. So I finished my PhD in 5 years, several good publications. It was an overall excellent experience. And if I have anything to say, it is the science is important, but the people you work with are equally important. Toxic PhD environments you want to stay away from, no matter how amazing the science is. This was a very conducive, supportive, pleasant experience looking back. So I didn't opt for a formal postdoc after that, but I did some research experiences because I was confident of being able to build my own research agenda. I learned some skills that I needed. And then I chose to move back to India. We moved back as a family. So here after 10 years, I was making a big decision of starting my independent research group in India. I applied for the Ramalinga Swamy Re-Entry Fellowship. I received it. It wasn't a very smooth transition returning back. There were one institute that did not work out. But then I finally ended up a few months later at Savitribai Phule Pune University, where my research group is currently homed, where we currently work out of. We are a very active and vibrant group, and we contribute to the ecosystem in India in many ways, including research. We work on biofilms, and we work to develop infection models or platforms that study them under human relevant conditions so that we can use them to better understand post-pathogen interactions as well as screen novel and combination therapeutics. So both the preclinical aspect as well as understanding the infection state. We've been funded by many, many grants. We've done some good work. Most importantly, we have reached out to the community in India at large. And rest assured, it's been quite a career journey. The underlying has been that I have, I think, created my own path and made the best use of opportunities that have come my way. I'm happy to take more questions about the PhD journey itself. But for now, it's good to say that I'm very happy with the return to India and I'm here to stay. Thank you.
Thank you so much, Karishma. I think, apologies. It's I think such a amazing journey, and to share it with so much of enthusiasm with us, with giving us details, like, not only showing us the highlights and all the, amazing things that you've done, but to also talk about how you got there, because many a times what happens is everybody sees the rosy picture and doesn't realize the struggle. So being a woman researcher, being at this stage, career stage, I think there were so many points that I could connect with, and I'm sure even the audience would have found such points in there throughout your presentation. So I'm wondering, maybe we could take one or two questions, reflections from the participants, and then we could move to Rahul's talk, if that's all right.
Certainly, definitely.
Sure. So anyone, would you like to share, if you have any questions, but also any thoughts, any reflections on what you've heard so far? Yes, Aishwarya, please go ahead.
Hi, thanks, Pragati. Hi, thanks, Dr. Karishma. That was a really great session, and thanks a lot for sharing your journey in such depth. I think similar to what Pragati said, at many points I could really relate to whatever you're saying. So first thing was that many of our choices as women especially are very much influenced by our family and who we are close to. So I could really relate to that, and the fact that you waited for 2 years. I mean, you struggled for 2 years to really get into your PhD. So I'm also in that same process, like relocation after marriage and 2 years of just thinking, okay, how do I really get into this academic system here? So thank you so much for sharing your journey. It was very inspiring, and there's always this what I take from your session is that keep going, and you can really try and do what you wish to do if you find the right channels and really keep at it. So thanks so much for sharing that inspiring journey of yours.
Thank you.
That's all really, I wanted to share.
Thank you, Aishwarya. Really, sometimes it's about making it work. There are
Yeah.
times in life that you have the opportunity that you exactly envisioned and you get it. But as you grow older and take on other aspects like personal life, relocation, motherhood, family, husband's career, you just have to make it work with what you get. I wouldn't say I started off wanting to be in a biophysics lab, but now I'm no longer. That phase is over. Now I'm doing the research that I want to do. Even now, there are challenges of doing science in state universities. Right? They are not geared to do research at the level of the institutes of eminence, so to speak, right? So there is always that thing behind your back that are we not doing enough that an IIT is doing or ICER is doing or NCBS is doing. But then this is what it is. I need to be in Pune. Our family would like to be in Pune. This is the situation. And we make it work with everything that we have. Right. Yeah. So thank you.
Thanks, Aishwarya. Ketki, would you like to go ahead? Yeah.
I hope I'm audible. Thank you, Dr. Karishma, for this interesting session and sharing your journey. Like what Pragati and Aishwarya said, yeah, even I could connect with many of the points where you said like you have to make do with what you have based on the resources available. One thing that really struck out of your talk was how you placed importance to people you work with, and importance of non-toxic environment for your PhD, and how that is important for your mental health.
Very much, very much.
Yeah, thanks for bringing out that point.
And we can talk about that in the breakout sessions. And this is extremely important because sometimes it takes us even time to realize that what is happening around us is toxic. Right? And when you have experienced a very good situation is when you realize that something is toxic. So we can talk about that in the breakout sessions as well. Definitely.
Thank you.
Welcome. Thank you. Thank you.
Thanks, Ketki. Priyanka, would you like to come in?
Yeah. So I'm having a journey. It was really insightful and inspiring. My question to you is, since you also mentioned you when you came out from your PhD, it was not just paper, you also have a child. So how was it managing motherhood and a research, because both are demanding and both require time and attention? So how did you navigate through the stress of it?
I mean, it was definitely stressful, Priyanka, but that is where not everybody has to become a mother in their PhD, but time management and task management is important. So that is where that comes in. Now, even my researchers in my group, something simple things, making a calendar. I mean, this is again the workshop topic actually, right? We wanted to talk about it. I think time management is a skill that one will have to learn, not only to handle personal life issues, but also just hobbies. Keep yourself sane, happy, in pursuit of something that's not your research. And there are many ways to set that in place. But I think that in my situation, it was motherhood that forced me. But time management is critical no matter what the situation in a PhD.
Thank you.
Thank you. Thanks, Karishma. So I think we'll now move on to Rahul. Yeah. So I think, Rahul and I also had an interesting meeting where he, being an intermediate India Alliance, DBT Wellcome Trust India Alliance fellow, we both interacted during the recent India Alliance annual conclave that took place. And the thing that brought both of us together was the topic of implementation, which he's also keen about, and I'm currently studying as part of my PhD. So Rahul is trained as a clinical psychiatrist and an epidemiologist. His area of work mainly has been mental health for the past almost 17 years. And currently he's an associate professor at the Pravara Institute of Medical Sciences. And yes, I think extremely well published as well, like Dr. Karishma Kaushik. So we're very excited to hear from another journey now on how was your experience through the PhD. And following that, we'll have some questions for you, Rahul. Thank you.
Okay, can I share my slides? I don't see.
Yes, can you please try? Yes, I think it's coming up.
Okay. Okay. So hello everyone, and am I audible, Pragati?
Yes, yes.
And
Very
you can
clear.
see my slides. I'm on slide
Yes.
number 1.
Yes.
Okay,
Perfect.
thank you so much. What a brilliant presentation, Karishma. It was really nice to kind of be part of that presentation, and really enjoyed your journey. How parallel journeys we all have. I mean, when Pragati and I also had a call, we discussed very similar situations we have gone through, and I was really happy to know about your own journey, Karishma, and I'm sure many participants in this workshop would be having a very similar kind of a course where they wanted to do something, now they're doing something else, or they exactly wanted to do what they're doing right now, and they're pursuing that further. So it's very nice. So let me just start by saying that I come from a place which is called the land of no interest, abbreviated as Loni. And Karishma, you might have heard this when you spend some time in Praura. So Praura is same as Loni. Loni is the village where Praura Institute of Medicine is located. So I come from that particular place. I'm currently working there with my research grant based out of Praura Institute of Medical Sciences and the area around it. We'll talk about that if time permits. What I'm going to talk about today, and again, it's not going to be a very detailed presentation in terms of my own life journey, and it's always very interesting. What I noticed was your PhD journeys actually start well before you enroll into your PhD program. So they start very early. Just to give my, just to kind of pick up from my own story, I would say that I had heard about this particular place, which is called Maastricht, way back in 1988 or 89 when European Union Treaty was signed. And it was a big thing in 80s. All European countries coming together, especially after a world war fought between them 4 or 5 decades prior to that. And this particular place had kind of was there in my mind. I mean, I never thought that I would end up being in that particular place and do my PhD in University of Maastricht. So as I say, the PhD's journey start way before you enroll, and they keep going. I mean, we keep on moving along with some of those similar experiences. Till now, I've given several presentations, but no one has invited me to kind of reflect on my own journey, let alone PhD journey. So it was very nice to kind of receive this invitation from Pragati, and I was so happy that for the first time I'm going to talk about myself rather than the kind of science which I'm engaged in, or kind of some obscure theories and frameworks and things like that, or findings. It was really nice to have an opportunity to talk about what I did in some part of my life. So the topic is reflections on my PhD journey, and I thought, I'd never reflected back on my PhD, which I completed around 4 years ago in 2018, late November 2018. So it's technically 3 years. So since then, I never thought about what was all about in PhD, but this presentation gives me a good chance to kind of talk about a few things. So what I'm going to do is I'm just going to reflect upon some of the things, and let's say if I'm asking myself a few questions a few years down the line, or maybe at this point of time, what I would have kind of asked, and some of you may be having some of these questions. So when I think of my PhD, one question comes to my mind is, was it too late? I mean, did I do my PhD quite late in my career? And just to give you a background, I completed my MD in psychiatry in 2006. So after 2006, I was quite sure that I wanted to get into research because I was inspired by some of my mentors. And again, in the interest of time, I won't get into that. But it was very clear that I wanted to get into a field which was research based, or community mental health research, or anything around that, psychiatric epidemiology and related fields. So I apply. I mean, again, I as what Karishma has said earlier, and many of you might have experienced, I wasn't very sure that which field I wanted to get my research into. So although I did want to get into more of epidemiology and psychiatric epidemiology and mental health epidemiology. By nature, I'm someone who likes everything. So I like a bit of everything. And neuroscience was also fascinating. So one fine day, I just wrote an email to none other than V.S. Ramchandran. I got his email ID from somewhere, and I wrote him a small paragraph saying that I've completed my MD in psychiatry and I want to do further research in this area. And please advise. I mean, of course, no one kind of responds to an email which is kind of doesn't describe what you exactly want to do or your background and things like that. I never got a response from V.S. Ramchandran, although I got a response from some very eminent scientists in this particular field. One of them was my mentor for next 14, 15 years, Professor Vikram Patel. And even with those 3 or 4 lines, he did kind of spend some time with me. And I sort of got kind of an idea about how and where I wanted to head. So I did my master's in public health from master's in health sciences, as they call it, from Johns Hopkins School of Public Health in 2008. So since 2000, during that program, many of my sort of batchmates wanted to do PhD, and I also got enrolled into PhD. So I was struggling with that whole idea of getting into a PhD program because I was only kind of till that time I was only into academic programs, and I thought let me have some first-hand experience of what things are on ground, and then only it will be good for me to get into a PhD program. Also, I had an MD, so there was this like, I mean, you already have a doctoral degree, so do you need another PhD and things like that? I mean, it was sort of stopping me. Although my employment with Public Health Foundation of India meant that I had to be with them and I had to teach in the upcoming Indian Institute of Public Health. So I did spend some time in teaching in Hyderabad, and what I was actually teaching statistics and epidemiology and all those things which really were not my forte. I wasn't doing mental health for close to 2 years, 2 to 3 years. In fact, I had to struggle a lot to convince Public Health Foundation of India that I should be working in the field of mental health because my primary training is as a psychiatrist. So you might wonder, I mean, do people also have to do those kind of struggles? Yes, they do. Because I was somehow kind of picked up to teach statistics just because I was interested in statistics. But then they asked me to kind of teach statistics and teach R programming and things like that, which I did enjoy, and I did spend some time learning and teaching those things. But that was not what my core strengths were. Eventually, I got into a very nice group of people who had multiple grants, and then I had an opportunity to kind of lead some of the consortiums, the research program consortiums. One of them was Prime, another was Emerald, was Share, there was Vishram. There were 4 or 5 very big ticket global mental health projects, and I was leading the work in India. So once I got settled into the mental health programs, I started thinking of should I be doing PhD, and some push from my mentor kind of got me thinking about it. So it took 4 or 5 years just to kind of settle myself in the field work and then get into the thick of the PhD planning. Again, the whole story was very interesting because I just happened to read an email sent on a listserv saying that University of Maastricht and PHFI have a collaboration now, and they have an interesting PhD program. No one in PHFI bothered to apply for that. Probably no one ever did later on as well. I was the only person who applied, who kind of wrote to the person who was looking after that program, got a positive response. And then my PhD officially started, kind of informally started in 2013. But it took me 5 years. It took me 5 years to complete that particular PhD. So the second thing was it too long? And again, going back, my wife also sometimes asks me, it took too long, 5 years to complete that. When actually what I did was I had to kind of publish 5 first authored papers, and they were all published by end of 2015. So all the work was done by 2015. I just had to kind of put all that together into a nice document, kind of a thesis, and get it kind of set up a panel and they review it, and then you go for a defense. But somehow it just took almost 2.5 years getting that through. So I'd written my first drafts of the thesis well in 2016 itself, but I don't know what was happening, and it kind of went on and on and on. And finally in 2018, mid 2018, there was the PhD committee was set up, and then they decided to kind of review it. And my defense was planned in November 2018. So there are many factors which are beyond you, and I was also kind of busy transitioning, and of people are important, families are important. My wife at that point of time got a scientist B position in Indian Council of Medical Research, National AIDS Research Institute. So I was based in Bhopal, then we had to move to Pune. I mean, it was we did want to come back to Pune, but primarily it was because of my wife that we had to come here, and I was also struggling with some of those transitions, trying to take care of the field work in Bhopal, other projects which I was handling, while also simultaneously looking at the PhD. So yes, it was too long, but somehow, I mean, it takes that much amount of time to get there. I also feel that, I mean, you would be surprised to know that the total amount of time I spent in Maastricht was exactly 3 weeks. So I went there once, spent 1 week. Then 1 year later, I went there once, spent 1 week, so 2 weeks. And then the third time I went to Maastricht was to kind of for my PhD defense. So I hardly could kind of pick up any courses or do any kind of academic work during my PhD. But as I said, PhD journeys start well before your PhD. So most of my quantitative methods work I had done in Johns Hopkins as part of my master's. Whole 1 year program, I was only studying. So so that kind of helped me do my quantitative methods fairly well, which I could use in one of my papers in PhD. So qualitative methods was something which was lacking, but then I picked it up. I just did some online courses and read some freely downloadable books and things like that, and managed to do a qualitative paper. Also managed to get a narrative review and a perspective paper and a mixed methods study, the 5 studies. But definitely I could have used more resources from Maastricht University, could have taken courses, but this is all in retrospect. And was it too messy in the end? Of course, I mean, I do feel that it was very messy. I wasn't sure at all till the very end that, is this for real? I mean, am I really going to get PhD? I've been to this place only 2 times. My supervisor is excellent. I mean, he's very supportive, but we haven't met, except for some Zoom meetings, we haven't met really so often. And although he is reassuring me, but I wasn't sure whether this was happening for real. In Netherlands, they have a system that you kind of publish this as a book. So there are 5 papers which are already published. Then you write kind of an introduction chapter, and you write a discussion chapter, and then a valorization and summary and things like that. And you kind of get this. So the PhD committee reviews this. They take a decision whether it is fine or whether it's not fine. And if it is fine, then you have to publish it as a book. And all this I did in last 10 days. I mean, on 22nd of November was my PhD defense. On 8th of November, there was Diwali. So there are 3-4 days of Diwali. And I was still kind of, I had never published a book, as in, I had no sense of what a publishing book looks like. Although I had, publishing in journals is very different, because all the publishing work is taken care of by the journal team. While here it is, I had to look for the publisher, and I mean, I probably did a very messy job of all that, and it happened in all last 15 days. Also, I wasn't very sure what exactly you're expected to do at defense. I had not seen a defense. I had no peers in Maastricht. I had no contacts, and my supervisor always used to tell me that no, this will be fine and things like that. But last 1 week when I was there in Maastricht, Thursday was my defense, and I landed there on Sunday. And then next 4 days, I was frantically looking for whatever inputs I was getting. So I managed to kind of sneak into one PhD defense, and that time, like 2 days before my defense, I got to know that this is how you're supposed to defend your thesis. Anyway, so many of you might feel that, are you doing this too late? Is it taking too long? Are you doing too less or too much, and is it too messy? So welcome to my club. It's always like that. And if you are interested, I can share the copy of my final thesis, which is on the right-hand side. For those in public health, I didn't upload it on any repository, but I'm happy to kind of send it to you on email. On left-hand side is the link for my PhD defense. It is available online, and some of you who are enrolled in Maastricht or other Dutch universities, this is more or less how generally the defense goes. So thank you so much. It was nice sharing some of these experiences with you, and happy to take questions. I hope we are good with time. So thank you, and over to you, Pragati.
Thank you so much, Rahul. Perfect on time, and I think again furthering and deepening our understanding of the journey, and removing that rosy picture of the final PhD fully done, but sharing these struggles and exactly the questions that, oh, is it already too late? Oh, I think am I doing enough or not? That's constantly on our mind. So thank you for touching upon those and speaking mainly on those, so that we also don't we are also able to freely share how we feel. And many of us in the audience are between say a few are aspiring to start off, but many are already into their first year, second year, and some in the third years. So very relevant questions. So I think we should open it up to the audience for a few minutes. And yes, would anyone like to share any thoughts, questions to Rahul? Yes, I think. Sorry.
I'm Shivan here.
Go ahead.
So while it is thinking about the too late, too messy, too complicated, something like that. So in your experience, do you think there is any specific period in which we have to take this journey? For example, soon after the completion of the post-graduation, or do you suggest to have some kind of experience and then pitch into the PhD? So how do you see these two facets as you go along your experience, Siri?
Also, thanks, Shiva. And I must say that I don't think there are right or wrong answers to this, because every life journey is very unique, very different. Things happen in a very, very different way. So I'll just try to give some practical tips which might be of help. So what happens in basic sciences, again, as much as I know, and Karishma may correct me, is that PhD is many a times a prerequisite for you moving into some kind of getting grant and things like that, or even for some of the positions in the universities. There is a prerequisite for PhD. In that case, I would say that rather than delaying it too much after your post graduation, it is better to get into a PhD program. But my sincere thinking on this is that you should have some kind of an experience. You should have looked at something what's happening in the world, because we are too fresh when just out of bachelor's or a postgraduate program. I think I fully support what Karishma said about her volunteering. Volunteering and spending 1 year in a typical Indian middle class mindset, many a times it's not seen as a very good thing. But probably we are also kind of as a society, we are also maturing, and I see many of my next generation sort of nephews, and they take time out, and it's good to kind of have a feel of what's happening. Certainly it helped me, because my PhD, don't take it otherwise, but I thought it was a cakewalk, because I was anyway doing all that work. I mean, I had to anyway publish those papers. I simply nested my PhD in what I was doing, but that's not possible for everyone. So this is slightly kind of an outlier kind of a case. But experience is important, and you shouldn't be doing something which your mentor has told you to do. Rather, you should have some kind of it has to be your story. I mean, when you defend, and just to illustrate that point, the first question in my defense, and if some of you happen to visit that link, the first question in my defense was, now the title of my thesis was Evidence to Practice. And the premise was that we know what to do, we don't know how to translate it. And the first question was from my opponent, they call it opponents. So my first opponent asked me, do you think there is enough evidence? I mean, this was challenging the basic premise of my research. And I said, I mean, well, you can see for yourself in that presentation, but I said that, well, there is some evidence which we know, which we can translate. Of course, there are gaps for having to know more and generating more evidence. And that's exactly what I'm going to do after my PhD, because exactly 1 week later, I resigned from my post in Public Health Foundation of India, and I've moved into Pravda, and I'm doing things which are slightly not related to my PhD at this point of time, but there is there is a link. So I mean, sorry for that very long kind of a response, but in my understanding and the way I see it, I think it's good to spend at least 1 or 2 years understanding where the field is moving, trying to know yourself better, and then get into a structured PhD program. Because once you are into it, it is very difficult to then kind of make changes. I mean, you can't, for example, the toxic environment, and many a times it's beyond you. Maybe you can change one institute, but you cannot constantly keep on changing institutes and mentors. So one has to be careful about it.
Thank you, Rahulji. Thanks for that wonderful. Can I ask one more follow-up question with that?
Yes, please.
Yeah. So how do you feel feasible to have a new topic, in the sense the candidate might not have any experience, he might have pursued some other career, kind of professional altogether till the post-graduation, and suddenly shifting to PhD to the new topic just because there is a funding. So how do you see, and what are your suggestions if at all that kind of a situation is there?
Well, I think that's probably the case with all of us, and I think Karishma alluded to that when she said that she was kind of getting into a topic which she had not probably. So maybe I'll also request her to respond to that. My take is, forget PhD. There is never any point in your career where you get to do things where you are most comfortable with. Meaning, you have studied this, and you are kind of an expert in this, and now you get to do this. There's nothing like that. I mean, every time it's a new thing, you have to keep reading. You're almost like a toddler in that particular area. So I have never ever experienced anything in my life which is okay. Now I'm settled. I know this stuff, and I'm going to do. It never happens like that. Currently, I'm doing randomized control trials, which I've never done for entire 14, 16 years of my life. So I'm looking into what are the intricacies of protocols. And just today morning, we did CTRI registration for the first time. That doesn't, I mean, that doesn't take away from what I did earlier, but it just adds to. So it's fun to kind of, and that's what science is about, and that's what we are into research, to kind of get into zones which we are not comfortable with and trying to explore. One more thing which I want to tell is, again, science doesn't happen in like, I mean, there are always baby steps. So we kind of take baby steps, and paradigm shift is done probably by very few who end up getting Nobel Prize, things like that. And again, I don't know much about that field because I don't come from that, but all that what I've seen in public health, social research is we kind of take baby steps. We assimilate what has been done till now, and then decide where are the gaps, and just try to fill that small gap in a very small way. And that doesn't belittle our work. It's just that this is how science progresses. So don't set yourself for something too unknown, but something manageably unknown, and get into that. And that's the fun of being in research and science. And never belittle the baby steps which you take, because ultimately those baby steps add up to the whole knowledge domain. And because many a times, I mean, I do make fun of my own publications, saying that even my co-authors don't read it. But that's fine. I mean, your co-authors don't have to read it always. There are a lot many other people who are interested in that particular area who may read it 20 years down the line, 50 years down the line, or who knows. I mean, and that might be helpful, because I have been immensely helped by some of the very sort of unknown papers, not cited by anyone, but I find them useful. I find them extremely useful. I've cited them, I've used them left, right, and center. and I owe to them. I owe to the baby steps taken by those investigators. So that's my response. And maybe Karishma, you can add to this particular thing because probably you have gone through this in a very different way.
Yeah, thank you, Rahul. Wonderful points. It was like mellifluous listening to you. Absolutely wonderful. So, regarding all I would say is treat if for a PhD at least, treat it like a training. Don't necessarily commit that is your area of work for the rest of your life. Right? Treat it as a training. Learn the tools. En route, you will get the PhD, and over time, you will understand and comprehend what your strength is in scientific research. So it's a little, I'm doing a PhD in neuroscience. I want to only become a neuroscientist. No, there are many things that should work for the PhD to happen. It should be a good environment, a good institute. You should have secure funding. So if that means not in core neuroscience, but something else, it's okay. Treat it like a training.
Thank you both.
And things don't go your way, because I wanted to say this in my presentation as well. Karishma, you would love to know that I first went to DY Patil University when I was in Pune, and I proposed them that I want to kind of do this kind of work with you guys because I don't want to move anywhere. And there is a lot of subtext to this, which we will leave it. And I had to kind of very quickly, in a span of about a week or so, I had to move that entire thing from, in conceptual stage, I had to move it from DY Patil to Praura, which also makes a bit difficult for me because I have to spend 50% of my time spent there. But then it's a different challenge. So things never ever
Very
work.
True. No, this exactly has happened to me on numerous occasions. It is DY Patil's loss, Rahul. Sometimes we also have to tell young people that our institutions and systems may not have that vision yet. Very often. So that doesn't belittle, like Rahul said, your work or your capability or what you bring to the table, right? The institute may not just simply have the vision.
And you can always settle with someone else. No problem with that.
Very true. Yeah. Thank you for sharing that. It's not, things don't work as per plan. It's always good to plan, but then, always have maybe a plan B, plan C, and see how to make them work. So I think that very nicely brings us to the group work that we had planned for. So, Shivanand, if you could confirm that there are about 5 breakout rooms set up. So what we thought was that based on what we have listened so far from the speakers, and also reflecting on our own journey so far and where we are at this point, we have chosen about 5 topics which any PhD would face throughout especially these 5 years, but even further in life. So just break into groups of maybe 4 or 3, and feel free to keep your cameras on if you're comfortable, and have a conversation of what how do you relate to that particular topic, any challenges you faced in that topic, and how you have countered them. So we could do this maybe for about 10-12 minutes, and then we come back to the this main room, and each group can share maybe 3 solutions towards these challenges that we are posing. So maybe I'll just type or rather paste the 5 things that we had thought of. And Shivanand, the rooms are there, right?
Yes, Pragati, we are ready. I just wanted to announce the co-host in group 1 Pragati, and group 2 Sarin, and group 3 Anika, and group 4 myself, and group 5 Ketki. So we have made this co-host because the recording will be saved in their computer. Since we cannot record all the breakout rooms, we have made a co-host. Please make sure that you save the recording and later on you share it.
I think slowly people are trickling back into the main room. So yeah, I hope you've had some time to discuss and learn from each other's experiences and come up with some 3 or more or less also is fine. Key takeaways from your discussion with colleagues on the topic that was assigned to each of the rooms. So I think all rooms are here. Yogi? Yes, 22. I think we're all back. So good. Maybe we could then slowly start off with just listening first to the key takeaways from each of the groups. And then if time permits, I don't think there's a good way of, summarizing or something. The whole session has been just filled with nuggets and pearls of wisdom, interspersed throughout. So yeah, we'll not attempt to summarize. Maybe we just hear from each of the group on their key takeaways. So Pooja from our group 1, would you like to share?
Yeah. So our group topic was managing the relationship with the supervisor. So everybody has that interaction with the supervisor and may have different challenges while going through this journey. So we came up with 3 takeaways that every supervisor or the team of supervisor which we are working with have different perspectives. So it is very difficult to manage that different perspectives and different disciplines they come up with, and confidently facing and articulating to them what you are trying to say, and clearly explaining it to them what you are trying to complete in this PhD. So it is very skillful communication and your confidence, and they should gain that confidence in you that you will be capable of doing that that in that study. So yeah, that's what I wanted to say.
Thanks, Pooja. If anybody else has any quick, thoughts that come to their mind on hearing this topic about managing relationship with supervisors, maybe a minute to take 1 or 2 at the most comments, feedback. Yes,
I think
yes,
sorry, go ahead. No, please, let Ranjoy go ahead. I'll just say something that would help
Yeah, actually, I have a question. When I saw the list of topics, I initially wanted to be in this group, but anyhow, I have this question. What if your supervisor belongs from a different school of thought and you belong from a different school of thought? Both of you have agreed on a particular topic, but the way you are expressing the things which are beyond the scene, things which you subscribe to, and your supervisor although belongs from a different school of thought, then there is a ego clash there, and how to handle that?
Very true. I think in the group we did discuss that in the starting, that one is the background and that difference that epidemiologist or quantitative, qualitative, those divides that we have. But beyond that, even the socio-cultural, so like supervisors based out of India, based in your city versus supervisors sitting in Netherlands, and then how do you go and with whom how do you go ahead when there are differences and it's not aligning? So I think that's how Pooja shared, that maybe we need to do all the groundwork. We need to understand that what is the best way to communicate with each supervisor and how their ways of working we need to understand. And secondly, if we feel or if we exude that confidence that we know what we are talking and that it's making sense and it's aligned, chances are slightly higher that things might fall into place. But having said that, there is still a very good chance that, especially just in the quantitative, qualitative realm, there could be spaces where there's just no alignment. So maybe Rahul and Karishma, if you'd like to come in. Yeah, please go ahead.
Very quickly, because I had raised my hand. So one thing is not just PhD, but while you are working as well, never ever you kind of align with everyone, and there are some people with whom you align and some you don't. So my approach is have a common minimum program where you kind of have things defined and move ahead and be pragmatic. I mean, at least I'm pragmatic in a sense. I tend to finish off some of those things with a particular group, and then I move on. If I like that particular group, I move on. And even if you like some people and align 60-70% times, there are rest 30% of the times when you don't align with them and you don't like the way they work. So it's a mixed baggage, and you just have to kind of live with it and be pragmatic. Thanks.
I'll just, enjoy what Rahul has said. The question you ask yourself is, can this working arrangement, get you a PhD? Is it so bad that it's going to hamper your graduating on time or your degree? Then you might want to think about it. If not, I think these are phases that happen. 5 years is a long time to engage with a person. And is the outcome going to be what you are in it for? And the other thing I will mention with overall with managing supervisors is maintain documentation. Like a weekly email update is a really good idea. Often foreign professors like in the US and Europe are off in the summer to Greece and Cyprus, and they would not be able to meet you every week. But maintain email, at least telling them I did this. So later when it comes up for review, it's like, I tried this, it didn't work. I tried this, it didn't work. Even if things don't work, right? Keep it on record so that later you have not done anything in 6 months cannot be something you have to face. Especially with foreign professors who are very hands-off.
Thank you. Thank you. Very important points. Pragmatism and documentation. So I think very important. Moving on to group 2, time management, key takeaways. Sorry, we're really short of time. So I hope that we get to clear feedback, inputs. Group 2.
Go. Hello, Pragati. I was in group 2 and I had very interesting company. I had 2 women researchers who were working as research coordinators in their respective projects and were hoping to initiate a PhD track from the work that they were pursuing. And they were primarily discussing about the challenges of investing time into preparing the ground for developing at least a broad idea of the research topic that they would like to pursue, because the demands from the work were quite high. So in fact, we were talking about what measures could perhaps help such researchers who are into projects and still are interested to pursue PhD track. So one of the ideas that emerged is perhaps projects need to start thinking of inbuilting time within the workspace, wherein people who are employed are sort of given a leeway. At least 1 or 2 positions within the project are also sort of considered as potential PhD positions, so that the candidates working in those positions can invest a minimum amount of time, protected time, for them to prepare the ground to initiate a PhD track. So that was one of the ideas that emerged out. And then of course, we had also Meena with us, who is a working mother and a full-time PhD scholar. So the domestic compulsions, the environment at home, and still needing to invest that degree of time, something we already heard from Karishma's presentation earlier, came up as a common thing. And then I was also sharing my own experiences as a single parent during the day, being at home. And despite being a full-fledged PhD student, not able to dedicate the requisite amount of time that I think is bare minimum required for me to pursue my journey. What we sort of realized here is that there is going to be shortfalls in time management. That is going to be a consistent process. I think at no point of time we are going to perhaps be able to achieve the perfect balance of time management. It is more on I think it's sort of like how it comes up in a day's timetable. As a day comes up ahead of us, how can we prioritize our own time? So that seems to be the real message, that on a given day, if you have these number of hours available with you, or at least you are forecasting this number of hours available at your disposal, how best do you prioritize things? That may be a hybrid model, it may be exclusively PhD, it may be your work, or it may be a combination of both. So it's really up to the milieu where you are located in, the current circumstance that you are lost in. So it's more of a pragmatic decision at the end of the day. So I close here.
Thanks. Karishma, Rahul, any takeaways, any thoughts? No. Okay. Yeah.
Then self-care, the group on self-care.
I think Fatima had some really nice points because she's rocking this self-care thing. Fatima, would you like to talk and share what we discussed?
Yeah, there were a few things I shared with Karishma, that being I had a gap of 18 years in my career after my undergraduation, and then I finished my MPH and then started my PhD. I'm halfway through it. So I am very passionate about learning. That is why I'm doing PhD, if you ask me. So I take it as a hobby. Then it doesn't put a burden on me. And I have specific time frame which I have set aside for my PhD, because I have to look after my kids and look after myself as well, because I'm going through this phase of my time where I'm going through menopause. I have to take care of myself. So if I don't take care of myself, I will never be able to take care of my kids and finish my PhD. And one of my professors, he advised me that take it up as just a coursework. Just like you finished your PhD, finish your MPH, finish your PhD in the same manner. Take it as a coursework, one thing at a time. Don't distract yourself, and then you will surely complete your PhD. And then after you finish your PhD, you will work on a project which you're passionate about. That is your real work. And then that is how I keep myself grounded and take care of myself and try to finish my PhD.
Thank you so much. I think that's one of the least prioritized areas where, you know, we and even under discussed, I feel. So thank you. Yes,
very quickly, not just self-care, but taking care of your family and people around you. And as I think Karishma referred to earlier, it's all about people as well. I mean, it's not just about those 3 letters or kind of achieving something. The entire life is moving on along with that whole thing. So take care of yourself, take care of your kids, take care of people around you. That's equally important as much as what you contribute.
Thank you, Rahul. So I'll invite group 4, building broader scientific skills. And from here on, Ketki will be taking it forward. Yeah, thank you.
Thank you, Pragati.
So group 4 from myself. So myself, Priyanka, Angel, and Vaibhav were the part of this group. And the few takeaways in broadening the scientific skills. One of the challenges that we all were in agreement was the ability to review a paper. Most often we are more inclined towards what is most appealing to our research from the paper, and that's how we get biased into research, and we don't really research and we just search what we want. So that was the one point that came across. And reading skills is the one thing that we need to adopt, and that's a very big challenge. Sometimes we spend a lot of time in reading, but we don't grasp out of that article. That skill is also a very big challenge, is mentioned, we discussed in the group. And the third point about the clarity of the research question. Sometimes what we all agree with, PhD is something journey that we want to change the word from that, which is something too ambitious. As a young mind, they think a lot changing the word instead of just being about themselves and grounding themselves, being humble to the topic and then investigating. So that's something more important, to have that clarity in order to build the scientific skills. And the last important point, very interesting, that science comes from the common sense, applying the knowledge day activity. And one of the participants in our group said that he applied his topic to everyday activity, and that's how he was able to unpack more science. Rather than going from the science to common sense, he came from the common sense to science. That's how he is more clear and conveying the message to the world. And the last point, which they have mentioned by another participant, the time management is already been discussed, and that could be quite through technological knowledge. While we unpack the science, we also should adapt ourselves to the improved science in terms of the technology usage that could also help us understanding more science, how it is evolving and connecting to the present world is what we discussed. Thank you.
Thank you, Shivanand and Group 4 for this. Dr. Rahul and Dr. Karishma, if you have anything to add on to this.
Also, very quickly, accept the fact that you may not have all the skills. So one has to also live with the fact that you may not know some things. I mean, you can outsource it. There's no harm in kind of getting people's help.
Thank you, Doctor. Yeah, Rahul, it's important to know that, yes, you cannot handle everything. At times, you have to take help from people around. Okay, coming to Group 5, networking, not nepotism. So we were 4 of us, Dr. Rahul, Aishwarya, Dr. Ranjoy, and me. So we discussed on 3 aspects. First is why networking is important. Second, what were the challenges we faced during networking? And third, how we can go about networking. So with why networking is important, it's important to network not only to, for your future opportunities, but also to collaborate for future projects. And especially in public health circle, it might feel that networking is nepotism because of its competitive and diverse field, but it is not. That's what we decided. That's what we thought about as a group. Secondly, many of us face inherent biases and inherent challenges and cannot approach people directly. So those were the major challenges which we thought we have while networking. Third, some ways of networking is, first is just do it. That's what Dr. Rahul said, that just do it, just go to the field and start networking, and eventually you'll get a hold of it. Second is start writing to the first author of a paper, not only to source papers from them, but also to build a network and talk about the work they do and your work. Third is, even you can write to a journal and be a reviewer, and reviewing some paper would also help you in improving your networking skills. So I think those are the points which we covered. Group 5, if you have anything else to add, please feel free to come in.
Well, Karishma, I have a very quick question. The thing was about how to differentiate between networking and nepotism. So maybe participants would be helped if you have your thoughts on how to differentiate between that. Many times it is seen as networking as nepotism. So what do you think about it?
So to give you a fun example that will also help us end the session, nepotism is Alia Bhatt getting a role because her surname is Bhatt. Networking is Vidya Balan going with her work portfolio and saying, this is my work. If you have a good role, please consider me. That is, to sum it up, that is the difference in my opinion. Telling the community that, hey, I'm available, these are my skills, why don't you reach out to me? It could be Twitter, it could be Facebook, it could be LinkedIn, it could be a real conference, it could be a workshop, is absolutely nothing wrong. But saying, I am so-and-so's PhD student and isliye mujhe ye job mila, then you need to question whether, whether this was for you or this was because somebody wanted to curry favors with your PhD boss. So I don't think any of us are in that second realm. But young people should realize the power of Twitter, LinkedIn is enormous, especially when we've shifted to a digital age, especially for LMIC researchers for whom flying to Brussels and Europe is not an option every other week. We miss out on a lot of connectivity that the EU and North America has because of the power of the dollar, the power of the euro, the whole process of getting there. So leveraging digital tools may end up giving you a very good postdoc. It may end up giving you a job. And, I faced it a lot, Rahul, when I started enjoying Twitter, Indian community Twitter. But all the people who at one point felt I was using Twitter to, the nepotism are today using it for the very same reason. It's just that people's timeline of realization might be different. So let's leave it to them and you do what is working for you. Right?
And I mean, to sum it, कुछ तो लोग कहेंगे लोगों का काम है क्या? So I mean, whatever you do, people will always have some or the other take on.
Thing. So see, Rahul and I are totally in Bollywood mode today. Did we say this was a PhD workshop? So you do what works for you. And if you see you're getting traction and visibility, keep doing it.
Thank you, Karishma, and thank you, Rahul, for your insightful session. So with this, we wrap up this session. Thank you to all the participants also for their enthusiastic participation. And Pragati, and I would first like to thank Pragati because of whom this session was organized so well. Thank you all for joining in. Bye. Shivanand,
yeah. Thank you, Ketki, Pragati, Karishma, and Rahulji. So if I summarize in just 2 lines about these 2 sessions, Karishma's message could be make out of it what you have and or make it works with what you get is something that I could take. And Rahul is don't underestimate the baby steps that you take in your PhD journey, because that is how your journey of PhD will be accomplished. Thank you so much for the beautiful message and the wonderful interaction that we had, and really enjoyed a lot. Thank you once again, and we have a lunch break followed by this session, and enjoy your lunch, and we'll assemble back at 2 o'clock. Have a great day, Karishma, and once again, thank you so much.
Thank you, Rahul. Bye, all of you. Bye.
Yeah, we'll assemble back at 2 o'clock. Okay, very good afternoon to all. I guess you had a good lunch and good break. So after a very enriching first half of the workshop, I welcome you all again to the second part of the first day of the workshop. So we have a very interesting session to start with the afternoon session. One of the important skills that one needs to acquire is the art of communication and the presentation, be it PhD, academia, or any field for that matter. Therefore, it is very important that we keep building those skills of how to convey what we intend to convey. Dear friends, our next session is on the presentation and communication skills. To facilitate this session, I invite Dr. Sarin. Dr. Sarin is an Ayurvedic physician with a master's degree in public health. He is currently pursuing his doctoral program with the Institute of Public Health, Bangalore. He hopes to further his professional research career in the domain of health policy and systems research with a special focus on Ayurvedic systems of medicine. Dear Sarin, thanks for taking the responsibility of facilitating this session. And the session is over to you. Thank you so much.
Thank you very much, Shivani, and a warm welcome to all of you. We have a very interesting session on communication and research from 2 to 3:30, and we have divided this entire thematic session into 3 subsessions. So we begin the first subsession with a very, very important resource person that we have with us today. Let me introduce you to him. Dr. Matthew George. He is professor at the School of Health System Studies at the Tata Institute of Social Sciences, TISS, Mumbai. Thank you very much, Dr. Matthew, for arriving for the session. Dr. Matthew George, his background is from the social sciences, and he has done his post-graduation in public health and his doctoral study, again in relation to public health, from the Center for Social and Community Medicine at Jawaharlal Nehru University. He currently serves as professor at the School of Health System Studies at TISS, Mumbai. And his active interests include in the sociology of illness, as well as the sociology of medical knowledge, and multiple systems of medicine, medical pluralism in India. Without further delay, Dr. Matthew George is going to talk on the topic of communicating research problems and challenges. So I hand over the floor to you, sir. Warm welcome once again to you.
Yeah, thank you, Dr. Sarin and IPH Bangalore for inviting me for this session. And it's always enriching and refreshing actually to engage with research scholars as a lot. So that's it. We always learn from that in the process. So I think the timing seems to be very tight. So I kind of feel that it's within 20 minutes or so we may have to cover that. And yeah, so I hope I can share the screen as well. Yeah, I hope the screen is visible.
To hear you.
Hello. Hello, am I audible?
Sure, sir.
Yeah. Okay, so yeah, I think one of the key challenges already the session introducer has already communicated about the purpose of communication in research. And when we say communication, most of the time it's all about oral and written communication is something that we talk about. But what I'm trying to look at it is in the context of research, how important and what are we really communicating and why? And then I'll talk about in the second part about the possible forums or platforms available for communicating research. And as we all know, I think each of the sessions or each of the platform do have a different purpose. And I would strongly emphasize that part. The purpose of communication in a way decides the content and the nature of communication. So that's something which we should keep in mind. So having said that, we will shortly, I think that, yeah, with the given time, maybe around 20 minutes or so, I'll have a brief presentation. And then feel free to stop me in between if needed. And after that, we can have a little more discussion if the time permits. Okay, so I'm sure that all of you are in the various stages of PhD, as I could see from the participant profile. So why is it that we need to communicate research? What is there to communicate? It's all written. It's in common language so that anybody could read it. So what do you think is the purpose? And I feel if you can also respond so that instead of having a one-sided lecture, we would have more discussion and then eventually move on to specific questions if there are at the end. And among the group also, I'm familiar that most of you, I think some of you have also taught earlier. So I'm familiar from the names I could see. So why is it that we need to communicate research? What is the need for communicating in the first place? What do you think? Please feel free to respond. Yeah. Yeah, to share your research with wider audience. Yes, that would be one. Even you can put it in the chat as well.
I think also we can have different audiences to whom we want to communicate our research. So it could be, someone who does not have knowledge of scientific terms, like communicating with the public, or it could be with policymakers. So it's important to, so that the research that we have done has some meaning, unless it is communicated.
Okay.
Yeah.
So it's a forum in which where we disseminate, and if it is not even communicated, so there is a way by which we propagate the very findings itself. But as you rightly said, the audience is diverse, and that's a big challenge actually. So the question becomes, whom are we communicating to? For academic circles, the concerns are slightly different. For policy personnel, their concerns are completely different. Or are we communicating like in the natural sciences? One of the purposes of communicating is to create awareness among the larger public about the new developments and findings. So is that something applicable also in the context of public health? Nowadays, with all new findings and studies about COVID, half of it becomes all new knowledge, which is to be disseminated to the public. So is that something? So in a way, the question of communication comes in very clearly that what are we doing? At the end of the day, it's all about language. Those who know the language can read it. Now, whether they read it in the same way or there are diversities according to their background, disciplines and all when we communicate. So that is something that entire communication, and it's also written, if it is not documented, then it does not exist. So it's also a legitimacy of what you did. Is it a systematic documentation, the purpose of communication? Any other response? In terms of communication, we have at least 2-3 coming in. So I would say that the entire purpose of communication is more about translation. The task of communication is about translation. You know what you did as a researcher, and you are now communicating that to a second person whether it could be a person from whichever field. But there, it's just a translation of what you think you are communicating to the next person exactly the way you want them to think. That is precisely the point, because we can all communicate. The term we use, the concepts we use in research, social determinants of health, the concepts that we use on health system. The moment we say, each of the concepts have different meanings for different people. So as a researcher, it is important to communicate what exactly you want your audience to think about the topic the way you want. So that's one thing as a research communication. And when you say in larger academic circles or even journal publications, we have arrived at already existing knowledge system and linked with that, saying that this is what I really mean by this concept, not the way X or Y decides or X or Y think. So that is something which is very safe. So communication, according to me, is more about translation. You are just translating and making it advisable. Now here the question comes in. The entire research you need to communicate in parts, for which I think broadly I have put it like objectives, methodology, findings, and results are the components that we generally put across in terms of communication. So why should we communicate objectives?
To clearly state what the problem is. Because unless we know the problem, then if we communicate methodology or findings and results, there will not be a correlation with why we did it in the first place.
Yes, perfect. Any other thoughts on? Because most of the time there is a tendency to focus on findings and results most of the time, assuming that objectives methodology is obvious. It's not necessary that we should give emphasis to those, rather let us, especially if it's a policy circle, or if you're communicating to policymakers, they're not really bothered too much about the objectives and methodology. There, the assumption is that it's not.
Also, you can actually, with the sharing of objectives, you can share what you were trying to study or what you wanted to.
Yeah, right. So you have also to have a focus on study, talking about the limitations also. You have to very clearly say that this I'm doing ABC, but not doing DEF. And you put our intentions, give a sense of what we are setting out to do finally. So what is the ultimate purpose which we started with? So there is a typical purpose of giving various communication. Now, coming to methodology, I have to, at least in objectives also, you can glorify and say that, yeah, objectives again about place, time, person, which are the basics which are necessary for any research objectives. When it comes to methodology, there is a serious challenge where the tendency is more about methods and very little about the theoretical position. And when you don't say the theoretical position and directly talk only about your methods, at least 20 other questions will arise in the mind of the audience. So one of the purpose when you communicate theoretical position is to settle and by default translate into the methods that you have used by default. Like if you have used a certain theoretical position, it's expected that within that tradition, you will be sequentially using a certain kind of method. So your method justifies your theoretical position and your theoretical position justify your method. And one of the things in the current context in most of the PhDs across, I can say that the theoretical position is something which is sidelined, which is not really given adequate emphasis the way it should have. And especially it's important. I will say that to who all it is important. So some of them it is not at all important, depending on the audience. But for academic circles and as a PhD program, it's also a kind of litmus test. Okay, is it a good PhD that there is a theoretical grounding and positioning of what you did so that your methods automatically get justified? Then finally comes the findings and results. You can add on. I'm sure that being in the PhD stage, we all break our head too much on all this at every point of time. So it's all there in your fingertips. We are all oldies who have completed that at some point of time, so we never revisit. So findings and results, again, the findings and results, many a times I would see that these are the data that we had, these are the percentages, these are the tests. So the way you present your findings and results, again pose the question, to whom are you presenting? And so translation one should give emphasis on every aspect of research differently, from title to objectives, methodology, findings, so that you want your audience to think the way you want, so that you and the audience are in the same page. And that's a tough part in the current context, where we have a lot of words used with similar words meaning differently for different people from different contexts. A kind of interpretivist or subjectivity that is inherently part and parcel of society at large. So considering that, it's important to make sure that you are communicating what you want to communicate, so that your audience also think in the similar lines as you are. That's precisely the reason why communication is needed. So it's nothing at the end of the day, it's translation. I hope I'm making sense in terms of the first part of why we are communicating research. What is the role of communication in research? Now, coming to the to whom? Who are the possible audiences that you can think of in communicating research? Do we have a homogeneous audience, or the variety of audiences that one can think of? Are they all of same kind? Can we use the same language to everyone? What do you think?
Communication should be targeted to different audience based on who the audience are. Like the way you communicate your findings to a policy maker would be different than the way you communicate it to lay person.
Yes. Any other? Yes, policymakers, research participants, common public. Yeah, exactly. Those are the kind of points which I also have. So academic exercise. Within academics, when you say that when you remember, at least to most of you, when you do a PhD, which kind of communication you find it the most difficult? As when you might have presented your proposal, and you might have spoken to several lay persons also what you are doing, and you try to convince your family members, what are you doing? So which of your kind that you find it very difficult to articulate? Different for academia, policymakers, civil societies, media reports, and people. Perfect. Yeah.
Yeah, I think for me also, communicating it to family members is the most difficult, because to put it simply is the most complex thing, I feel.
Okay. And when was you more tensed?
Tensed is with academicians and supervisors, I think.
So within academics also, within that, among students group, among peer, you can communicate your topic in one fashion. With guide, DAC members, that's a different ball game altogether, because methodologically you have to be very strong, thorough. And imagine you're communicating your study to a natural science person. If you're doing a social science research and communicating to that to a natural science person, who are another PhD person in maybe neuroscience or even advanced molecular biologist or somebody, then you find it all the more difficult that you almost use similar terms, but the meaning attached is completely different. So that's where the challenge comes in academics. So one is, as you all rightly said, most of you have already put across, academic audience is one. And within academic also, there are different groups that one can imagine. And that is important for various reasons. And the other group, again, policymakers. The immediate group coming in policymakers. But in policymakers, it's very tricky. I'm sure that others who are from the policy or regularly dealing with policy in the current will elaborate more on this. Are we communicating for advocacy purposes? Or are we kind of talking about good practices, highlighting good practices so that tomorrow policymakers can take it up as a possibility? So you are putting it everything in a clean slate and say that, yeah, look at this. Here is something which is going on. Why don't you go and find out and see that the possibilities within that? Or within policymakers, are you making a policy critique? Okay, you have so-and-so policy. What about the implications of that? What about exclusion happening in that policy? So depending on within policymakers, which are the kind of positioning that you make depends also on the finding of your study, obviously. But then at least one can visualize. There could be more. You can add on the numbers further or the kind of group further. But the language you use for each of the communications has to be very cautious and has to be different. You cannot use the advocacy language to policy critique or even to a good practices. So obviously policy critique and advocacy, there are a lot of commonalities involved. But for good practices, you have to take a different stand altogether in terms of communicating. Then we have the media, which is now one of the most important and powerful. And in terms of reach, there is this mainstream media, there can be critical media, a whole lot of online magazines and others which raises policy issues, social media. And there again, when you put it social media, what are you expecting? Again comes the question of the purpose of communication. What is the purpose of communicating in media? Why do we need to communicate our results in media?
To reach out to a wider audience.
Okay, is that the only? Yes, it is to reach out to a wider audience. But who are this audience? You mean the general public or policymakers and?
General public, sir.
So what are they going to do with the results?
I think to also contribute to the narrative which exists about something in general in public. And
yeah. Go on.
Evidence, when we read about it, we get to know, okay, this is happening right now. Maybe this is different from what was happening a couple of years back.
Okay. So let us take the case of COVID vaccines. Now, COVID vaccines, with at least the earlier understanding, there has been a clear shift, at least I see it, from the way a general public is expected to understand vaccine before and now. Earlier, the understanding was vaccine, if you take it, that will prevent the occurrence of the disease. And now it has almost reached a point that vaccination may not really prevent from getting the disease, but it will only reduce hospitalization and death. That's what the current evidence says. So in that context, how do you think public would be, I'm saying the general public would be making sense of that? They have already made that shift in their minds that, oh, Purana vaccine alag hai and Abhi ka vaccine alag hai. They've already done that, or maybe a whole lot of people are still assuming that if they take vaccine, the chances of them getting the disease are less. What do you think? Because the idea of vaccine always comes with a certain knowledge and understanding surrounding it.
Yeah, I think as people are accessing the changing information about vaccine, it's helping them to make decisions also with respect to taking the vaccine or not. If such information is not available in public, then probably there'll be a skewed view of vaccines or something which hasn't changed over time. So to update with the knowledge and what the general public understanding of something is, especially in the current times with respect to COVID and COVID vaccines, I think.
Yeah. So there is a certain extent of knowledge which we expect to go across the general public. Plus, there is also the same forum can be applicable to policymakers, academicians and all. Also seeing that, something is there. Somebody has worked on certain area, which I didn't know. Even it may come from the mainstream media, even for academicians as well as policymakers as well. It's not that they are out of it. So sometimes when you write it in a popular media, you have to take care of the multiple dimensions that need to be covered in your research communication. And media also helps to convert, that's another comment I can read, that media also helps to convert any evidence into policy or change in the policies and getting benefit to the population communities. Yeah, so the point I wanted to bring in is that the moment we say general public, it's very crucial and controversial on what the communication in research is expected to do for a general public. And it is controversial as well, especially in the context of public understanding of science and those existing knowledge systems. It is assumed that the traditional, the classical knowledge production understanding was that it's a more of a diffusion of knowledge that happens from the laboratory to the public. And it is seen that it just happens from the top to bottom in a deficit model. This was the old understanding about how knowledge translation happens at the public level. But now what happened? It has been questioned and criticized by the constructivist and the sociology of scientific knowledge group. They say that actually knowledge is co-produced. Public are also part of the knowledge production. They may not necessarily take an active role. Even if they take an active role, they may not necessarily intend to take that active role. But they are by default very much part of the making of knowledge. So the question is that public also is part of creation of knowledge. And I'm sure that when it comes to ethical debates, there is always this question of being a respondent versus being a participant. And we all use words very cautiously. Because when we say that, the idea of public, what are we actually communicating to the public? Especially, which is very technical. Because in the COVID context, it keeps on repeatedly facing us saying that, what are we really communicating? Are we making public an expert in immunology? To what extent we want them to have the knowledge? So that their vaccine hesitancy can be addressed. It's one way by which one look at it. Are they able to imbibe all that knowledge that we are giving? It's not that their capacity is questioned, but that is not their final purpose. Their day-to-day life is actually in something else. So they are not interested too much on the knowledge beyond a point. Don't think that the way PhD students are behind knowledge production, the public is. The public is not. They have completely several other things to do, of which knowledge becomes one of the things which they may or may not engage with. So we have to position public within their larger socio-political context in which we need to. So that is something which we need to keep in mind. And for general public, the purpose of communication is very tricky and challenging. So one has to really know what you want to bring them through communication. Do you really want to create awareness by communication, immediately bring in behavior change? Sorry, I have to say that it's not that simple and linear. Behavior change just doesn't come just because you give some knowledge. It is much more than the conditions in which they are living. So that's what the current evidence also. So having said that, the to whom audience component. Now multiple category of people can be your audience, which is all the more challenging in terms of communicating. So when you communicate, at least have a clarity whom you would like to have your audience primarily, or the major audience among the various range that exist. So that automatically your communication will be set it right. I hope it's making sense. Okay, now coming to the possibilities. So the same set of category I have put it: academia, policymakers, media, general public. What are the possibilities in communication? For academia, to say that there could be theoretical or methodological contribution. Like, I don't know how many, some of you might be aware about, I'll just put it an example and then tell it so that time can be saved. About social determinants of health, maternal death. I'm sure that most of you are aware about the studies on maternal death, the verbal autopsy done for that Dead Women Talking document by Seva. So otherwise also, when we take verbal autopsy of maternal death, one of the immediate policy implications is that you are trying to explain what are the factors contributing to maternal death. But in academia, one can also extend it beyond that as a theoretical contribution, as a way of causality. And causal explanation itself is a theoretical challenge even now, to give a proper example or proper explanation of a good causal explanation phenomena. So you can use the same maternal death simultaneously to highlight a problem and the factors around it. But at the same time, you can extend it beyond saying that, yes, it is possible to use it also as an explanation of causality. Similarly, when you do a study for policymakers, I would give an example of a very recent study. Last day only I submitted the report to ICMR on road traffic accidents and road traffic injury. Primarily, the study focus was to understand what are the challenges road traffic injury victims face on the spot we have divided it into pre-ambulance, ambulance, and post-ambulance phase. And one of the findings of the study has been that 108 ambulances, which are generally assumed to have a major role, is insignificant in transporting patients from the site of accident to the hospital, the first level of transportation, which in two urban sites, we have done the study. One was only 2% of the total ambulance commutation was used for road traffic related injury purposes. And in other site, it was only 7%. So when you look at it from your study objective, that was not an important, that was one of the important findings for us. But when you articulate for policymakers, what we realize is that for every state, there are more than 300 plus ambulances, 200, 300, 108 ambulances, which has entered it into a public-private partnership mode. And for there, what is happening is that per ambulance, the cost is something like 25 to 30 lakhs. So now imagine the amount of money going into the ambulance maintenance. And the purpose and one of the major objectives they all articulate is to provide services to road traffic injury victims during golden hour. So it's clearly countered, at least from the kind of data that we got in. So for a policymaker, it is not really a major purpose to focus on 108 ambulance and its role. But for policymakers, it is important to examine that. Let us audit the services offered by 108. What we are arguing is that 108 ambulance service only does transportation. There is hardly any medical intervention goes on in the realistic situation. What they are largely doing is referral services from hospital to hospitals across the country, at least in several states. So 1 or 2 states only we have done the study for, but that's also not an entire state, specific urban pockets. So your study was actually on something else, but something else came in between, and you frame it in such a way that it makes sense to the policymaker and it becomes an important area. So you have to tweak it according to the need of your audience. I hope I communicated that, because it's a little fast. I need to move because I can see the time. I don't want to fill into the time of others. So policymakers need to be at times given a various way by which you need to articulate how you want to communicate your research. It may not necessarily your main objective. It's fine. You can get a completely peripheral item that already emerged in your study, but when you articulate it, you need to articulate within the policymakers framing. There you also need a policy community-based understanding about what is going on around. That is something which is needed. Same way, when it comes to media, one of the original purpose of media is to translate information from the researcher to the general public. It's a kind of, again, a translation exercise was the original purpose when media did communication about research findings. It was mostly descriptive and not very popular, but later we can see that it became analytical, popular, and it's almost very similar to academic communication nowadays. There are various reasons for it. Maybe I'll take it up during the discussion time. And general public, as I always say, is that one of the best ways to change their behavior of any kind is to make them part of your research to the extent possible and try to converse in their language rather than they expecting to understand your jargons. So when you take them along, by default, you are actually making an impact. That's the best way one can communicate. You don't need to communicate as if you're communicating, but taking them along automatically will change them. If at all that changes an intention from your end. Or even otherwise also, they will also share their concerns, comments. So in the pros, it's more about socialization rather than communication. I would see it like that. Okay, now.
Dr. I have a question that, I mean, like you mentioned that it's important to articulate it in words which is relevant to the audience to whom we are articulating. But how do we build those skills? I mean, like if I want to communicate with a policymaker about something which is that I want to advocate for nutrition in TB patients, that why nutrition is important, or even in their family members, then how do I know what to say to that person?
Got it. So that is where the perspective, that's that for every audience, you need to know where the audience are coming from. What are their priorities, concerns? For instance, if you are communicating to a policymaker, you should be well aware about what is going on with respect to the ongoing TB policy, the program, the challenges, the ongoing implementation challenges, the financial allocation, so that you can use the same language and communicate with your policymaker. The same way, if you are communicating the same to an academician, you are expected to know the theoretical underpinning of the argument that you are making, the methodological challenges that you may come across, or the methodological limitations that you confront. So it is important that that diverse set of understanding is needed to communicating to the kind of audience you need. And it is not just about knowing the English language or other things.
Right, right.
So that is the perspective that one need to build. So only if you can communicate to policymaker, only if you know the background of policy context. And if you're not aware of it, it's very hard to communicate to policymaker with the same kind of language that you use it in academic circles.
Okay.
So that I would suggest that's the learning that we should have, and the expertise and skill is to be developed in that.
Right.
Yeah. So coming to the last part, which again I think, yeah. So do we publish to communicate? Do we really publish to communicate? Really? What do you think?
Sir, I think it's also primarily to increase our visibility in the space.
That's what. So most of the time, even several communication research also, it's actually when you communicate in the public mainstream media, your as a researcher's visibility is increased. But whether it really goes across to the larger community is something that we need to examine and find out. And that's an entire area of this whole called public understanding of science and media and its analysis. Those kind of studies always focus on that. So in publication, that is something one we should first and foremost accept and acknowledge that we are not, the only purpose of publication is not communication. There are different, and current politics of publication, if I started opening up, that itself will go in another session. So the platforms for publishing, and why I'm saying is that because not all publications are good communications of research. Bear with me, that's the reality. And nowadays it's very hard to say if an article comes in so-and-so journal, we can say the article will be good. It's very difficult. So nowadays we are only talking about good articles, not good journals and bad articles, or good journals and good articles. So nowadays it has become, there are a lot of politics of publishing involved in it. And nowadays it's also a lot of commercialization involved in this publication process, which we are, and it's a larger issue that we may have to discuss sometime later. So good research publications doesn't necessarily always contribute to have a communication beyond peers. That's also the other side. You may have excellent research publication, but its contribution more or less confined to that academic peers, and maybe within that, it may not even go beyond that. So these are all some issues which question about the purpose of publication. And I have to say that it is not only about communication, because it's a platform through which you communicate your results, that's fine. But then it's much more different dimensions are there when for publication. Sometimes it is for your upliftment of your career. Sometimes it is for increasing your visibility. Sometimes being in the collaborative partner with international agencies as otherwise, and several others. So there is a larger first world, third world collaborative efforts which always land up in publications as well. So the purpose is something which is completely different. And the forums available. We have official technical journals, online magazine, daily newspaper, new digital platforms. Now in all of this, the purpose of publication is slightly different. You have your target audience, because you have in an online magazine or even a daily newspaper, the purpose of you are almost conversing with multiple respondents or audience when you are publishing in the mainstream popular media. Whereas in an academic media, even when you all write PhD, when we all write at our times also, we assume that we are writing it to the guide. Poor guide may not necessarily wanting to get into all that, but the general sense that, yeah, a guide knows so that I don't need to elaborate a lot. But please keep that in mind. The PhD document that you are finally is for the larger public. Anybody who can read the language should be able to make sense of what you have written. You are no longer writing it to a guide or an expert group. That you can clarify at certain point when needed, but pitch it at a much larger audience so that one can publish immediately also in mainstream journal and media as well. because that's more important and I feel is lacking. So with that, I would have the last point on the distinction between, I don't know that I'm already short of time with journalism.
Sir, we had a third session planned at 3 o'clock. The designated speaker has not been able to arrive for the day. So we can sort of adjust another 5 minutes or so, sir.
Oh, sure. This is the last slide, yeah. So when it comes to journalism and communication, there is also another debate which always said, is it a journalistic piece and not a research piece? What do you think will be the difference there? How do you distinguish between a journalistic piece versus a research communication? We all generally, academicians claim that researchers are slightly above journalists in certain way, and journalists claims the other way around.
I would say that, if we consider that general public is also one of the audiences whom we are trying to communicate to. So I would say that journalism, it can be part of research communication also. If we put an op-ed piece or something in the daily newspaper about our research findings or our research problem, then it will be part of research communication, I think.
Yeah, so who will be benefiting from that kind of communication as the audience side?
People who are reading the newspaper.
Which is predominantly the policymakers, academicians, larger that circle, journalists, not really the public as we generally assume. Okay. Because if we are only giving a gist of it, most of the time it's very challenging to actually bring a research communication through a mainstream media. Because that word limit is like 750 words, 500 words, you're almost to say what you want to say. So finally, it may land up either as a compressed extract of a larger study, or maybe one aspect of your study you will discuss, then it is much more detailed and depth, so that even the larger public can engage with. When you do that extract kind of thing, which is not really helpful beyond the group in which they are interested in. So that's one kind of challenge. But further, I agree, so that journalism is part of research communication. But in terms of the rigor or any other, is there a difference further in the kind of stories covered in journalism?
Basically, with regards to journalism, there are certain biases when the journalist goes and collect. So it's not a very systematic collection of data. That's what I feel.
That's a researcher's
point of view.
Emic perspective, I would say.
Yes.
So I think that journalists will be much more rigorous maybe sometimes than a researcher in many of the communication. Yes. Yeah.
The tempo also quite often is guided by prose rather than structured information.
Yeah, so the rigidity and the rigor is something which is always contested. Obviously, that is there. So one is, I would say, the methodological claim. So the methodological claim is different from the systematic method that we use. When you say methodological claim, what I really mean is that now something has been found in one's case as one small story. What is the extent of projection or generalizability that you project, which may not be an intention for a journalist most of the time, though by default we read it. Maybe as researchers, when you read journalistic piece, you will read it. But the journalist may be interested in that specific case, not necessarily every time going for a extrapolation that we do it in research. But researcher is expected to explicitly claim that. That's one distinction which I can think of. This again, what I could think of, there could be variations, one can debate on it as well. So methodology will be used in both, but methodological claims is expected to be more in the context of research as compared to journalistic piece. Methodological claims, okay, if this is happening here, then it is expected that multiple events of similar kind is happening elsewhere, that a researcher is expected to say without saying. The same with generalizability, it goes together.
So imply that when we say journalistic pieces, they lack evidence, or how would you place it? Like
the point is that complete it if you have. Sorry.
The reason I thought of this is because when you're writing for both the sections, you would need some evidence to say what you're saying, right?
Yeah.
So how, to what extent are we making how are we making that distinction?
Yeah, the point I wanted to say is that the journalist may not be seeing and explicitly stating that, okay, I have come across with a case in so and so, in one site or in two sites. They don't want to explicitly state that if this is happening in one or two sites, because of the methodology, it can be found in several other sites as well. In a case study methodology, what we give a analytical generalizability says that as a researcher. Whereas in a researcher, when we write it, we are expected to claim that, okay, I have found so and so thing in some place. The immediate question is, so what? Which means that if maternal death is implied by several other factors in a tribal community, it is expected that in other tribal communities as well, there could be similar factors operating. This a researcher is expected to articulate in a much more vigorous way, which a journalist may not necessarily intend in the first place. It will have the same kind of extrapolation projection possibility, but the journalist may not really intend to do so every time, especially in the early phases. And now that is where the challenge comes. So that is where, yeah. So rarely journalists, and now that's also the legitimacy question, because the boundaries are very thin nowadays. It's very difficult to make a clear distinction. And journalists nowadays rarely ask for the proof, original data. And they used to. There was a time when journalists used to ask for original data and other things while publication, but nowadays rarely I could see. Maybe still that practice is going on in certain journals, but rarely that is seen. And finally, the increased subjectivity, which is attached to interpreting reality. So I just want to have this part. Flexibility in methodology is a necessity to address the diverse complexities of society, but that is not an excuse not being systematic or rigorous. Flexible methodology doesn't mean that, oh, it's semi-structured kind, that logic of as and when it comes, we will change the methodology. No. Flexibility in methodology means there is a flexible methodology option available. Still, your methodology and the research can be rigorous as well as systematic. Okay, I'll stop there. Sorry for the exceeding the time. And I think, I don't know whether we have time for questions as such. It was such a short time, actually, for half an hour when I realized, yeah.
Thank you very much, Matthew, sir. The fact that it spilled over itself is ample evidence that it was quite engaging, interactive, and thought-provoking as a session. We really thank you for putting up these questions to the audience, and we also thank participants for having actively engaged with sir. It's not every day that you get a speaker of his stature. So thank you very much, sir. I'm afraid I will have to sort of not permit further questions here because of paucity of time. But we will now, please feel free to reach out to Dr. Matthew further for any clarifications. We shall share the email IDs of the resource persons with you. So please feel free to continue individual conversations with Dr. Matthew ahead. So once again, sir, on behalf of IPH and on behalf of the organizing committee of the PhD workshop, a sincere, heartfelt thanks to you for your time and participation, sir. Thank you very much.
Thank you. Yeah, good to see you, Shilpa, after a long time. Yeah, it's always a pleasure to see old students. I think you are all in the yeah. Okay, I don't want to take any time. All the best, and yeah, we'll meet.
Thank you, sir.
Thank you, sir.
Thank you very much. We shall now move on to the second session, and I apologize for the slight delay over here, but since the session was going on quite interestingly and there was active participation, we felt that it is not proper to disrupt it midway. And now the second session will be handled by Ms. Shilpa John. It is my privilege to introduce her. Ms. Shilpa John has a master's in health administration from the Tata Institute of Social Sciences, Mumbai, and subsequently has over a decade's experience working in public health management under the National Health Mission umbrella. She was initially with the National Health Systems Resource Center in Delhi, providing technical support to state governments for capacity building in public health planning, including the development of district health action plans for various states. And she subsequently worked at the Family Planning Division of Ministry of Health and Family Welfare, Government of India,
providing technical assistance in the implementation and monitoring of the National Family Planning Program. Currently, she manages the operations, communications, partner engagements, and monitoring progress of the India Health Policy and Systems Research Fellowships Program, which is aimed at building the capacity of mid-career public health researchers in HPSR in India. So Shilpa, primarily because of her varied experience in dealing with policymakers, we have invited her and requested her to share her journey and her experiences of having dealt with policymakers in detail. Over to you, Shilpa, and apologies for the slight delay in commencing your session.
Not at all. Thank you so much, Sarin and the IPH team, first of all, for putting me onto this platform. Professor Matthew, I've been fortunate enough to have him as a professor during my master's itself. So it's indeed a privilege to be on the same platform as Sir. May I share my screen, Sarin? Yeah.
Yes, Shilpa. Yes.
Yes, I can. Yeah. Just a second. I hope this is visible.
It is.
Yeah. So hi, good afternoon, everybody. It's wonderful to be on this platform. At the outset itself, like Sarin has given a brief background about me, but what I'd like to say is that I'm neither a policymaker nor am I a researcher, but I have had the fortune of sort of having worked with both the sectors and sort of being an intermediary in between in my journey so far. Also to add on to what Sarin has said, I actually started out my journey with the Regional Resource Center for Northeast States, which is also under the Ministry of Health and Family Welfare. During that period, I was based out of Guwahati, and we were providing technical support to the Northeastern states. Post that is when I shifted to the National Health Systems Resource Center at Delhi, and then after that is when I sort of moved on to the Ministry of Health and Family Welfare. So just following up on what Professor Matthew has spoken about, I'll also make this presentation very brief, and the order that I had planned it was that I'll run you through the pointers and things that I have laid out, and then we can just open it up for discussion if that's okay with everybody. Just before I begin, I did get a sense of what everybody, what sort of topics you're working on. But just to have an additional information, may I know if anybody here amongst the participants has sort of engaged with the government or is engaging with the government, has worked with the government, or been part of any other advocacy groups, committee groups, etc. Smita, right? Smita, may I know? Please feel free to come on in. May I know in what capacity?
Yeah, am I audible?
Yes.
Yes, thank you, Shilpa. So not exactly like a capacity, but as a technical partner. In my previous organization, I was working with the government officials regarding the PLA scale-up. You might have heard about it, the Participatory Learning and Action Groups, which is ongoing in Jharkhand. So it's like a scale-up program in Jharkhand. So scale-up in all the districts and states, and training, giving a quality level of training to the Sahiyas, means ASHA health workers and ASHA facilitators. That was the main challenge, and usually bringing their capacity and simultaneously bringing up their capacities, especially for providing HBNC and HBYC care, and how they can make the communities aware about it, and building that platform. So that was pretty challenging when we are supposed to deal regarding the incentives of them, like timely incentive they should get paid for with the government officials, because the incentive thing, though it was accepted and PIP has it within the government thing, but getting a signature of that MOIC or civil surgeon timely payment, those were a little crucial part. And at the same time, getting the training done for training done, and allowing them for the now the whatever training they get, the meetings are over, and now we have to, and there are so many things which is actually Asha health workers are doing everywhere in whole India. So how we can make our part as a important, or explain them, explain them that how this part is helping the Asha facilitators or Ashas to actually reduce their other workload, what we supposed to call. So
Okay, great.
Thank you.
Good. I think Praveen also has said a yes. So what my reason for asking this was that, maybe once we open it up for discussions, we can have those who have. I think right now we have 2 people who have said they have experience of engaging directly with governments and partners in that sense. Yogesh as well. Okay, great. So, right, interesting. Shiva, thank you for, catching on to the slide. So I really love caricatures and, identifying with cartoons, etc. So when I thought of like making this sort of very brief presentation, I came across a few, and this was something which struck me. It doesn't mean that I adhere to this policy, but this is something, it's like a food for thought for you. Do you think the key for effective communication is sincerity, even if you have to fake it, which in the present context, present day context is sort of you really don't know who's faking it and who's not. And I did manage to log in for a very brief period in the morning where, the PhD presentations were being pitched. And there was this suggestion where, effective pitching of your topic is also reflected in the sincerity with which you pitch it. So that was just my intention of putting this up, sort of like a food for thought for all of you. So in the interest of time, I'll just move on to the key pointers that I have laid out based on my experience on my public health journey so far, and then we'll open it up for discussions. What I have done here is that I have sort of made this to 2 parts. One is about, sort of understanding the environment. And the second part is about where I feel, as to if given with my interactions and my experiences, to know how you can make your role more impactful. It's nice to see that many of you have, are also working with government. So a lot of you would also be familiar with these nuances. So feel free to pitch in at the end of the presentation. Some of the key things that I have felt during my journey is that it's very important to sort of, be very aware of what are the structures in the hierarchy within the government. So, we know that, this is the basic layout, there's a district level, a national level, a regional level, etc. But the kind of things that go on at each level is so different, yet they are supposed to be synthesized together and work together as a system. So when I started out at the Regional Resource Center, I was all gung-ho about, oh, this is what I have learned and this is what I bring to the field, and this is how I intend to make a change. But in more than more number of cases than I can count, it has always been the opposite, because we realize that it's always that sort of sense of mutual collaboration and the partnership that we have to get into to get things actually going. That really is what actually gets you to get things done, or gets you to push things to make them happen, or to have them bring fruition to your thoughts, etc. So when I was posted at the regional center, from there I was posted to the state health mission, and I still consider my greatest learnings to be there because of my frequent interactions with the district level officials and with the district level players who were involved in whatever planning or implementation that we were engaged in. After that, I moved on to the national level. And then again at the national level, I was associated with the National Health System Center, Resource Center, which is also a part of the Ministry of Health and Family Welfare. So even there, we would always consider ourselves as, being, providing technical support to the Ministry of Health and Family Welfare. A lot of times, perhaps naivety now when I look back at it, but a lot of times when we used to sort of think, we'd be like, inside the ministry, it's all about, note making and files and I don't know how things get done, etc. This was all until I moved into the ministry myself. So sort of like, moving out from the frying pan into the fire kind of situation. The point that I want to make here is that please be very aware of the kind of structures that are, in your ecosystem. So whether it's with respect to the study that you are, the whole topic that you are working on, because you'll be so much into your PhD work and everything, you're so rooted into your own ecosystem. Do be aware of what are the other things that, sort of coalesce and come together to make it what it is. Another thing is that those of you who worked with the government or, seen this at close sort of quarters, you would realize that, there is a need for gathering information very quickly. It has to be effective. There's a very highly charged sort of working environment. Of course, there's a lot of file work, like I mentioned, you have to put up notings, you have to put up justifications, you have to come up with data and evidence to support your, things that you're putting forth on the files, etc. So these are all linked to sort of how you want to make a pitch if you want to engage with the policymakers, going by my experience so far. The other thing is in that environment, there's a lot of multitasking happening, because you're meeting with multiple stakeholders. As you know, a lot of us, in our profession, times managing routine administrative things during the entire day, that you sort of don't really get time to do the actual meat of the work, where you want to sit down, think, you want to write, you want to put down your thoughts. So there's this is a constant sort of atmosphere that is happening over there. The other two things that I put out here was also about guidelines and policies, etc., which are being drafted. There's a lot of work that is happening in this sort of environment, and it's very easy when we are on the outside to say, oh, they have brought up a policy like this, or they have put up a guideline like this. But what is important to understand is that they don't just come up overnight. There is a lot of thought that does go in, because there is a lot of justification that you have to also sort of, give out. And these policies, they usually start with, usually the standard, this thing is that they start with your expert group consultations, where you have expert group members who come in, give their, opinions on whether the government wants to take something a certain way, etc. And then, of course, there are a lot of interdepartmental consultations. So within that hierarchy itself, so if you're talking about, like, say, for example, some intervention in the maternal health division or something in the child health division, but it has repercussions on, say, the reproductive health component, or it is interlinked, which is what we always try to say when we're talking about health as a whole collective system. So there are a lot of interdepartmental consultations also going, and in a lot of cases, interministerial consultations also. So, whether you want to get in your the Ministry of Education into it, whether you want to get in some other, like, for example, during the whole COVID, when the whole COVID scene exploded, there was this whole thing happening about the oxygen, supply of oxygen, etc. So we were all part of the, liaising groups where we had to interact with states and ensure that, the oxygen quantity that is available with them is sufficient, etc. So that involved us taking on board the Department of Industries and Petroleum, etc. So you have a lot of these consultations also which go in where, when these guidelines or policies come about. So this is just a sort of a very basic gist of what the environment is. Just to say that, just to emphasize that it is something where you have to really keep being on the go. There is a sort of I think sometimes like somebody mentioned earlier during Professor Matthew's this thing, sometimes it's so difficult to communicate with your own family members, right? So a lot of people would say, oh, you work with the government, so you must be having it really easy because who works in the government is something which is which is very commonly thrown at us, but it's quite the opposite in my experience. And this is the second part. If we had more time, I think I would have opened up to sort of, getting in more experiences from amongst our participants who are currently working with government or have had earlier experience. But what I'll do is I'll just finish these pointers that I have put forth. In my opinion, making your role impactful. So you are deeply entrenched in your PhD. You know that you're working on a certain area, or you want to sort of you want to bring forth certain findings out and interact and be able to communicate. These are the key things that I think is what when we used to work with our deputy commissioners or with our joint secretaries, these are some of the key things that they look out for, right? First of all, you're bringing evidence to the table. I can't tell you the number of times that we would have to run helter-skelter, like if we need to pitch for something, or we know that something is happening on the ground, or this is what we need to put forth and get something going, or at least even get the sort of group together to even deliberate upon it, creating those background notes. So we are constantly looking for this, right? So be very clear about the kind of evidence that you're bringing to the table. Do your homework. I cannot emphasize on this enough, because like Professor Matthew mentioned, it's very, very important for you to know, be aware of who are all the stakeholders and all the supporting sort of say actors who would have a role to play in your particular field. So for example, if you need to look up, say education department policies, or say, any other associated this thing. So if it's nutrition related or Anganwadi center related, you need to be aware of who are all the other stakeholders who are, relevant to your study area. And also, of course, of the established organizations or institutions who are working in this area, who have already been sort of, working on that area, etc. Because we need to remember that the policymakers have at their disposal, a whole range of people, experts, organizations that they can reach out to. The other thing that I thought is important is that, how do you see yourself, whether are you bringing the perspectives from the community? Are you going to bridge that between what the policymakers' intentions are? So, in a majority of the cases, the policymakers, and I don't just mean the bureaucrats, right? I mean from, say, for example, so if it was the family planning division, we have our deputy commissioner, we have the additional commissioner, then we have the joint secretary, and then after that is the mission director, etc. So, a lot of times we would see where, groups would come to meet say our deputy commissioner, and they would say, look, we have this particular research finding. So for example, in family planning, they come and say, your contraceptive uptake, your majority of your beneficiaries are women. So the constant thing that they would say that our from our end would be that yes, we are aware of this fact, because we are also involved in constant monitoring of the data. We know that this is there, but if you come with a study where you're suggesting possible solutions, and you have a very clear cut sort of concrete sort of way to go forward with it, those are the things that really catch their attention, and like I mentioned, notings, things which they can sort of use as a evidence. They can quote that, look, this is a study which sort of highlighted this thing, and we think that this should be taken up in this. And these are kind of the things that they look out for. Tapping on the right opportunities at the right time, this is also very important, because even despite being within the ministry itself, it would be, and despite officers being available to us, like we did have the privilege to sort of be able to approach them. So our commissioners or our technical officers could always go up to the bureaucrats. But we also need to understand that so for example, during this whole COVID thing, everything is taken up by COVID. There are not enough number of hours in a day to complete all the tasks that have been set up. Or for example, there is a prevailing environment where it's all about elections and things like that. There are a lot happening. So also you also need to be aware of what kind of opportunity the system is throwing up at present. Is it really geared to accept your findings and your suggestions that you want to pitch for? The next thing that I wanted to stress upon was, the quality and the reputation of institutions that you're affiliated with. This does matter a lot. So, and this is something which policymakers themselves emphasize upon. It is much more likely for them to say, I don't want to make controversial statement, but how do you know that they might not go to, say, a government medical college, or to some expert in their own arena, or call experts from organizations of repute. So for example, if they really want technical guidance on so I'll just like if for example, we had introduced injectables as a contraceptive in the basket of choices which are currently there. Now this evolution itself is an interesting story, because it took a long while for it to come about, almost, if I'm not mistaken, 20 years in the making. The discussions and everything that came up on that. So we began with an expert group consultation, but the people that you reach out to are, of course, your standard, the institutions of repute, government medical colleges, AIMS institutions. Those are the people from whom you get your resource people, right, to form that initial expert group consultation. So it does really matter as to, which kind of institution you're affiliated with also. Those of you who might not be working with them, but in the later stage also, how organization, that also is something which you will come up with if you get to interact with policymakers. Another thing that you need to have is the capacity and the ability to answer questions. So you really need to be able to be quick and think on your feet, sort of. So this is also linked to the last two slides. You need to be able to be to improvise, and also the most important is that you need to be able to communicate in the shortest time possible when you're engaging with policymakers. Involving officials across all levels is something else that we think is important, because it's not just about going straight to the top, or telling a bureaucrat who's sitting at the national level that, look, these are my findings. But yes, of course, right from, because you are invested in those findings right from the from your study area. So right from the officials who are involved at that stage to taking it up to a larger scale as you would want to. Be prepared with your documents, including multiple versions of your findings. So this is linked to what Anika was sort of asking. How do we know what we, how do we write it to suit it to a policymaker's thing? keep yourself updated. That's my big suggestion. The NHM website, the Ministry of Health and Family Welfare website, their social media platforms, their press briefings, their press releases. Look at how they write, look at how they document, because having been on the other end where we used to do that, they want these facts simple and jargon, like Professor Matthew said, the methodology and all those things where you use technical terms. That's good for the academia, but with the policymaker, you need to have that in place, of course, but you need to have it lay out in a more simplistic fashion. So all I can say is that, preparedness, diplomacy, and good judgment is what will sort of, make you see through the day. The very last slide here, the key takeaways that I feel, time management is very, very crucial. Many times, if at all you get the opportunity to engage with a policymaker, you need to know how to, be able to pitch it in 5 minutes or 10 minutes or 15 minutes, whatever time you get. Clearly laid out processes and timelines, right? So your study or your work should have these clearly laid out. This is what, you must understand that if you want to put it out to an administrator, you need to show that these are the processes that you envisage that will happen. These are the timelines that you think will be adhered to, and if at all you think it is a thing of scalability, right? Even the government doesn't, they never just roll out everything without doing a pilot or having some sort of basis behind that. Indicate your potential risks and challenges. Show that these could be potential areas where there can be a pitfall. Show concrete results. That is what gets their attention most of the time. I've already mentioned avoid jargon and data overload. So of course, don't use too many images also, in my opinion. Use images which can be impactful and have real life implementation examples. Give a comparison, a comparative sort of this thing, lay out a comparative in the sense like, vis-a-vis the global and the local situation. And also it will be nice if you can sort of put out, what kind of stakeholders, partners, etc. would be required to be included. If you have a certain way forward, who are the stakeholders and partners that you think would be, important to be engaged in? So they like to know that upfront. Funding, of course. Even if you don't have an exact idea, just a ballpark thing that, you think that if you could fund a project for this much or, for this kind of I think it gives them a sense of, because after all, they know where to pull things from, which bracket to take it up from, etc. Multiple types of documents. This is my very last point, but I think it's the most important point for me personally. I cannot sort of emphasize less on the number of versions that I have made of the same document, whether it is to give out to our IC division for media briefing, or whether it is to be sent to a, to the joint secretary for their this thing, or whether it is for our own, our immediate bosses who are more technocrats, in the sense they are themselves from, they are the program managers of that particular program. And that also sort of answers the question that Anika has posed, how do you convey your research to politicians? Public health is political after all. I think everything, it took me also quite some time to realize that, I had zero interest in politics, but there is no space where you can evade this, right? So we go back to, it's something which has also been a realization for me. So when we put things to the politicians, so what happens is, at least in our hierarchy, right? So when we put out a noting or we make a brief document, we put it up to our deputy commissioner, and then they give us guidance on like, okay, this is missing or that is not missing. Then it goes to the bureaucrat, and then they give us guidance on, a lot of other admin requirements, etc. When it finally goes to say the politicians, politician in the sense I'm referring to, like, say, if in our health ministry, if it is the health minister, they will focus on very, few things that they feel is important: scalability, sustainability. These are some of the common things that they focus on. right? And of course, the greater benefit of the people. But having said that, I also feel that, really the administrators are the ones who really make that pitch to the politician. So whether a policy makes it or doesn't make it is also very, it somewhere also boils down to being very individual driven, but as part of the whole system, that is what, in my opinion, we all as individuals is what we make up the whole system, right? So, we're just a cog in the whole machinery. So I think in tandem, that is what our experience has been. The kind of policies that saw the light of the day were the ones where, sort of in tandem, we work together with all the stakeholders, and having the support of our technocrats, bureaucrats, and then subsequently pitching it to the politicians. So I'll stop with that. I'll stop my screen share. Because I think I'm a little blinded with the whole screen being taken up with my presentation. I think we're already at 3:18. Sarin, do we have? Can we have interactions?
Yeah, Shilpa, thanks a lot, Shilpa. What we'll do is we have just about 10 minutes, roughly, actually less than 10 minutes. So what we'll do is we'll just open up for interactions. And if we do not have many questions, then perhaps you could also give a little bit of anecdotes from your own journey, having worked with different projects. So we'll just open up for questions, if any.
So I saw a few others who have been part of, I think Praveen mentioned, and Yogesh also mentioned that you've been part of the government mechanism. So how much did this resonate with you, or if at all?
Yeah, Shilpa, this is Dr. Praveen. So I'm speaking from Guwahati. So I quite well resonate with, you have worked with regional NRCs with Mr. Ashok Babu and then a lot of other bureaucrats here. And then I'm currently associated with UNICEF Assam here, and then trying to help NHM in better implementation of nutrition mission over here. Yes, you are absolutely right. Because I having experience of researcher as well as implementation manager. For me, it was little difficult earlier, to convince these policymakers, because I used to use a lot of jargons, in terms of research paper and all. Every time they used to say that, hey, come on, Praveen, we know this. Tell me the solution, what needs to be done. And then, for a researcher, solution would come always from either from a discussion part of a research article or from the conclusion part and the recommendation part. And then when you start speaking those recommendations to them, it doesn't make sense. You tell me what suits best in my situation. That's how I somehow learned to, articulate as well as, communicate with these policymakers, be it the secretary, joint secretaries and all. So, in that sense, it's quite relevant. And then it's very important for a researcher also to meet these bureaucrats often and then try to understand their language, how to speak, and then how do they try to implement the programs. I think, the experience only teaches, it's nowhere written in any book. So, that's what from my side.
Absolutely. I completely second that. Because, if you're fortunate enough in your areas also, I don't know if I should really say fortunate, but if you have structures like, say, state health systems, resource centers, etc., reach out to them, connect, network. I also was never a person who would really be very, I'm very social, of course, but I'm not really out there on the scene as such, but it really helps to network and, to have as many inputs that you can have. You would have peers, those of you who do not even, don't have any experience of working with government also, you would have peers and, your fellow, whether it's batchmates or friends, whether it's over a cup of chai that you're just discussing things or the environment or, how things come about. That also is like very, very, enriching. So I would really encourage you to do that. That is something which has really helped me take this journey forward also. Thank you, Matthew sir. It's always a privilege. Bye. So anybody else who would like to ask anything or, have any inputs onto this?
Hello, ma'am.
Hi, hi.
Ma'am, when we are interacting
Please don't
with
call me ma'am, just call me Shilpa, yeah.
okay, when we are interacting with the policymakers, there will obviously be certain level of resistance, probably, right? So how do we navigate the resistance part from them, or how do we make ourselves? How do we break through that resistance if they are not really keen or interested in going ahead with this topic or whatever we want to talk about?
Yeah, so I think I don't know, somehow having worked within the system in that sense, I have not really ever, I mean, I don't know, resistance. Have you encountered resistance in that sense, like where they're not ready to listen to you, or they say that, okay, yeah, this is fine, or I mean, this, we all know about these things, etc. I wouldn't really, yeah, sorry.
From what I have seen is they will share their insights, but probably when it comes down to exact details, I want to ask, there one blocker comes, no, it's okay, this is fine. That is how I have been facing. Like general conversations, yes, they are okay. When it comes down to really understanding the specifics, it becomes a block over there. So that is something I'm finding difficult to break through.
So one thing is, I think, also you have to realize that sometimes, maybe they're not at liberty to sort of, give out that particular information, or what exactly, that you're seeking. Because like I said, as a system, they have to work within that. So in that case, I have always found that, being aware of, like I said, check up, keep looking up these websites, the government websites, the documentations, etc., that they keep coming up with. So when I was working within the government, of course, we have to constantly come up with, so for example, somebody comes up and says, no, this is, so family planning is something which has always been very controversial. So something like, they say, oh, this is a coercive thing, or this thing. Our standard thing is that nowhere in our documents, nowhere is it mentioned that this is something which is meant to be taken up of their own free will, of their own this thing as a policy. There is no nowhere that this is sort of put out. So we cannot that's like our standard response, right? In order to overcome resistance, another thing is, like I said, I think in this day and age, we are really fortunate to have a lot of platforms, okay, available to us. So I would suggest that, I've met a lot of candidates also, like whether it is researchers or even other people. Not everybody is on social media or, Twitter, etc. But those things do catch the attention. Newspaper articles, for example, they really catch the attention, So if you have other ways of of getting your things through in that kind of, communication platform, it's not just about like Professor Matthew said, like you publish something and then, have it, you think it'll land up at the attention of, say, a policymaker, etc. So I would urge that you use social media platforms. Like for me personally, I'm not somebody who's very prolific with my tweets, but I am on Twitter to follow everything that's happening around me, right? So that I know what is happening. But I think if you want to make a pitch for it, I would really urge that, you explore these options also. I don't know if that helps.
Yes, thank you.
And communication at the end, it's about, I mean, you might keep getting resistance, but it's also about being persistent. So I've seen that a lot of people who actually get through are the ones who are the persistent ones, who keep bombarding you with, like, whether it is in the form of an RTI or anything else. So yeah, that's
Shilpa?
Yeah.
Sorry to interrupt, Shilpa. I think we'll probably look at winding up now. I see there is a hand raised by Yogesh.
Yeah,
There is a
Yogesh,
quick question, and perhaps we'll just open up and then wind up.
Yes, absolutely.
Yeah, just to ask the question, answer to the previous one, I think it's also, it's a two ways you stand. Either you stand, keep foot in the government and work with them.
We are unable to hear you.
Hello, hear you now? Yeah, it's better?
Yes.
So I see in two ways. As a researcher, you are working within government, or you are stepping out and see outside as a means as an outsider. That's how official sees you. If you are within government, so they have a trust on you. It's also building on the trust. If you are outsider, you have to create that trust and within them. So that's what it works. In our example, like constant visit to them and update them what you are doing. So frequent visits. So it's also trust on our knowledge, our capacity to the government officials helps a lot. Yeah.
Absolutely, absolutely. Thanks for pointing that out, Yogesh. This is very important, actually, And also, in what way can you help them? So, supposing they reach out to you for, a lot of times, this is again, like I said, like when I was stressing, that you make multiple documents and multiple this thing. When we reach out, and I'm not just talking about, this is not just about researchers, whether we reach out to development partners or anybody. A lot of times in my memory, those people who still remain in our in our sort of memory and recall, etc., are the ones who really came to literally our rescue. Whenever you have to prepare something, like I mentioned, so constantly engaging with them, saying that, look, I'm ready to get this for you or prepare this for you, really like sort of putting yourself out onto the field sort of thing. And also, I think it's also linked to, the kind of, I don't know if you're approaching them as an individual per se, how much this thing, but really being associated with an organization or an institution really, really, sort of helps you pitch that stronger. So as Yogesh said, that is very, very important. There's a much more likelihood. So for example, like I mentioned, when I was in RRC, when I was posted to the NHM Assam office, there's a 90% likelihood of them accepting me because I have come from that within the system, right? So yeah, that's all. I think we are bang on time, 3:30. Over to you, Sarin.
Yeah, many thanks, Shilpa. Many thanks for a very interesting session and also quite pointed directions towards communication that you have sort of emanated from your own journey and experiences over the years. So quite interesting. Really thankful to you for sparing the time. And I also want to inform the participants that we had in fact envisaged this as a 3-sub-session thematic session. The third session was supposed to be handled by Dorothy. Unfortunately, Dorothy has fallen ill and is unable to conduct the session. So in fact, yesterday late evening, I had reached out to Shilpa seeking her help if she could help in steering this third sub-session, and she had very kindly consented, absolutely, just blindly consented, purely. But unfortunately, I think we are now tight on time and we have other sessions coming up, so we cannot disturb the other speakers, and we have promised them their slots. So we'll have to unfortunately drop this third sub-session. But many thanks, Shilpa, for your insights and for arriving here today. So I am officially taking this opportunity on behalf of IPH and on behalf of the organizing committee of the workshop to express our heartfelt thanks to you. Thank you very much.
Thank you so much to the IPH team. Thank you, Sarin, and thanks to all the participants. Do reach out if you have any queries, anything at all. Feel free to call me up anytime. Thank you, and wish you all the best on your PhD journey. Yeah, it's quite a task.
It was a wonderful session.
Thank you. Bye, guys.
Thank you, Sarin and Shilpa, John, for the wonderful session, and it was really engaging from both Matthew. Thank you so much. We will really want to be connected with you and see how we can take your help. Thank you. So, dear participants, already resource persons are inside the house, but then we request them to wait for 5 minutes. Meanwhile, we can have a 5 minutes quick break, and I request you to come back exactly at 3:35. So, Anika, could you please request the resource persons to wait for 5 minutes?
Yeah. Hi, Dr. Rakhal, and hi, Sapna. Welcome. So we are just taking a 5-minute break.
Sure. No problem.
Hello, Dr. Rakhal.
Hi.
Hi, Professor Rakhal. Sorry, I haven't quit yet. I'll just leave in a bit. I have to attend.
Yeah, no problem. Yeah, hi.
Dr. Rakhal and Sapna, just checking in. Would you like to share your screen while presenting, or we can also do it from our end?
Anika, yeah, if you want, you can do, because I have not made any changes in the presentation. So.
Okay, sure.
Yeah, I mean, either way is okay. Or I'll just share it so that, yeah, okay. If you can share it, yeah, so that makes less confusion. I've also not made any changes.
Okay, sure. Then I'll ask the team to share.
Yeah. And you can take more than 5 minutes, yeah, please. If you need to for your break, this is important. Don't worry. Take your time. Hi, Sapna ji. How are you?
Hi, sir. I was reading the structural violence paper. That's so amazing.
Which one? The Paul Farmer?
Because I also had this larger question, like we talk about all the problems, but how to sort it out? I mean, in terms of structures, what we can do. So that gives answer to my questions. Yeah.
Let's see. So I'm just putting off the video for a few minutes when they all come.
Yeah, welcome you all after the break. I guess we had a very short break, and we're sorry, but resource persons are already in, and we could be in the session. So the next one is very interesting. The topic of the today is a very relevant topic. Science, which doesn't exclude anyone, whether it is in the base of gender, race, sexual race. It must be inclusive to everyone and must be accessible to everyone. That's a very relevant topic of discussion. And we look forward for the session on a very interesting debate on inclusive science. To facilitate this session, I invite Dr. Anika Juneja. She's a medical graduate and she has specialized in public health and worked in Adivasi rural districts of Madhya Pradesh, Chhattisgarh, Jharkhand, and Karnataka. Currently, she is a PhD student at IPH, studying on neighborhood disadvantages and access to healthcare in Adivasi communities. Thank you, Anika, for taking up the role of facilitation. And with that introduction, I hand over to you. Thank you.
Thank you, Shivanand, and welcome everybody to this session. I'm actually grateful to the coordinators for this PhD workshop, especially Shivanand and Ketki, who have come up with this topic, which is very dear to me, I think. And I think it's very important to have a discussion on this topic, as it creates a space to have conversations about diversity and inclusion within research science and reflect on issues such as co-creation of the research process and co-production of knowledge being created from the research process, especially when research involves marginalized communities as research participants. And I'm also very happy and thankful to have Dr. Rakhal and Dr. Sapna as the resource persons for this session, keeping their creativity, thinking, and experience in mind to contribute to this session. So a brief introduction to the resource persons. Dr. Rakhal Gaitonde is a professor of public health at the Achyuta Menon Center for Health Science Studies of the Sri Chitra Tirunal Institute of Medical Sciences and Technology. He completed his MBBS from Government Kilpauk Medical College and MD Community Medicine from CMC Vellore. Subsequently, he has worked with NGOs implementing projects on community-based accountability and governance of health systems, including NRHM in Tamil Nadu. And he has recently completed his PhD in public health from Umeå University in Sweden, after which he has joined as a faculty at the Achyuta Menon Center, where he teaches social determinants of health, health policy, and health economics. Dr. Sapna Mishra, a PhD, she's a public health graduate with PhD. Her doctoral work explored the occupational health of workers engaged in e-waste processing in the unorganized sector of a South Indian city. She approached this problem from a sociological perspective. She is working as a part-time consultant with the sexual and reproductive health matters in the area of rights-based knowledge creation. She has also been selected for the India Health Policy and Systems Research Fellowship, the first cohort, and her interest areas include occupational health, health policy and systems research, philosophy of research, rights-based research, and sexual and reproductive health. So a bit of context about the audience today for our resource persons. So we have PhD students from different institutes and who are at different journeys of their PhD. And since morning, we've had different sessions on pitching our own PhD topics, then post-PhD speakers reflecting on their journeys, the challenges that each of us have faced in our journeys till now, and a session on communicating research to different kind of audiences. So a brief layout of the session, we'll have an introduction and setting the floor by Rakhal, followed by a presentation of 2 case studies. And then in the end, we'll have a question and answer session. So you guys can type in your questions in the chat box and we can start. Shivanand, can you present the slides for Dr. Rakhal? If that's possible, or else I would request him to present directly.
Yeah, I'm fine either way. Shall I just present?
Yeah, I think that's okay.
Okay. Yeah, is my slide visible?
Yes.
Okay, great. Okay, so first of all, thanks very much to IPH and the organizing team for inviting me and Sapna to give this talk. I won't claim in any form or sense that I'm an expert or I have very much to say in inclusive science. But what I can say is that I have been trying within the extent possible of my particular social position to try and explore what an inclusive science would be, and what I'm sharing with all of you along with Sapna is basically a journey, okay, rather than anything that is a final word, as it were, on this topic. So first of all, I would like to start this lecture, this session, by acknowledging my special privileges of being an English-speaking, English-thinking male with education, with access to education, with access to the best education systems, both having class and caste privilege, and this obviously leads me to a very sort of is almost esoteric sort of position right at the top of the pecking order. But it is from this positionality that I have tried to explore what it means to have privilege and what it means to seed that privilege during research. I also acknowledge that I am still learning about the type of privileges I have and the way that those privileges affect the legitimacy of my research. This is still an ongoing process, and I don't think I have, done very much. So I'm merely sharing with you all the journey I have had, we have had so far. So in that situation, I see this presentation, and I would urge you all to see this presentation more as a state of our art rather than a state of the art. And I do hope that if I make this presentation again in maybe a year's time or some more time from that, I will have actually learned more, and this presentation will look very, very different. So with all these caveats, in place, I thought I would first, give a brief background on exactly where we will be focusing today before then, actually starting the session. So first of all, when actually Anika approached me about doing this session, we had a little discussion on what exactly we would be focusing on, and there were actually at least 3 or 4 different possibilities that the word inclusive science could mean. And broadly speaking, I had asked Anika if we wanted to focus on ways of doing, in terms of data collection, approaching communities, doing disseminations, and so on, or to focus on the ways in which we analyze the data. So in terms of co-creation of data, co-creation, co-analysis of data, the co-creation of, for example, categories and so on. Given that this is a 1.5 to 2 hour session, obviously it would not be possible to do both. And based on the feedback that Anika had, I think a discussion with the other members of the group, it's been decided that we will focus this session on largely on the analytical sort of way. So the way we have deployed science or scientific thinking to the research that we have done with individuals from marginalized communities. So with that sort of introduction and focus, done with, I wanted to start off this session by first asking from the audience, from all of you who are here listening to me, on what are the type of questions that you are grappling with. Okay. So when you ask for a session on inclusive science, or when you are coming to a session on inclusive science, what are the type of questions that are troubling you? What are the type of questions that you feel would be interesting to answer? Okay. Now, I thought it would be useful to just go through this exercise just to get the various topics or various areas on the table. Not, of course, promising to answer all of them, but at least attempting to engage with a few of them. So I would urge maybe a few of you, 3, 4, 5, how many ever, to just, unmute and please, Meena, I see your hand up, and maybe just, I know all of you have done multiple introductions, but at least for those of you who are speaking, if you could just very briefly tell me, who you are, where you are, and I have the list, so I'm familiar with the different institutions you come from and so on. Yeah, Meena, please.
Yes. Hello everyone. This is Meena Putturaj. So I am a PhD student in the 3rd year. I'm exploring the implementation of patient rights in health facilities in the context of Karnataka. So I'm I'm halfway through my PhD. I've almost completed my data collection. So one question that I was grappling was, of course, it's very easy to do research on the oppressed, marginalized, vulnerable communities. But when it comes to patient rights, especially, I find it very difficult to ask tough questions, to speak truth to the power, walk into the corridors of power and question the policymakers. Often that is not possible. Research on the powerful actors is very difficult than the research on the oppressed and marginalized. This is one question that is constantly running in my mind.
Sure. Thank you very much. Would anyone else like to jump in? Yes, Smita.
Hello.
Hi. Yes, Smita, we can hear you. Yeah.
Yes. So I'm Smita. I'm here right now at Rewari, Haryana, Sangat. I joined Sangat recently, and we are here looking for nutrition, psychosocial, and environmental determinants, how they impact on child development. I'm about to start my PhD, so I'm still juggling with the my research question, like what it needs to be and how I am. I don't know. I'm still into very much in the initial process. But yeah, I wanted to talk right now about my previous experiences, like when I was working with Ekjut in Jharkhand, like being a tribe, like working in the tribal state, and right now I am here in Haryana in the it's completely different state, and but in still in rural area. So that is one of the challenge right now I'm facing, and thinking in a researcher's perspective and previously being implementer. So this is like all two different things. But at the same time, as already Dr. Meena pointed out, like asking a question to the powerful people, or in that sense, like who are more aware about their own rights and regulations. At the same time, like I am right now thinking about the research in where I'm involved in. So more about the household, like mothers in Haryana, they won't allow much to women to work or being a bread like earner in the family. So this unpaid labor, and if we are going to ask the questions to them, what kind of like putting into their shoes, like thinking empathetically, how what kind of information they need to get get it back when we will do the dissemination in that per se. So I'm juggling into those things till now, like what kind of sort of questions I need to ask so that I'll be authentic to give them that information back. So yeah.
Yeah. Okay. Thanks. Thank you. Thank you very much. Anyone else? Couple more.
Yeah. Myself, Shivanand here.
Yes. Yes.
So yeah, I'm basically doing the research with the traditional medicine, and how could the use of traditional medicine enable self-reliance in primary health care. So here, one of the challenges that I find is the knowledge that is being existing in the community, which is experiential knowledge, and most often that is not reflected in the policy document, or that also will not come. While we interrogating to participants, there's a lot of knowledge that is existing, and then that is a part of healthcare as well. And how do we navigate such knowledge and make a part of the science is something that challenging. Evidence versus practice, whether the practice-based or evidence-based is I find that is a very challenging task to convey. How do we can? Yeah.
Yeah. Sure. Thanks, Shiva. One more or two more or. Okay. If anyone wants to jump in, please do. But since there's been some silence, I'm assuming that people would like a little more time to open up. So thanks. I think the sort of issues that were put on the table, I think are quite important in terms of the sort of issues that researchers we face. Especially, recognizing the power hierarchies that are there in society, right? So not only, do we as individuals have a certain power as researchers and resources behind us, but also the research we do and the research we take to places, also those places in which we disseminate, in which we present, in which we analyze themselves have certain sort of, embedded inherent sort of powers which we need to engage with. And how do we do that? How do we navigate this, terrain of, different powers? So exactly. And this I hope will be something, that we will, try and engage with in this session. I will maybe just now jump into the presentation, and I do encourage anyone who wants to clarify a point I'm making, not to wait for the end, but just to raise their hand, or if I don't see your hand, please just unmute and please speak up. Secondly, I forgot to ask, but I do hope that English is okay as a language. I can handle a bit of Hindi and Tamil, and I'm sure Sapna can do Hindi also. So just to the organizers, is English okay with everyone? I'm sorry, I should have asked before.
Yeah, that's how we are running the session, sir.
Okay, great. Thanks. So in case anyone wants a translation of a word I use, I hope I won't use too many jargonistic words. Please stop, and I'm sure we can, within the group, figure out adequate translation for you. So what I thought then, we'll just start off is that what I will be doing today is reflecting a little bit on some of these issues in research that crop up largely from a social science perspective to what is largely a biomedical or a very so-called a modern rationalistic approach or so-called objective approach where everything is reduced to numbers and regression equations. Now, when you want to move into the worlds of oppressed and marginalized communities, then obviously numbers have a very important role, but have a limited role, and that is where we see the entrance of, or the importance of, social science approaches. And what I'll be focusing on in sort of my talk is what does this social science understanding or social science contribution to the study of health and disease, and obviously then to the research on health and disease. The second point is, I think, the reflection on the fact that research participants, people who we do research with or who participate in our research, are embedded in contexts. So as Smita mentioned, it's a hugely different context from, say, Jharkhand in Ekjut, where you are working with Adivasi communities with their own specific power hierarchies within their system, but probably much more gender empowerment or equality to an extent, compared to, say, for example, the situation in Haryana, which probably has a much more stifling gendered context. So obviously what a woman would say in Haryana and what a woman would say in Jharkhand probably means quite, or needs to be looked at in very, very differently. And that is what social science talks to us about, the embeddedness of individuals in their contexts. The third point is this reflection on our own power as researchers. So actually speaking, there is a huge power that we all wield, because whatever our research participants may say, ultimately it is what we record. It is what we write in our research paper that becomes the truth for that particular process. And that is a tremendous power, and which can be misused, which can be used well, but all said and done, it's a power that is important for us to acknowledge. And then, of course, is this whole issue of the social determinants, the societal determinants, and what are now called the social determination of health, in terms of understanding the way, the mechanisms in which, or through which, the context actually plays on individuals or impacts individuals. And of course, related concepts like structural violence and embodiment, for which I have circulated a couple of papers, which I hope you will read with and engage with those ideas. But this is just broadly setting out, the sort of context. And what I will now do is move on to a story that I often use Sorry. So, so the story is all about a patient with tuberculosis, and this is about this happened to me while I was doing my MD in CMC Vellore, where there was a patient with tuberculosis, and we were in charge. The team that I led was in charge of actually treating this patient. Now, of course, we made the diagnosis based on sputum positivity, and the nurse went and started the patient on anti-tuberculosis treatment. And of course, about a week later, about a month later, the nurse comes back to me, the field worker comes back to me and says this patient has stopped having his medicine. I then asked the supervisor to go and give him quote unquote, health education. That's what we do. And the week later, I get a report saying, no, we gave him health education. He still hasn't started his medication. I then sent my junior, the intern in the department, to go and give more health education. And a week later, we found it was the same he wasn't having. So then me, the great doctor, actually went to his village and stood outside his house and said, boss, can you help me understand why you're not having your medication? And he told me, sir, you're not going to understand. Then I, said, no, try me. I've come here, from the hospital. I'm trying to understand. So I went through my checklist, right? So first I asked him, do you know what disease you have? So he said, yes, I have tuberculosis. So I asked him, do you know how many months the treatment consists of? And he said, yes, 6 months. And then I said, do you know what happens if you don't have the medicines for 6 months? He said, yes, I know. If I stop the medicines, then the disease will come back and it will be more powerful, and maybe the usual medicines won't work. And I was like, okay, so, all the knowledge check boxes are ticked. And then I said, oh, maybe, you're not happy with your DOTS provider. And he said, no, I'm very happy with the DOTS provider. It's a person that, I chose. And then I said, okay, maybe the drugs are not, regular. He said, no, I'm getting my drugs very regularly. And then I'm like, stumped, because all the checklists, all the possible answers for, default, he's actually checking them. And then I say, oh, maybe you have side effects. And then he said, no, I did have a little bit of gastritis, stomach pain, but the nurse came and gave me, antacid, and I am fine now. So I don't have side effects. And then I said, okay, maybe you're not getting better. And he said, no, in fact, I'm actually getting better. For the first 3 weeks, I was just totally having high fever and cough. And in 3 weeks, there's a remarkable improvement in my condition. And this was when I gave up, because every single thing that I knew as a doctor as possible, determinants of, stopping medication, not knowing about the disease, not knowing about the treatment, not knowing about the rationale, about side effects, about DOTS provider, about everything. He knew, and he was actually feeling better. And then, despite feeling better, he had stopped his medicines. And that really, really stumped me. And that was when I actually gave up my whole, blinkered view of being this doctor, and said, listen, help me understand what you're going through. And then he said, doc, if you really want to understand, why don't you come into my house? And then I moved from the outside. I was standing outside on his veranda. I moved into his house, and he looked at me and said, look around my house and tell me what you see. And there was nothing. I mean, there was a little towel somewhere and a small little stove that hadn't been lit in, ages, and a couple of vessels. And that was about it, a mat. And I said, there's nothing. And he said, exactly, that's the problem, And I said, sorry, I don't understand. He said, listen, I'm poor, right? You can see in my house, there's nothing. Now, when I had tuberculosis, I lost my appetite, right? So because I lost my appetite, my poverty, my hunger didn't affect me, because I didn't have an appetite. But you came and gave me medicines that made me better. And as I began to feel better, my appetite came back. Now I am hungry, but I don't have any food to eat. I don't have work to do. And therefore, I gave up the medicines. I would much rather have the disease and not have an appetite than not have the disease and feel hungry, but not have anything to feed myself. Now, to me, this was the eye-opener of my understanding of disease, of ill health, of public health. And that was the day when I realized that, boss, as a researcher, as a doctor, there is only that much you can understand with your blinkered vision, which comes from a position of power. It comes from a position where, as a so-called MD, community medicine graduate, who's in his final year, who's like going for his exams, is supposed to know everything, that you don't realize that the reality of patients' lives are just so much different. They come from such different positions that you have never experienced. I have never experienced hunger. So how am I supposed to experience or even think or plan or make programs for individuals like him who are willing to go and have disease just so that because they don't have the resources to quench their hunger? Now, that is the situation that I'm trying to address. The problem with most of us researchers, and I'm generalizing, and I'm sure there are large number of exceptions, but in many researchers, is that we go with this preconceived notion and we go with this power that we know the problem and that we are going to find the answer, very rarely realizing that we don't know the problem at all. We know a problem, and that problem that I recognized was adherence. To me, that was the programmatic question. Whereas for the gentleman who had stopped medication, adherence to medication was not the problem. The problem was hunger. The problem was poverty. You see, so to me as a researcher, if I approach a problem with my preconceived notion, with my framework that comes from my position of power, from my privilege as a researcher, I fail to see the issue from the eyes of the person whom I am studying or whose problems I'm trying to engage with. And that, to me, is the fundamental issue that we as researchers need to acknowledge. Now, that other, quote unquote, other person may be a woman, and the issue being gender, may be an Adivasi, we don't understand the culture, may be Dalit, we don't know, many of us, how to engage with caste. It may be multiple, sexual, a range of sexualities. It may be a whole range of things. It may be people who are elderly, people who have, various forms of, who are differently abled, and so on and so forth. But the point is that when we do research, we wield the power of defining the question in the way we believe is, quote unquote, right. And that, to me, is the beginning of the issue where we begin to exclude people. Okay, so I will just take a minute here to stop before going on to the next sort of slide, in case anyone wants to come in here on this. Any responses to the story? Any questions, clarifications?
Meena, would you like to come in? You've tapped in the chat.
Yeah, it's a very touching story reflecting the reality on the ground. And so, during my undergraduate training, in the postgraduate training, I never heard about I was even not sensitized too much about the social aspect of a health problem, or the social aspect, the socio-political aspect of the health system. So it was on the job during my PhD, I got orientation towards this dimension, or this worldview, I should say. And it has been such an eye-opener. And often I tend to blame the state or others, but then later I also realized in my day-to-day things I do, in the day-to-day professional work I am involved in, how am I perpetuating social inequities by wielding power in the visible and as well as in the invisible ways. So that was some reflection after hearing the story.
Thanks. I think these reflections are, extremely important, and let's keep going with them. So in a sense, what we learn from at least my reflections on this, this example, is that we need to first start moving from individuals to and things to exploring relations, right? To understanding what one person means vis-a-vis the other or in a particular context. And second, we need to move away from associations to actually mechanisms. And this is what we will be exploring. So essentially, to me, inclusivity is all about respect, okay? And respecting a person as human and not a category. Okay, so we constantly talk, and it's actually very demeaning when we talk about SCST. Okay, and actually it's like it's demeaning, and we should refrain from doing it. But I think it's just become so much part of our language. We don't see individuals as being human. We see them as categories. Okay, so that's a widow, that's a single person, that's a person who's a sexual minority, or that's a disabled person. No, they're all humans, right? But we tend to sort of categorize them, and by categorizing and in a way dehumanizing them and making them into categories, what we are essentially doing are three things. Okay, we don't acknowledge their history, right? So a person, at least for example, in the gender movement, in the women's movement, we are now talking about, with people who have had or who have been sexually abused, women who've been sexually abused, either in childhood or, more recently. We don't talk to them about as victims anymore. We talk about them as survivors. And it is an acknowledgement that every individual who has come from oppressive backgrounds, who've come from oppressive situations, has struggled against the oppression in the best way that she or he could, and has survived to come to this situation. So every time we see an individual, we need to acknowledge that history. We need to be humble and say, you are a survivor. What can you teach me? Because I am not a survivor. I come from privilege. And I oppress through my privilege, through the way privileges I enjoy. In fact, I'm enjoying them because of the oppression that me and generations of people of keeping my position have actually wrought on you. And it is an acknowledgement of that history that we start with. The second is that if we see individuals as survivors of and as people with with survival and with agency, okay, we need to first and second point is that we need to acknowledge that there is an underlying logic of action from these individuals. They may not fit with the logic that we have, but there is an underlying logic, and we have to look at that respectfully. And the third is about structural oppression, which basically draws attention to the context within which individuals and communities are embedded and the systems of oppression that operate. Okay, so and this is important, and we will sort of expand a little bit on these in the case studies and take this up for discussion in future. So what I want to talk about in all of this then is to use a particular research method that both Sapna and me have used in our research, and is essentially about talking about categories in research. Okay. Now, I don't claim that this is the only way we can do inclusive science, but I'm just giving this as one example in the way we have attempted to make our science more meaningful to the communities whom we are working with. Now, when we talk about categories or individuals, there are three ways in which we can talk about them. We can talk about them as categories or labels. Okay, so SCST is a label that we put into a variable and into a linear regression model. Then there is caste that is seen as a process. Okay, so then we have things like discrimination, or we have things like untouchability, okay, which are processes that lead to, for example, inequity. And then there are systems of oppression, okay, that is casteism, where caste becomes a defining axis of oppression, whether it is in the economic field, whether it is in homes, whether it is in society, whether it is in education systems, and so on. Now, we must understand that when we use a label like Dalit or Adivasi, are we using it as a label? Are we using it as a process? Or are we using it as reflection of a system of oppression? And I'm drawing on the work of Damun and others in their discussion on intersectionality, where they essentially talk about these three different uses of the word. And I will share that paper with you immediately after the session. In essence, what we are trying to talk about is that the concepts that we deploy can either cause violence when they silence these histories, when they silence the structures and the agency, or they can actually contribute the concepts we use. I'm talking about the categories we use. They can either be violent when they silence histories and structure and agency, or they can contribute to actually questioning the status quo by acknowledging the histories and structures and agencies. And in the next two case studies that Sapna and me will present, we will try and show how we tried to move away from concepts deploying these concepts as violence, and moving on to attempting to at least work with these concepts as being more liberatory. So I'm now at 4:20. So I'm just going to skip these three slides and go straight into the case presentations. I'm going to stop sharing at this point and ask if there are any quick clarifications. Else, I will request Sapna to make her presentation.
Anika, there are some questions.
Okay. Yeah, Meena, do you want to come in? You have two questions, right?
Yes, Anika, this topic is really very close to my heart. It's triggering a lot of thoughts. Thank you, Raquel. So I'm thinking we should consider the history, we should consider the agency of a person, why the person does, what is the logic behind what he thinks and the logic behind his or her action. Then I was wondering, how do we determine what is right or wrong? If what is justice then, according to whom? And as researchers, whose justice we should be promoting in our work? I understand all research we do is value laden. Then should we say that the values define the stance we take in our inclusive science pursuit? What are your thoughts on this, Raquel?
Yeah, so I think let's discuss this in a little more detail once the cases are over, but maybe as a quick reply, a quick response, I think I would probably quote what is now being recently, I think, quoted quite a bit, Archbishop Tutu's, talk on what is neutrality. So he says, and I'm quoting, and I'm sure many of you are familiar with the quote, that when an elephant is stepping on the tail of a mouse and you try to be value neutral, then obviously the mouse is not going to appreciate your neutrality. So yes, research is value laden, and I think the ethical stance for a researcher, in my mind, would be to make explicit his or her framework and his or her value, right? And people are free to accept the research or to reject the research. But as a researcher, I usually attempt and try to make my values and my framework explicit so that the reader realizes that these are the lenses I wear. And I don't claim in any way to be neutral, because I am not. We can take this up in more detail, but yeah, and thanks for your question, Meena. I think these are very important. If there's nobody else, then may I ask Sapna?
Yes, I'll share the slides.
Yeah.
I hope slides are visible.
Yes, Sapna, we can see your slides.
Yeah, so hi everyone. So this presentation is a part of my, it comes from a part of my PhD work where, I try to explore the occupational health of a marginalized community in the slum of a South Indian city. So, but if you generally see the way occupational health has been conceptualized or, is being researched upon, it has largely used, sort of very biomedical approach or, very environmental epidemiology approach, which seems to decontextualize, the workers' health and their suffering. So based on that, we attempted to use a sociological lens because we were dealing with a marginalized community, and we felt and we realized that it was very important to take into account their histories. Rather than just doing some biomedical way of research. So yes, to put the things in the context, I'll just start with a brief introduction. So in India, the majority, a million of workers are engaged in unorganized sector for processing waste. And if you see who are these workers mostly come from the marginalized communities like Dalits and Muslims. And the type of employment and working conditions they have are like very deplorable, and which make them vulnerable to injuries and other work-related diseases. In many cases, you do not even have that, sort of employer. It's like the worker himself will be an employer. Even if there are employers, there is no employer-employment relationship. That means there is no chance of getting any social security, any compensation in case of any, injuries or any health related issue. Another thing is because the type of work they're engaged with, it doesn't give them any legitimacy to have voice. So these workers are totally voiceless. They cannot demand anything from the employers. And then when it comes to the health system, or how health system treats these workers who do such a great work by cleaning the city at the stake of their own health, but who remain totally unacknowledged, even the healthcare system seems to miss their occupational healthcare needs, and that's why the workers end up seeking healthcare in private clinics and hospitals. Now, when it comes specifically to e-waste, a recent data like in 2019 shows that India is the third largest generator of e-waste. And we have 90% of e-waste going into the unorganized sector, where again it's the Dalits and the Muslims who are processing the waste. It's there everywhere that everyone knows that the majority of the e-waste goes to the unorganized sector, and e-waste is recognized as one of the hazardous waste, and which poses threat to the health. But the state seems to be silent about it. Now, so basically it was a mixed method study. We started with a qualitative exploration, and then we also try to quantify, but I will not go in depth about on the methodology. I'll just try to put up the findings. And I'm starting with, the context. I mean, who are these workers and why do we have e-waste in this particular part of the city? So this particular city is recognized to have one of the, highest living standards in India. But if you see this particular slum, this is right at the heart of the city. 30 years back, it was famous for leather tannery, and now it is famous for waste processing. So we say that, we have developments and we have this and that, but why do we have such a sort of precarious work in that particular setup? That needs to be questioned. This is, and that was the finding, and that appeared, that emerged because we asked about the histories. We asked the workers, what were their previous occupation? Why are they engaged in this waste processing right at the center of the city? The second, when you look into the socio-demographic characteristics, they were mostly young Muslim males. They were locals, and the education obviously less educated. They had 10 or less years of schooling, mostly in Urdu medium. And the detailed interrogation also revealed that their forefathers or their fathers were also engaged in waste processing, and that's how they ended up doing waste processing. Now, when you say precarious work, it is defined in terms of employment and working conditions. So when you say the employment condition, most of the workers were self-employed. Even if there were employers, there was no written contract, there were no fixed wages, no fixed working hours, there was no question of training, because the workers told that this is an intergenerational work, so they have learned doing this by observing their friends or family members, so they do not need any training. Again, because it is an unorganized sector, and you do not have employers at many times, so there is no question of any association or any welfare society which actually look for workers' health. The workspace was so cramped that many times workers were observed sitting on the road, or sitting on the molds of the waste and processing is, and they were also not using any safety equipment. So when it comes to occupational health problems, the injuries and musculoskeletal troubles were the commonest. And in terms of healthcare seeking, they utilized private and charitable health clinics. They never utilized the urban primary health center, even if it was physically accessible. So now I would try to situate the practice of TT in this particular context. So one of the interesting, workers do go to this private and charitable clinics. They get band-aids, they get medicine, but one of the interesting findings which emerged was the TT injection. So it was a serendipitous finding. So I asked him, so what do you do when you get injured? And they were like, we get TT injection. And I'm like after how many durations, like after how many months do you get? And they were like, we get it frequently. So if you see the statistics, there were few who even got it once every month, because they believe that if they take TT injection, they would be healthy. Any infection which may arise out of injury will be cured if they take TT injection. And this TT injection, which is otherwise free in the government health sector, they end up paying 30 to 200 rupees and get it from the private or charitable clinics. I also went to the healthcare providers to inquire about this particular practice. And then though the providers told that frequent TT injections were not required, they end up prescribing. And they put up several reasons. And one of the prominent reasons was there was no medical records for vaccine available. And they were like, we share a very strong bond with the community. So if workers comes up with a request for TT injection, how could we deny them? A couple of providers did acknowledge that the workers' poor condition is responsible for the health problems and the injuries, but they cannot do anything to improve it. When I tried to explore why workers believe that they should take TT injection frequently, so many of them told that because they work in such an unhygienic condition, so they get injured frequently, so they should be taking TT injection. They believe that if they do not take TT injection, they will have a rotting of hands and feet, and which will impact their work, and therefore they should take TT injection. They also mentioned that the healthcare providers do suggest them take frequently, and even if the healthcare providers were resisting, the workers were like, no, we do this work and we know about our health more than you, so you should give us TT shots. And this is because one of the reasons was like, they have heard from their elders that if they take TT injections, it will keep them healthy, and it also helps in healing and relieving pain. So, if I had gone through a very biomedical way of studying occupational health, I think I would have discarded this practice by labeling it irrational or something which is medically unjustifiable, because we all know the doses of or the duration after which the TT shot should be taken. So had I taken the biomedical approach, I think I wouldn't have gone into depth inquiring this particular practice. So I took a step forward, and then I tried to situate this frequent TT practice in the context of marginalization and the vulnerability these workers were embedded in. Even the existing literature says that, any practices like this, for instance, there are a lot of examples of papers written on the frequent injection practice in marginalized communities. And the literature says that we have to see the practice in the socio-cultural system. For instance, in this particular case, if you see their working condition, they do not have time to go to the UPHC. They cannot take time out of their work, even if they are injured. So they feel that whenever they get injured, they should take immediate TT injection so that, they do not have to sit at home because they will not get any infection. Another interesting thing is we also have to see the availability of type of healthcare providers. So in this particular slum, the urban primary health center was located very close to these waste processing units, but none of the workers went there because they believe that it is only for women and children. Another reason was the timing issues. Workers cannot afford to go during the daytime because these are informal sector workers and they get paid based on the amount of pieces they dismantle every day. So for them, the convenient timing was either evening or the night. And these private sector private clinics or charitable clinics, they remained open till late night. One of the clinics was functioning till 12 at night. And this made, the worker convenient to go and get TT or any other treatment from the private or in a charitable clinic. Another thing is if we try to situate this problem in the larger context and, why UPHCs may not be may not be taking care of the occupational healthcare needs. One of the reasons could be the skewed orientation of our UPHCs towards MCH or RCH. I'm not saying that that's not required, that's equally important, but this made the workers feel that it's only for women and children. And there are papers which said that though women and children were given important were considered in the earlier days when we have high maternal mortality and infant mortality, the workers were never a part of healthcare system. Their healthcare needs were never taken care of. And this could be and another reason, now we have this systematic weakening of public healthcare system. And this could have been one of the reasons why the occupational healthcare needs are not recognized. Another concept which we try to use in our paper is like the pharmaceutical fix, which says that you treat the problem through medicine rather than improving the social determinants of health. And the existing literature largely use this concept from the health system perspective, but because we were trying to understand this particular practice and why this practice was so frequent, we tried to understand and we felt that it was a co-created practice. So it was not only that the health system or healthcare system was forcing them to take them a TT injection, but it was also the equal demand from the workers. So we tried to locate it as a co-created knowledge or co-created practice rather than just saying that it's the healthcare system which is responsible. And rather than discarding it as irrational or medically injustifiable practice, we believe or we found that it is a product of co-creation which emerged in the context of precarious work and also where the public healthcare system seems blind towards their needs. We thought that this could be, rather than discarding or rather than saying that, this is bad and, this should not be taken, we felt that it is a possible way to get entry into the larger discourse. And then we can think of some community-based framework on occupational health where it's not only about training the healthcare system or the providers, but also involving the workers in the planning process. And I think this reflects the earlier discussion on inclusive or how do we involve participants in the process of the research. However, in the current scenario of uncontrolled privatization and the weakening of labor laws, this looks quite challenging. Now, to conclude, we feel that this rampant practice of TT injection is not an anomaly or aberration. Rather, it's a co-created practice, which is a result of precarious work, poorly developed and narrowly focused public healthcare system, and obviously entrepreneurial private health system. However, we feel that framing such practice as a co-created product recognize that there is a possibility to bring up this alternative, lived experience and to have some empowering models of occupational health by making the workers as equal participant in creating their own model of occupational health. Yeah, thank you.
Thanks very much, Sapna. And as you would have noticed, the focus was on the concept or the category of irrational behavior, and this is something I think all of us keep on seeing, especially when we work with different marginalized, vulnerable, oppressed communities, is their quote unquote irrational behavior. And in the case I talked about before, it was the irrational behavior of dropping your TB medicine. In the case that Sapna just mentioned, it was about the so-called irrational TT injection, and Sapna very nicely took us through the history, the whole situation, the health system, the realities, the precarity of working conditions, and Sapna used the TT injection as an entry point to gather all of this information, and then make her story one that is actually looking at the TT injection from the perspective of the people, from the bottoms up perspective, rather than looking down at TT injection as as experts, as we with power would do. So thanks very much for that presentation, Sapna. I've heard it many times, but it still is very exciting, the work you have done. So thank you very much. Before opening up for the questioning, I think I'll just slip in my second case, which will be short. It is a similar exercise that a group of us tried to do. This was it is reported, and I've shared this paper. You may be familiar with some of the author. I don't know if you guys have had a chance to meet Oblesh and Sukanya, but they are both in Bangalore. So you should try and reaching out to them. And essentially, I was talking, this paper talks about the health issues of sanitation workers in a town in Karnataka. So we're basically looking at Paurakarmikas, as they are called in Karnataka. And all of them are, of course, from the Dalit, are all Dalit background. And therefore, this is also an important issue of caste. Now, the paper itself is there for all of you to read, but I just want to focus on the issue of alcohol. And one of the issues when we did our background search and we talked to other people who were, who had done research on occupational health, especially among waste work, was this whole issue of alcohol. And everybody is, quote unquote, alcoholic. And we were warned that we should be careful when we do research because everybody is under the influence. There people begin to drink even in the morning. And therefore, we would find it very difficult to actually collect data and so on and so forth. But actually, this work was done through, the association to the unions of these workers and associations of, people working with manual scavengers. And therefore, of course, we had a very rights-based approach. We as researchers sat down with these groups, with the unions, with the representatives on many occasions before actually even designing the study. So that's really the background. But in a sense, when we looked at alcohol, which was one of the major issues, how did we see it? And this case is very simply just, using the concept of alcohol. And in the paper, we write that though the workers reported seeking treatment at government hospitals, the most common practices were the intake of over-the-counter medicine from pharmacies and drinking alcohol. So I remember one of the researchers, recalls, and I remember his, presentation to us, that when he asked workers, why are you drinking alcohol? The reply from one of the workers and said that you come and do the work we do for one day, and you will also become an alcoholic. So the issue really with that retort from the worker drew our attention from the practice to the context. And how then do I begin to understand the concept of alcohol or alcoholic? And that led within the researchers to a discussion on whether we should see alcohol as a problem and therefore alcoholic as a category, or we should actually be seeing a person with agency who's using alcohol, who's actually actively using alcohol. And that is what people said. When I have severe chest pain, when I go into an open drain with no with no protective gear, I just wear my underwear and have to go into a pit of shit, then I have this tightening of my chest. I have severe symptoms of running nose or coughing. The only thing that gives me some, and of course the lack of dignity, but the only thing I can do at that time, I can't go to a government hospital. I can't go to a hospital because that will mean losing my daily wages. So the only thing that I can do is drink alcohol. And in fact, I drink alcohol as a medicine. And we then actually use the word alcohol and have said that this in fact is a medicine, and this is not as is used as a derogatory term of a lack of agency. So working with organizations who are closely working with the marginal manual scavenging community, talking to and observing the community and willing to literally get into their shoes, working with them, I think was a critical aspect where we as researchers, we were willing to give up all the categories that we were familiar with to begin to look. However, and for a public health person, I mean, many of us know that alcohol, immediately throws up a red flag. But we were willing to give up the frames because we believed that these were survivors. We respected them as people with agency, and we understood, and we struggled to understand maybe, but we tried to acknowledge the huge structural challenges that they were up against. And therefore, we finally write in our paper that this study also revealed that the perceptions of health risk were molded by their low social and economic status. Alcohol intake was perceived to help in tackling the hazardous work and reported as a method of treatment for all illnesses. This is perhaps the most important public health concern, and any intervention to tackle alcoholism would have to also address the social ramifications of caste-based employment, the perpetration of such a hazardous job, and the link between alcoholism and poverty. So as Sapna, used this concept of TT, irrational behavior, upon itself to begin then to throw light on the larger structures, we also attempted to use alcohol as in a different way, to use alcohol as a term, but deploy it in a way that actually throws light on the structure that causes that alcohol intake, rather than on the individual who is actually having that alcohol. So basically, So basically then what happens is that in this process, both Sapna in the case of irrational treatment, and myself and other authors, Oblesh and Sukanya, in the case of the way we have deployed alcohol, have actually, I'm just sharing these two cases as examples of the way in which one particular process, that of the categories and analyzing categories, we had attempted at making science, at making research more inclusive, more socially just, by giving equal weightage to the perspectives, to the frameworks, to the articulation of the issues, from the communities whom we were doing research with. Okay, so I want to stop here and leave this, with you all, and open the floor for a discussion. Again, with the caveat that this is not everything. It's just one attempt that we have made, which I felt would just at least begin a thought process for all of you, as you begin to explore inclusivity in all your, ways. And yes, Meena, it's interesting to see this paper in NMJI. It was a struggle. It was rejected by the reviewers because they felt this was not epidemiology. Then we argued with the editor that this cannot be seen just as epidemiology. This is important health issue, and it was epidemiology. So we proved, we had to prove that this was epidemiology. It was sent to another set of reviewers. It was rejected again. We stuck by it. We appealed to the editor, and after more than a year and a half, it was finally accepted by the executive editor and published. Yeah. So it's important that we, sometimes, stick with it also.
Yeah.
Okay.
Raquel, a real struggle for social justice. I see you experienced to the editor.
Yeah. So, okay. So thanks all for your patient listening. And I'm now opening up. Probably, Anika, you wanted to have a break for maybe 5 minutes. If you just want a quick bio break and whatever, drink water, stretch, and then come back for questions. We have, I think, another 45 minutes. So, yeah.
Yeah, I thought that it's almost 1 hour and little few minutes beyond. So maybe we can have a break. We have space for that. And then we can come back and we can have a 5-minute break and come back and
that's fine. That's fine.
Okay, so it's 4:45. So we'll meet at 4:50. Is that okay for everyone?
Yeah, fine, Anika. No problem.
Okay.
Anika, we could begin, right, perhaps.
Yes, I think if all of us are back, we can start.
Yeah. Okay, cool. So, yeah, so thanks everyone. And as I said, we'll open the floor for, I think, questions. And I do hope that, we'll be able to maybe explore some of these issues in a little more depth in this, part of the session. So, yeah, so I think basically you can just shoot. I mean, just start off.
Yeah, Priyanka, would you like to come in? Priyanka Bandwall.
Hello, sir.
Hi, boss.
So thanks for the session, firstly. It was very insightful. I am actually a psychologist, so I could actually draw parallels to the psychosocial aspect that we usually talk about, and we do see it in our practice, and how when it comes to research, somewhere that quality is what we are lacking or forget to take into account when we're at the first zone.
Yeah. Thanks. And I think, yes, there is a very, very significant psychosocial component to all of this. I think the whole issue of, for example, dignity, the whole issue of what one feels when one's dignity or one's personhood is not respected, I think is a huge issue that many times as researchers we feel privileged enough not to bother too much about, or not to bother at all. So yes, absolutely. Thanks for drawing attention to that dimension.
Yeah, even I would like to say that, like from both of your case studies, what I could understand was how important it is to look at that health problem from the gaze of people who are experiencing it, and constructing it in that lens, and not in just one lens, the way we look at things biomedically or even with some other discipline. So Sapna, I also had a question for you that like I also remember you telling me previously during HPSR that you've made friends with a lot of people whom you were researching with. So I was just wondering if because it's often said that during the process of co-creation, discussing your research question at the time of formulating it with the people whom you want to research with, or with the participants, is also key to understand whether this issue is actually relevant for them or not. Because when we make a research question, it's relevant for me as a researcher, but when we talk about co-creation, it also has to be relevant for the people whom we will do the research with. So I was wondering about your experience with your research participants in terms of discussing the question with them, or even now since you've completed your PhD, so discussing findings with them. What do they think about this whole process?
Yeah, so if you talk about discussing research question, at the first point, for these workers, the occupational health itself doesn't matter for them, because they're the only motive is to survive somehow. So when I was even telling them you don't have to take these many TT injections, that's not required, so they are not bothered. If you ask them why don't you wear gloves, they are not bothered. So for them, they're like, we need to have 3 meals a day. So for them, this whole concept of occupational health, which looks very fascinating to us as researchers, for them it's nothing. They only need to have 3 meals a day. So while framing my research question, I did not involve them, but the moment I went to the field and I spent around 8 months or 9 months in the field, my research questions were very broad. What were their problems, their healthcare seeking practices, and how the states see them. So I put the questions very broad. But every time I was on the field, every day I was meeting them, that even this TT practice, it was a serendipity. We never expected that we will get this TT as an finding. So my research questions were broad, but it was in a sense a bit specific also, because I was only focusing on occupational health. But in reality, these workers are not bothered about injuries or anything, because they were working despite of having injuries. So injuries which were like quite severe to me, when I saw that they were quite in-depth and severe, but normal for them, they just tied a cloth and they were working with the injured legs. So they are not bothered unless and until they are having 3 meals a day. That's my experience from the field. Yeah.
Thank you.
I think that's agree with what you have said, because I had the opportunity of working with pregnant women from a marginalized section of society. And when we talk to them and we tell them, okay, this is how the findings would be working, there is always that surprise, okay, fine, you are looking into these aspects. When we actually go down to the ground reality, we say their needs or requirements are pretty basic. It's not as glamorized in our eyes as it is to them. I think that's how it is when we are looking into practice.
Okay, Shriyuta, would you like to come in? I see you've put in something on chat.
Anika, I forgot to answer your second question where you were asking about sharing the findings. I'm so sorry. So I did plan that, I'll go back. In between also, I was checking with them when I was doing research. So every day when I was doing, especially the qualitative part, I was going to them and asking them, is this what you said? I'm getting this from you. And it was like, sort of validating from many senior members of the community. But even after we, finished writing and everything, we decided that I'll go back to the field and to communicate at least some, findings to the people. But COVID came and everything stopped. But now, because of now HPSR, I again have the opportunity to go back to them because I'm planning to study the COVID vaccine thing. So I think that will give me the space to communicate what I have gathered in the past few years. Yeah.
Okay, sure, thanks. Yeah, Shriyuta, would you like to come in?
Sriyuta, you're able to hear Anika? You have to unmute yourself. You are muted.
Yeah, Shriyuta, you have to unmute yourself. Or maybe Shivanand, I see that you have also written something.
No, I think what it's in continuation with what Meena is trying to ask. See, in my research also, as you were asking, is normalization an issue for a researcher, unlike it is for the people? When we go to the tribal community and the forest, under the Forest Rights Act, the government is ready to give 2 acres of land, and then they are ready to give shelter for them, and they're asking to come out of the forest and live as a normal people, civilized people. But I see that in my interviews, they're not ready to come, and they just want to be there, and because they feel more freedom there, and they're ready to move in and around. So as a researcher, we think they are facing a lot of problems in the community, in the forest, being there, and accessibility is an issue, affordability is an issue, health services are challenging. But I don't know. I don't know how to put that perfectly. But is normalization of the people is an issue for a researcher, or is it really an issue for people also? Is something I just wanted to hear thoughts around that.
Okay. I'm just wondering whether I should just jump in here, or whether we should take a few more questions, maybe.
I think you can answer and then we can do question wise.
Okay. Yeah. Okay. So So I think what I wanted to sort of just picking up again on the example that Shiva, you talked about in terms of the people not wanting to come out of the forest and take the 2 acres. I think there's again many of these issues on normalization that I think you and Meena are talking about is about the frames that we use to see these things as quote unquote normal. Okay, so for most of us it would be normal that someone accepts 2 acres of land as a rehabilitation for a life in the forest. But I think the question is, look at the history. What have happened to Adivasis who have left the forest and come into urban settlements? Okay, how many of them actually have gained in quality of life, right? So I remember this discussion that I had with a wizened old man in the Narmada Ghati, in the Narmada Valley. This was in the year 99, 2000. Where it was at the peak of the movement in those years, and many people had taken the rehabilitation package, but many people didn't take the rehabilitation package. So we had visited, as part of our visits in the Narmada Valley, people who had accepted the rehabilitation, and we were visiting one of them who was showing me his fields, his 2 acres plot, and he was like, so I said, okay, so you must be happy. And he looked at me and said, you know what, I wish I hadn't taken the rehabilitations. And I said, why? And he said, listen, you don't know our life, right? So when I was in the forest, I would go to the stream for fish, and if there's no fish, then I would collect fruit, and if there's no fruit, then I would just collect roots, and if there are no roots, by that time little bit of ragi or something would have grown, and I will eat that, and if that I would collect honey, or I would collect mahua, so I was like, but you guys are just so used to this monocropping, and now you've given me 2 acres of land, okay, fine, and I put this crop, then you said no, you need a pump, and then you need electricity for the pump, then I need a loan for the loan for the pump, and then I'm not able to give back the loan because and at the end of 2 years I'm in debt. I have lost my so what really have I gained, right? And I think this is this issue of us not understanding what is a livelihood, what is a life world, versus what we are usually thinking about jobs, right? So jobs are those things that are exchangeable. Okay, so I can do a t-test, or I can use SPSS package, and I can do it in IPH, or I can do it in Achyutamanan Center, or I can go to Harvard and do it, and the skill will be used. But livelihood is not like that. Lives of many people in rural and even in urban areas are so deeply linked to the ecosystem around, to the life world around, to the economy around. And it's not all modern economies, of markets that, we are thinking, the frames we are thinking, and therefore we just don't see, the lives of these individuals. And therefore we define something as normal. But normalization is violence. Because we are normalizing what is dominant, what we accept as dominant, and what we then accept as natural. And then somehow the other becomes unnatural. Okay. And so I think, yes, I mean, I accept that all of us are normalizing things, but I think that is the entry point. We need to use the experience, as someone I think mentioned right at the beginning, about how do we bring in experiential, insights into actually, and what both Sapna and me did, and me as part of the research team in the second paper, what we did really was to take a category that was normalized. TT as an irrational response was a normalized reaction. Alcoholic was a normalized category. And then we interrogated those normalized categories with the insight that we gained from living with, observing closely, gaining friendship with, gaining trust from the communities who were, the participants in our research.
Thank you. Thank you.
Sapna, you want to add something?
No, sir, I totally, agree with you, because even if, when we were talking about occupational health, we never saw that, the way we have done it, this could be also, the way we should do occupational health, because initially I also had this very biomedical way of understanding occupational health. But then that is important to understand actually what is happening in the field, because we need to have some idea, some understanding from the literature. But when you go to the literature, and it's very important to take into consideration what the participants or the respondents think about occupational health rather than, we go and tell them that this is for occupational health. I think that's the way we researchers develop, and also our perceptions and values change on the ground. So this ground experience, and the PhD is a learning, like 5 years learning. So we continue to learn even after that.
And we learn post PhD also.
Yeah, of course.
So for those of you who think that at the end of the PhD, the journey is over, sorry, wrong number. It's just begun.
No, sir, I mean, even about our research, it's post PhD that when I go back to see my thesis, I get more insights, and I'm like, oh, I should have used this, I should have used that. So that's the way it goes.
Yeah, Meena, sorry, you have your hand up.
No, I was thinking, we are talking about the problematization. Whose problem are we talking about? Whose problem are we normalizing? Whose ideas are we normalizing? So if issues are so contested, then how do we pull up a dialogue between the different stakeholders on such contested issues? I feel so pessimistic, and you're leaving me with a sense of hopelessness. Where do we start social change?
Does anybody else in the group want to jump in to engage with this? I think this is a very important issue. But before I say my 2 pennies, does anybody else want to jump in and respond to Meena's anguished question?
Sir, I just want to, respond very quickly. I think it's important even to change the narrative or change the discourse about some problems. So when I say, for instance, occupational health, the way it was seen by me earlier and the way now I see it and the way I talk about it, even if changing the conversation or discussion around is a change, at least to me as a researcher at my level, what I can do now. Obviously, to bring the social change, it takes years, collaboration, but at least at an individual level, we can think of, because we as researchers have power, and rightly you mentioned at the beginning that what we write, it appears truth to the large community. So I think even bringing change in discourse is like a first step to bring any social change in large.
Anybody else wants to come in on that?
Weber, do you want to say something? You've just unmuted yourself. Okay.
Sorry, it was by mistake.
But you could still say something.
No, I didn't really have anything to say. Thanks.
No. So Meena, I was cynical, I think, at one point, but I think actually the word you used actually helped me out, and that is the word problematization. And I think what using the word problematization, and for those of you who are not very familiar with that term, it's essentially asking, what the problem is assumed to be. So not taking for granted that all of us understand the problem in the same way, and being humble to and being open to the fact that different people may, understand the problem differently, or may understand or make have. Now, that actually is the way forward to me, because what I found as very productive is to then not talk about the problem, but to talk about the underlying assumptions. And there I find, if we ask, for example, even an IAS officer, for example, this is a conversation I have with, that I'm now having in Kerala, for example, or in any other many states we've had in the past. You've built a hospital in an Adivasi region, okay? And then you're telling people no one's using it, right? And that's because people are ignorant and uneducated, and the usual thing. Oh, so it's just such a failure. What do you do? The question then is, you ask, what are your assumptions? Why do you think building a hospital will work? Okay, and then you get to the question that they'll say, okay, because you have services and so on and so on. But are services available? Are doctors available? And are those doctors who are available actually providing services with dignity. And then you are able to open conversations, at least with few people, that once you start engaging at the level of their assumptions, because that is something that are objective. So I have found, at least, again, not 100% success or anything, but at least to move the discussion forward is to saying, okay, this is the way I see the problem. This is the way you see the problem. Okay, but what are our assumptions? Can we put the assumptions on the table and then look for evidence for one or the other assumptions? And then I feel that at least in some ways, in small ways, people begin, at least if nothing else, to feel a little uncomfortable about blindly going with dominant problematizations. Okay. Any other questions or reflections? If not questions,
I just have one question in continuation with what you are discussing. Of course, the assumptions are questioned and the problem has been understood from the various perspectives. By doing the kind of research for the social sciences and the different perspective that we used, could you illustrate with an example how the solutions are brought up to a particular issue? Say, for example, the alcohol you were mentioning as an issue from looking at it from the epidemiological perspective, and then we have to look at it from the other perspective, from the social determinants. So, what is the possible solution for such kind of problems in your view?
Sure. That's a tough question because I don't know, whether there are, very many, easy, quick fix solutions, right? But I think what is important is that, again, is the question, this concept of a quick fix, solution. But what I believe, right, is, and I think many of you may already have listened to Sunil, who talked about Attappady. I don't know if he talked about the dissemination process that he went through, right? But what has happened is, for example, in Sunil's research, and again, I was on his doctoral committee, and so I'm very familiar with the sort of research, he did. But what has happened is that Sunil has done the research, has taken that research and given it back to the community. He's of course created the analysis along with the community. He went back on multiple visits to almost all the villages and disseminated, had discussions, group discussions, urkutams with them. And what has happened is that all that he has actually published has actually become the political demands of the village sangha, the Adivasi sanghas in or the NGOs that are working also in Kerala. Now, to me, I think that is fantastic, because what then happens is that the demands for these type of specific changes then begin to resonate in different parts of the system. So, for example, when I'm sitting in the planning board, and part of a working group on the Kerala planning board, it's again Sunil's paper that I raise and I'm able to raise. And then what happens is that you have this document that is a political document, you have a research paper, and then you see that over a period of a year and 2 or 3, 4 years, the problem of the Adivasi question in Attappady is beginning to take on shades that were not there in the past. Now, probably all of us have the luxury of saying, okay, this is a long process, it's going to take time. I acknowledge that Adivasis in the thick of things, children continue to die, and it's not a very nice thing. But yes, processes of change are long, struggle is long, but I do think that I guess the only thing that all of us can do is, apart from networking and building up a critical mass, is to feed back as much as we can our research to communities who can then use that in multiple forums.
Thanks you for that. I think becoming the voice of the people is what is the main purpose of this publication and problem. So that's very interesting to know. I have other questions, but let's see the comments.
Yeah, thank you, Rakhal, for that. In fact, just before your session, we had a session on communication in research, and we were discussing about communicating it to policymakers, to politicians. And like you just mentioned that how a researcher went back to the community with the findings, and then those findings are being taken to the politicians as well, and it is becoming part of the political discussion. So that's quite inspiring to hear and reflect on that people are taking that path as well. And
yeah, and I think there are other good examples, Shiva. Just I took a little time to collect my thoughts, but I think one very interesting, very, very inspiring example, and there's a discussion on law, I think, in the chat box, is the work of the Silicosis Peedit, Mazdoor Peedit Sangh. So, there are groups of workers who have been affected by silicosis in the Gujarat, Madhya Pradesh, Rajasthan belt. And there are a number of NGOs working with them, community-based organizations who have, collected, done research, documented, the huge burden of silicosis. Again, not very systematic, no, big cohort studies or anything. Simple case studies, simple surveys with, very poor statistical power, but powerful messages that went across and has actually led over a period of 15-20 years. Okay, it's not overnight, but over a period of 15-20 years into a very, very strong Supreme Court judgment on rehabilitation of silicosis. They have put in 5 commissioners to look at the rehabilitation process. And now, the governments are forced to buy X-ray machines, are forced to get people trained into the diagnosis of silicosis among doctors who are working in public systems, get, rehabilitation packages out. Of course, people are still dying of silicosis, but at least there is now a systems-wide response to the issue of silicosis, and silicosis is no longer a completely, neglected sort of disease. So yes, there are examples where this sort of work, systematic research has actually led to actual social change, in the field. And there are a number of examples. I think KKK, PK, I think Sapna will also has looked at that. The Kagad Kach Patra Panchayat of, I think, Pune. Has done some phenomenal work, again, based on very, very systematic research. Again, not, the sort of jazzy, research, but very systematic sort of work. The workers of the Pune, of the mercury thermometer factory in Kodaikanal, whom I supported with scientific sort of work, again is an example. The workers won probably in one of the biggest historically biggest compensation packages from Hindustan Unilever, and so there are a number of examples where this is.
Thank you for sharing those examples. Quite wonderful work to know. Do we have any more questions?
Can I come in, Amika?
Yeah, sure.
It's not a question, just a reflection. So even in my research, I'm currently looking at tobacco sector workers and shifting and their perception about their livelihoods. So when I entered into the field, being a public health worker, it was very clear to me that it's an occupational hazard and people should shift out of it. But as I started engaging with the literature, it started coming out that it's a livelihood. It's not only livelihood which is important, but there are many social aspects to it. Like, for example, a woman worker, it becomes very easier to work from home and roll BDs where she can manage both. Another was many times also thinking on the historical perspective, many of them entered BD worker as a form to redefine their caste, because earlier they were engaged with stigmatized occupation. So this, so the presentation by you and Dr. Sapna resonated with what work I am intending to do, and I would really be thankful for bringing out this topic. Thank you.
Ketki, thanks so much. And in fact, this is where work with communities and listening to them, actually can lend huge, opportunities for thinking in terms of. And as you said, BD work is so useful because women actually have to balance home, and earning, and then working from home makes a lot of sense. So this is where maybe something like, for example, advocacy for creches, right? Where then, you are, okay, I'm not saying that's going to work, but I'm saying we need to think beyond what is the obvious and it is people who push us there.
Yes.
It is people who then, and for all you know, and again, this is just, wild thinking thinking of structural reasons. Okay, so for example, child care, for example, more protective equipment in the case of manual scavengers, for example, may actually have quite unintended positive effects on the whole issue. But yeah, thanks for that.
Thank
you. If I don't think we have any more questions, or if we have, then you can write to Sapna or Akhal. Yeah, I can share their email IDs and you can continue the conversation. So thank you. Thanks a lot to both of you for coming and doing this session. I think there were a lot of basic but very important points raised, like acknowledging one's privilege and looking at people as human beings and not as categories. So yeah, thanks a lot. I think it was a wonderful session.
Thanks for giving us this opportunity to think about the work we are doing. And yes, and I do hope that all of you have wonderful journeys, and be very happy to bounce ideas off or anything, if you have. So please, Anika, share my email and feel free to write and keep in touch. And yeah, all the best.
Yeah, I just remember something after listening to Ketiki, that she was talking about how comfortable it is for women to work at home so that she can balance. But I would request her just to check even the politics of this concept, because there's a lot of things written, why certain things are, like especially this unorganized sector work are normalized as unorganized sector. And one of the reasons, and that's why they are not turning into formalized, because they think that this makes life easy, flexible, because once you become formalized, then you have to give crash facility, you have to give so many other facilities to workers. So I would just request her to, think a bit about the politics of this entire concept. And thank you, yes, for this opportunity. Yeah.
Thank you, Dr. Sapna, for your words, for your suggestions, actually.
Yeah, thanks, Anika and Rakhal and Dr. Sapna. Really wonderful session, and after the lunch, you really awakened us, all of us, with a very strong, and I really enjoyed the session. I am sure all the participants have benefited from your session. It's always very special to have you in the session, Dr. Rakhal. Thank you so much again, and same thanks to Dr. Sapna also, and thanks, Anika, for a wonderful facilitation. I just came across another very uncertain news that we were not expecting, that this next session speaker is not.
Shivanand, can I just come in? She messaged she'll be joining in another 15 minutes.
Okay. So that's a good news. Then we can move forward. So before that, then we can have a 15 minutes break. Thank you.
Okay.
Thank you.
Okay. Cheers. All the best to all of you in your respective PhD journeys. Those who are not yet starting, those who have started, those in the middle, those in the end. All the best. Have fun.
Yeah, thank you so
The
much.
journey is never going to get over. Huh?
Yes, it's definitely.
Yeah. Of learning. PhDs will end.
And it will be painful also. It will be painful also because you are going to engage with marginalized communities. So you will reflect on your privileges and that will give you more pain than actually their suffering.
Okay.
Skate key. She's muted. Who is the Kranti? Are you there? Kranti, can you hear me? Okay.
Hello. We are on a break, right? When do we start? 5:45.
She is not, she has traveled.
The resource person is available by 5:45.
Okay.
So that's the reason. Otherwise,
Yeah. No, that's good.
Yeah. Let's have some rest.
Okay.
Session.
So meanwhile, if anyone has any questions, how did you feel about the first day? We are entering the last session of the first day, and I hope everyone has enjoyed and benefited from the workshop. If anyone has something to say informally, nothing formal, not about any session or please come and say a few words.
I'm feeling a little exhausted after it's like sensory overload since morning.
Okay. Anyone is feeling anything?
But otherwise, it's.
Hi Shivanand, hi Meena, hi everybody. Yeah, I can also agree. I'm also a little exhausted. But sessions have been really great. It's been a real. I mean, at least each session, I think you've so carefully selected it. It's the topics wise. I'm really very happy. It's very interesting. I think from my side, I wanted to just reflect that when I think who was the speaker? I forget, but somebody spoke about. I think Dr. Matthew George. He spoke about the theoretical positions that you choose. So I think that is something that I'm struggling with a lot. So if you can point us to some resources or some good papers on this, or how to understand this better, that would be really grateful. I mean, really helpful for me. Or I don't know if anybody else also shares the same feeling, but when it comes to methods, just figuring that part out is very it scares me really. What is it? And the words and everything feels very like overwhelming when I start reading it. So if you have any resources that you can share.
Is kind of engaged with realist synthesis and the kind of a theory building.
Okay.
We could come in and give some suggestions over here. So that might help you. Pragati, do you think you can? Yeah.
Sure. I think I can have a conversation with Aishwarya sometime and see if there's.
For me.
You're not able to hear me?
We can hear you. Yeah.
We can hear you.
Okay. Yeah, no, I was saying that, I'll be happy to have a conversation with Aishwarya and see if that helps. And I think especially the initial few months of the PhD on making some critical choices and also being able to justify those choices. Though those areas was where I was also getting quite stuck. So maybe I can share with you that part and see if that helps you.
Great. Thanks a lot, Pragati. Thanks so much.
So many things are there.
Meena, could you say something about this theoretical
stance?
Yeah, could you please?
Aishwarya, I think almost all the researchers are in one way or the other. The ultimate goal is to identify their theoretical stance. It's not like one time you figure out and then it's done. It's not so. I think your values, the topic you choose, the analytical lens for example, you're applying gender lens or realist lens, or what kind of analytical lens frames you use, the hypothesis, the theory of change. There are so many synonyms are there, so many factors that contribute, that determine your theoretical stance, I would say. So we are still in that path. It's like, meditating under that tree. It's similar to that exercise, I would say.
Yeah.
We are all waiting for that eureka moment.
Thanks. Great insight, Meena. Thanks.
Yeah, I think what Meena is suggesting is truly, I agree completely with her. Most of the time, this science, what we think is from the science perspective, as I mentioned, the common sense is where brings you the ability to understand the science. So when you try to apply the concept that you are trying to give, so to your own day-to-day activities, so that helps you a lot to convey your science to the audience. Right? So that is where the theory also comes from. How are you navigating it through? I think that's the way we should practice. Even I believe.
And this theoretical stance also varies from topic to topic, project to project. Even in one project also, you will realize you could apply many theoretical stances at different points of time. So it's very tricky to summarize and have one definition. What is theoretical stance? It comes in the disguise of theory of change. It comes in the disguise of hypothesis. It comes in the disguise of theoretical framework, conceptual frameworks.
Yeah. So meanwhile, anybody else would like to give any feedback, comments? Just be informal. We are again formal.
Yeah, I would like to add. Actually, initially, I had too many theoretical frameworks in mind because I gone through theoretical perspectives, and then as Dr. Matthew taught us in this, so then I felt that this matches medicalization matches to my my PhD research, and then I felt that yes, gender analytical framework matches. Then I felt technology and human body matches. So it was becoming a chaos because every framework is right. There's nothing right and wrong in choosing a framework. But what the theoretical framework indicates is when we choose a theoretical framework, that is the crossroad or the path from which you will start walking, and you won't be taking other pathway which is right there. It can be correctly studied. Your whole study can be studied in that perspective also. But when you choose one theoretical perspective, that is when that is the path on which you will be continuously walking, and research will be on analyzed on this pathway and studied in this perspective only. That's what I understood eventually when I was told by my committee members that you cannot study everything and then you won't get anything out of it, and you won't complete your PhD in the duration which is desired for. So yes, I faced this problem when I was in the initial months of my PhD, because every theoretical behavioral theory, every anthropological theory, I felt that yes, I can work in this where it has not been studied, and then I can take it up. So I think that might help you.
Thanks. Thanks a lot, Pooja. Yeah, for sure. Yes, everything is helping me today. So it's really, really great.
Because I worked in that way, and that is how I chose only one theoretical perspective, and even others might be right, and my study wholly can be done in other perspective also. That's what I learned, and I think PhD is a learning thing. So that's what I learned myself.
Thanks.
Well, thanks for introduction. Anybody else? Any feedback?
Just want to add one point.
Yeah,
to the theoretical framework. Sometimes it is not cut in stone. The framework you start with may not be the same till the end. In some kind of researches, the theoretical framework evolves, it gets modified, you get a refined framework at the end of your research project. So that is also there.
Okay. Okay. Yeah, thanks. Thanks, Pragati, for that. Anybody else? Just a feedback for the day and just say hi to everyone. It's been how you were fresh now, how your face is looking like. Just want to show your face also after the end of all this exhaustive day. Also can turn on your video and just show us. We want to take those moments as well.
Nobody wants to switch on their video.
Yeah, so I think in-person interactions we are really missing a lot.
Thanks to COVID.
No, why thanks? You don't want to make?
No. I mean, it's
Thanks to COVID is the usage of language.
Sarcastic.
Others, we don't see their videos.
So some of all of you shown very eager meeting coming to Bangalore. I was feeling very heavy to convey the message of conducting this workshop virtually. And the decision that we took on Saturday was a long discussion, and what to convey, what to sell, and then of course the guidance were also there. But then even we wanted to have this event in person because this is where we feel connected together. But of course, what we have adjusted to the virtual world, and we are feeling connected. Though we are working different areas, the kind of smoothness that has gone in the planning, and also you responding to every questions and needs has been amazing. So that's where we have. I was feeling that we have adjusted to the kind of environment that we have been to last couple of years. But definitely, it's a great missing of in-person event. Smita, would you like to?
Shivanand, this is the time maybe to ask the two volunteers who could recap for tomorrow.
Yeah, just before going to the next session, just would like to know any volunteer who can recap the today's sessions tomorrow early morning as a first activity, and then moving on to the second day. Right. Any volunteer to do that?
Just key takeaways.
Just key takeaways. Nothing much. We don't want any
for 5 minutes
presentation, things like that.
We just want to know what you learned on day 1. What are the deep insights you gained after this workshop?
Who will be the volunteer?
So, which means we'll start the session tomorrow at 9:30, right?
Yeah, Nandini is fine.
Hi, everyone. Good evening to you all.
Hi, Nandini. Thanks for joining. Hope you're feeling better today.
Yeah, I'm okay. I'm good. I will survive. But I was just wanting to test if everyone can hear me. Yeah.
Yeah, you are audible, and we
Yes,
can see
yes,
your
Nandini,
video
we can hear you.
clearly. Yeah.
Okay, great. I'll keep my video on for the session if that's okay, if everyone's internet can handle it. In case there are any internet issues, then I can always drop the video as well, because I'll be sharing my screen for a while in any case. So yeah, we can see how it goes.
Thanks. I think you can keep your video on. So far, we didn't face any issues, but if there are, we'll let you know.
Okay, perfect.
Yeah.
Should we wait a few minutes for everyone to get started? Or?
We can start, I guess, in another 1 minute by 5:45.
Okay.
Yeah. Okay. So I think most of us have joined, and we can start the session.
Yeah.
As PhD researchers, we always, many times we have to present our work in conference. And in many of this large conference, most of us, since being early career researchers, we tend to get lost. So we thought this would be a great this would be a great platform to, understand how to engage meaningfully in a conference. And for that, we invited Dr. Nandini Sarkar. It's with great privilege I would like to introduce her. Dr. Nandini DP Sarkar is a postdoctoral researcher in Health Systems and Equity Unit at the Institute of Tropical Medicine, Antwerp. She holds a joint doctorate degree from the Vrije University in Amsterdam and the University of Barcelona, Spain. Her doctoral thesis focused on challenge of equitable quality mental health coverage in Eastern Uganda. A health psychologist from India, Dr. Sarkar's research interest focus on global mental health, integrated health service provision, quality of care, and human behavior as related to health and illness, particularly in low and middle income countries. She has over a decade of experience with qualitative research methodologies, and most recently is working with complexity-driven realist evaluation methodologies. So with this, thank you, Dr. Nandini, for accepting invitation, and I hand over to you to begin the session.
Okay, thank you so much for having me, for the invitation. I know it's really late for everyone in India right now. 5:45 in the evening after a whole day of a workshop is quite, yeah, it's the end of a day. I've tried to keep this session a little bit interactive. We're going to try and use an online polling tool and stuff. And I think I just want to be more of a discussion between us. So please feel free to, drop your messages in the chat if you have questions. If you have any, comments, just raise your hand. I'll try and keep an eye out on the chat box and that. So let's start. I would like to start by sharing my screen, I think. So let's get going there. All right. Are you able to see my screen?
Yes, your screen is visible. Yeah.
Okay, perfect. Great. So again, as I said, thank you so much for inviting me to just talk about, the practicalities of being a PhD student. I've been there until very recently, and what it means to engage, meaningfully in conferences, especially in this day and age of digital virtual conferences. So we'll come to that in a bit. An overview of what we'll just discuss is essentially, my profile, who I am, my background. Conferences, why are they important? And not just why I think they're important. I think it's important for us to discuss why you and your experience are so far, and why you think they're important. And what are some of the challenges maybe you've gone through yourself till date? What are some of the highs, the lows? So I want to also learn from you, and you all to learn from each other, I think. And in the latter part of the session, we're going to try and just talk about a few tips that I would suggest that I've learned from my experiences, from my colleagues' experiences, for what I call better conferencing. I think it should be a verb, because it's, there is a way in which to conference, I think. So so conferencing. Who am I? As Ketki just said, I'm a postdoctoral researcher. I work in the Department of Public Health at the Institute of Tropical Medicine in Antwerp, Belgium. I've been here for over 7 years now at ITM, and I work in the Health Systems and Equity Unit. I'm a health psychologist by background. I did my bachelor's and master's studies in India in psychology, and I then came to Europe to do my PhD, which I completed in 2020. But I've also left this last sentence saying, but I'm also, and I think this is important for us to always remember, especially when it comes to, conferencing and human interactions in general. I'm also, I'm a woman. I'm in my mid to late 30s. I am a woman of color. I'm Indian. I'm Bengali. I have all these components to who I identify as. I speak English. I'm fluent in English. I'm fluent in Bengali. And all of these things lend to the way in which I interact with others around me. They define my experience in how I engage with people from other places in particular, but also from the same place. So I think these are things that we need to, I apologize for the noise. There's some public announcement going on outside. And these criteria, characteristics of myself influence how I engage with the world around me, how I engage with others. And I highlight this maybe because I'm a psychologist and I introspect all the time, but mostly also because I think this is important for us to know. It helps us to identify what are we comfortable doing, what are we not comfortable doing, and what our preferences are, and in what spaces do I want to occupy, and how do I create that presence of mine in this space. So we'll come to that in a bit. As part of my PhD, as Kitki mentioned, it was on the challenge of equitable quality M&S care and coverage, and it was a local health systems analysis in Eastern Uganda. Of course, some of the outputs was a thesis, a bunch of peer-reviewed publications, but also within all those years, I also managed to have 7 oral presentations at different conferences. I had 3 poster presentations. But I think in terms of outputs, and those were the concrete, tangible things that I got out of my PhD. But what you don't see and what's not on paper is the fact that I genuinely believe that I have a much more improved sense of self-confidence and an improved ability to, one, discuss my own work. I can definitely now talk about my PhD, because there's the one thing I think, if I have one advice for any PhD student, is that, no one knows your work better than you, like full stop, that's it. If you ever have a moment of doubt where anyone could be asking you a question of, where you think, oh no, are they correct? Have I done this incorrectly? Or, oh, maybe they're right. At the end of the day, you are the only one who knows your work as in the entire world, and no one else will know that better than you. So if you ever have a for me, that was my mantra. Like that was what I had whenever I had a doubt. So of course, now I can talk about my own work, but beyond my work as well. It helped me. All of these kind of interactions have helped me learn how to better network, how to learn from others, about others. So I think, yeah, we need to also learn how to improve, of course, our, produce in terms of outputs, but also how do we work upon ourselves? How do we grow as people throughout this journey, which is one of the most intense journeys I think any of us will go through in our lives. Like I don't know if anyone else has said, but I think it's definitely one of the most defining journeys that we choose to embark on, because this is often a choice for most of us. Okay, we're gonna try something interactive here. I never know how this goes with internet, blah, blah, blah. If you could all use your smartphones, scan this QR code. And I'm gonna now, I think, have to stop my share, start another share. So it's a little bit glitchy. I'm sorry about that, but I can't think of easier ways. But I'm gonna give you a minute for everyone to scan this QR code. And it should take you to a poll. Can you let me know if it's working, if it's taking you somewhere? Because I also need to, yes, okay, great. So I'm gonna stop that share and I'm gonna share the other screen, which is, where is it? Oh dear. Here it is. So it's obviously not this, because this is the Zoom I attended. And it's here. Perfect. So if you could all take a minute to just kind of respond. And for those of you who missed the QR code, you can also go to www.menti.com and put the code 2442564 in. It didn't work. Okay, so you could join, I think, Menti. I'm going to put this in the thing. That's the website. And then 2442564. That's the code you need to input. All right, we're getting some great responses. I think you can write multiple responses. If you have more, I think you can write up to 3 responses. So feel free to keep thinking. I don't know how many of us are on this. So if everyone puts in at least one, then we should have a few more responses, I think. All right. This is great. Thank you. Okay, let's take a minute to read what all the pop-ups are. And so what we can see here is the word cloud, and what the word cloud kind of visualizes is the number of times something is said. So the larger a word is, the more often it's been said by you all, the respondents. And so what we can see is, of course, why are conferences important? The 2 biggest things is, for networking and for learning. And I think we can all agree with that. I think most of us would definitely agree that we go there to learn something new, or to learn, even old things, to relearn things, of course, and also to meet others, to network, to learn from other people. And so, so we've also got some nice, interesting other ones there. So we've got variations of learning something new, networking, yes. And then I like the fact that there's also to share. A lot of us go to conferences to actually present our work. We go there to talk about the research we've done that we believe is important and that we think should be highlighted and should be, that it has value. And you want to share that, of course, because, what's the point of doing something where you discover or you unearth something of interest, of a broader global interest potentially, and then it just stays within your little bubble and no one else gets to hear about it. A lot of scientific knowledge, one of the most important things about it is to share that knowledge. How do you convey that knowledge? And not just through, academic peer-reviewed journals, but also to each other. So to share, and like we said, it's about knowledge dissemination. Exposure to the real world. That's an interesting one. I agree. You do get another type of exposure, especially to outside of, like I said, oftentimes we're doing research, we're in a little bubble. And this allows us to kind of go beyond that bubble. We see, okay, what are others doing? Am I in a little silo of myself, or am I on par with what the rest of the world is doing? Is this of pertinence to the rest of the world? So it does, exactly. I agree. Yeah, I think it allows for exposure to the real world. It allows for visibility, of course, of your own work. And in the same way that you have exposure to the real world, you can often, through conferences, also gain, valuable insight into different perspectives, other people's perspectives, not just your own. Field exposure, of course. I'm not sure what confidence is, but maybe confidence, or yeah. In any case, thank you for this. We're going to come back and use Mentimeter again in a little while. But for now, I'm going to stop the share. We're going to go back to the PowerPoint. And if any of you have questions or additional comments, please drop them. Put up your hand if you want to speak out loud. Not a problem there. Okay. So we're back to our presentation. So that was, why are conferences important? So thank you for engaging in that. And as you all said, it basically falls into these three categories, I would say. One is the opportunity. It's an opportunity to present your own research, like we spoke about. It's about sharing what work you have conducted, why you think it's important, share it with a larger audience. But it's also an opportunity, as we also said, to learn about other timely and relevant research, especially in your field of interest, that you work in, the domain that you find yourself in. We all saw networking was the biggest category. So of course, it's also an opportunity to meet others. You get to meet renowned persons in the field potentially. You get to meet others with similar interests, backgrounds, others in a similar career stage. You can often go to a conference and find other PhD students like yourselves who are going through the same struggles, going through the same highs, the same lows. So your peers essentially, but most, I think what I find conference most useful for is that oftentimes it's an opportunity to meet persons you would never have met otherwise. That, in another context, realistically, you would not have met them. But here you are, and especially if you work in health or global health, there are chances you will get to meet other individuals from entirely different contexts, other countries, other states in India. I think, just learning from each other within India is such a huge opportunity, I think. So, it's an opportunity to meet persons that you wouldn't necessarily come across in your day-to-day activities, the work that you do, the research that you do. And lastly, I think it's a potential for growth. I think conferences are there. They can often be a stepping stone in terms of your career growth. They allow for you to showcase your work. It's a valuable way to disseminate your work. So, there's growth in your career. Because of potential networking that you may have had through these conferences and whatnot, oftentimes there's potential for job opportunities. You may have made a contact at a conference in a way that can lead to a job opportunity that you otherwise wouldn't have had. And again, I come back to when we talk about growth, not just those outputs and concrete, tangible things, but also self-growth, self-confidence, self-ability. There's so much potential for growing as as academics, as researchers, as individuals, that oftentimes so much of what we learn in these spaces can kind of trickle into our everyday workings. We become better mentors, we become better supervisors in the future, we become better kind of, mothers even, or fathers. I think the way in which we engage with each other changes because of the more practice we get with getting to know different people. So yeah. Any questions at this point? Are you good? All right. Let's move on then. All right, we're back to Mentimeter again. So I'll leave the QR code if everyone can scan the QR code. Give you a minute. And then I'll drop, this one has another code, I think. So I think once I go to that screen, I'll drop that. Yeah, okay. I think I'll move towards the other screen now. Oh. All right, sorry, 1 second. Let me just get here. All right, brilliant. So let's go back to Zoom and share screen again. There might be easier ways to do this, but I'm still.
I don't think so. Your screen is visible currently.
No.
Oh, yeah,
I'm getting there. Yeah,
okay.
Sorry. No, I know. So this is the question. How many conferences have you attended since your PhD journey started? I think I can also see how many. 7 people have responded. 4 have said none. 3 have said 1 to 2. Any others? Okay, and I received kind of an overview of who the participants were, and I saw that most of you have been doing your PhD for approximately 1 to 2 years. Some of you are aspiring PhDs. Others, I think only a couple of you have been a little bit longer in the game. And I think the biggest thing we need to keep in mind here is, of course, that we are currently, especially those of you who have started their PhD in the last 1-2 years, you are COVID Corona PhD babies. You started your whole journey in the middle of the pandemic. And of course, we all know what the pandemic has led to, and that's led to a lot of conferences either being cancelled initially in the year 2020 to being moved online. And that's a whole different format, another way of engaging. We'll come to that in a bit. Okay, I think most people have responded, as many of you who would be able to. So let's move on and answer the next question. So you should see that on your phone. Oh. Yeah, so of the people who have attended, the 3 people, that's not a lot, were they virtual or live? So we've got 2 virtual, and the third person. No, the third person, it was neither. Okay, well, maybe we'll just go with the fact that we can see clearly, they had it live. I might pick on the third person and ask, do you want to, who was it? And what was it? And where was it? And was it before the pandemic? Please feel free to unmute yourself and speak. I can't hear anything. I don't know if it's just me. Oh, there were 3 people with, okay, we're getting some more respondents. Okay, all right. But this is just to give an idea that, of course, like I said, those of us who have, especially recently in the last year or 2, who have been attending conferences, most of them have become virtual. I'm going to go back to my presentation. I think the question that I want to ask is essentially, for those who've been to live conferences in the past and those who are now going to the virtual ones, which format did you prefer and why? And what are some of the differences you may have noted between the two? And please feel free to unmute. I can't pick on people because I don't know who all are there or who's listening actively.
Hi, Nandini. Hey.
Hello.
Hi.
Hi, Aishwarya.
Hi. Yeah, for sure, in person.
In person,
In
yeah.
person would be definitely much more, it's much more better than virtually. At least that has been my experience. Yeah.
Mm-hmm. Yeah. I see Kiki's also agreeing. Live, more interaction, she writes in the chat.
Better opportunities to network around with people.
Yeah. Live allows for more opportunities to actually meet people face to face, and yeah, network with them in person, of course. Yeah. And I think that's the general consensus. I think regardless of our shift towards kind of virtual conferencing, I think we all definitely do, at least personally, at least I prefer the personal, like the in-person engagement that we can have at conferences. However, at the same time, because of so many conferences going online, we actually have access to so many more conferences. We don't have to worry about flying halfway across the world. We and all the kind of resources all of going to a conference consumes. In this case, we just have to see, okay, can we attend it in terms of time and in terms of, online webinar fatigue, cost savings, exactly, Kranti. So there is a cost benefit analysis we can do. And so at the same time, I think most of us would agree, we do miss that face-to-face interaction. I think we're all pretty sick of, our screens by now, but it's life, we're adapting. All right, moving on. So if we go on to kind of the last section of this talk, and we talk about kind of tips for better conferencing, as I said, I think my first tip would be to, know what you want to get out of the conference. Why are you specifically there? Are you there to present, to share your information, your findings? Are you there to learn? Are you there to network? Before we go into kind of more details about each of these sections, I'd also just want to say that when we go into the idea of networking or conferencing, and being physically, even if it's virtually present, we shouldn't fall into the trap of comparing ourselves to others. We shouldn't fall into, the idea that, oh, I should be able to do this in terms of we have an idea of what it means to be to what it means to network and to get contacts and to get benefit out of a conference. And I think we sometimes fall into the trap of comparing ourselves to others and going, oh, he's so much better at this and I don't have the skills. But that's the point. Not all of us have the same social skills. Some of us are shy, some of us have anxiety, there are language barriers, there's even accent barriers. We could all be speaking English and we might not be able to follow each other. There are so many different components into why it may or may not be easy for someone to speak, to network, to engage. I personally, for instance, I know this for a fact, and over the years, this is still something that I struggle with. I'm very good with small groups. The moment you put me out in a large group, that's it. My social anxiety rises. I have taken, a lot of practice a lot of effort to kind of get it to a space where I am comfortable doing it. And interestingly, on that front, I am much more comfortable talking in the virtual setting in front of a laptop than I am in a large conference room presenting my work, for instance. And that's just because of just my personality and my skills. So that's the point. I think we can often see someone and we can think, but they're so fluent and they're so adept and they are capable, blah, blah, blah. But I wouldn't compare. I definitely wouldn't, because we are all on different levels. And the more we practice, the more we put ourselves out there, the more you grow as a person. So don't worry too much about that, especially in the beginning of your PhD journey. So I'm going to focus on, if you're there to learn at a conference, what to do, some tips. And if you're there to network, what to do, some tips. If you're there to learn, I think it's really handy to go over the conference schedule in advance. Most of this is kind of speaking as if this was a live in-person conference, and we'll come later to some tweaks that we can do if it's a virtual conference. But technically also these still apply, all of these tips also apply to the virtual conferences, but for virtual ones, there's some extra things we can do. So in any case, for a conference, it's useful to go over the schedule in advance, know what sessions you'd like to attend, and why. Also identify that for yourself. Is it based on interest? Is it based on the fact that, it's a topic that you have worked on and you want to see what the latest data, information and science is about on that topic? Or is it a new topic? Is it a type of methodology that you've heard of, but you really utilize and you'd love to learn more, a little bit more? And so is it a novel topic that you want to go? Are you going for the speakers? Sometimes, like I said, you're going to hear a renowned speaker or a group of speakers or a group of researchers who are presenting work that you admire. So, make sure you select in advance what you want to attend. Also, you can select these sessions based on the session type. I would advise that it's actually nice to try different types of sessions. Go for panels, go for one-on-one oral presentations, go for the poster presentations, go for interactive workshops. It helps you kind of, again, learn, but from many different perspectives. It helps you engage because each of these session types have a different way of engaging with the audience, right? So you as an audience member, if you're sitting there, you get to experience a different way of engaging with those who are there sharing their knowledge. So being an audience member in a panel is very different than being, part of an interactive workshop. So select a variety of, a variety of session types, if possible, would also be my suggestion here. Additionally, feel free to ask questions. I think especially early in our PhD, sometimes we can kind of think, does this question make sense? Is it important enough to answer? We can, we start having doubts about, whether we should ask a question or not. And I would say there's no harm in asking a question. If you are the type of person who gets a little bit nervous, to ask a question in a larger audience, if it helps, prepare your questions in advance, especially if you know who's going to speak, if you know the work that they're doing, if if you also work in the same field and you have an idea of what's going on in that field, you can always prepare questions in advance. And then oftentimes that's easier to ask as well. It's also important to, I think personally, to mention who you are. If you're a PhD student, mention you're a PhD student and your affiliation before you start. That kind of situates for the presenter, I think, kind of knowing, also, who are we engaging with? It's nice to have a human connection, to know who it is that's asking me my question. And also, and this is nice as well, that if you mention your name, where you're from, or your affiliation, it can also sometimes stay in the mind of the presenter, and that way they are more likely to remember you because you actually said who you were. And that also helps with the next section, which is networking. And if you're there to learn still, of course, if possible, if the speaker has time, if you're not, if they're not running, sometimes speakers are so busy, they just go from one session to another. But if they have the time, follow up with that speaker, if possible. So go up to them, ask, share that, yeah, I asked you a question, or, say, I really liked your presentation, and blah, 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 blah. And so it's important to also take it up ourselves, to take that initiative. It adds another dimension than if we were just to sit there and listen and learn, which of course is also good. I mean, we need to do that. We need to sit, listen, learn. But of course, we're also there to network, right? So I think in terms of networking, my tips would be open to talking to others. And by others, I really want to specify others. Sometimes we go to conferences and we know people from our own institution, and it's easy to go to conferences and you end up basically networking within your own social academic circle with the people you know. So I think it's important to be open to talking to people outside of this group. And that can be daunting. It can be daunting to go talk to people you may not know. However, to overcome that, one thing that I think is kind of useful and nice is to find a networking buddy, pair up, for instance, with a colleague, a peer, or someone you've just met at the conference and say, hey, this is what I'm interested in, and I would love to go be able to talk to people from this organization, that organization, or these specific researchers, and, kind of support each other. Check up on each other at every so often. Be like, hey, did you meet anyone? How was it? And if you meet someone that you think the other person is interested in, make sure to pass on that contact. So that's another strategy that can often help kind of getting over the awkwardness, especially if you don't know many other people there, to pair up and find a networking buddy. Another way in which to enhance networking is to join more interactive sessions. Like I said, join the workshops, the one where you actually get to talk and you meet, and at the end of it, because of that joint interactive session, you have a shared experience, and you're more likely to kind of converse outside of just the session and what was there, but to talk about your own work, how that session may have influenced your work, or how it impacts how you saw the field. It's a starting point. It's like a conversation starter, basically. So especially if you're in those more interactive sessions. Additionally, use all those breaks. Conferences have many coffee breaks, lunch breaks. Make sure you utilize that time, because most of the time we're sitting in the different sessions, and so we don't often get downtime or networking time. So if you're really there to network, sometimes people skip sessions in order to network one-on-one. So if you find someone you meet someone in the coffee break and it's kind of going past into the next session time, sometimes it's worth not going to that session if it means you have a really engaged conversation and discussion with someone you just met during the coffee break. And coffee and lunches are often great social icebreaker spaces. You can go to a coffee table, a coffee and a lunch, and just start talking to the person next to you in line while you're all waiting, and just say, oh, have you attended anything nice so far this morning? And, chit chat, the small things. That's often a great way to start talking and introducing yourself. Speaking of introductions, it's nice to have some small introduction about yourself. And if it helps ease up any anxiety for you, have it already prepared. Know how you want to present yourself. In my case, I would say, hi, I'm Nandini. I'm from India, but I work in Belgium. These are my interests. Like, you just, have something that you are comfortable saying and use that as an opening line. Additionally, also have questions where, because I think that's the other important thing about networking. You want to know about the other person. It's just not only about presenting yourself, it's also about getting to know the other person. Because if it's one-sided, that's really unlikely to pan out in the long run. So have some small, similar bio questions prepared. Another thing we can do is, of course, have, and this takes some practice, have an elevator pitch ready. And this is sometimes really important for, sometimes you meet someone who just doesn't have the time and you really want to have their acquaintance. An elevator pitch is essentially something that we teach where it's a 3-minute kind of rehearsed speech of, say you're stuck in an elevator with someone. How do you sell what you're trying to sell? How do you sell your idea, your topic, your theme, yourself, while you're stuck in the elevator with the said person? So it's called an elevator pitch for that reason. So if you have something like that ready for yourself, then you can throw it out anytime you meet someone who's relevant and you think would be interested in what you have to say. Lastly, if you have the opportunity to have business cards, of course, try by the end of that conversation to exchange business cards with the person that you're speaking to. Brilliant. So yes, about elevator pitches since you had a PhD pitching competition this morning. So in the same way, while you're not trying to pitch your PhD necessarily here or trying to get more grants, it's a similar concept. You're pitching who you are, what you do, what you'd like to get out to this other person. And it's a really quick, informative, fast-paced way of getting to know another person. Finally, I think it's important to make use of social media. So, especially in conferences nowadays, they all have conference hashtags. Tweet about sessions you attend, tag relevant people, retweet people that you're interested in or you follow. And all of this will, because you are also, and I'm using Twitter because that's as the example, because that's what I use for professional academic purposes. If you tag these different people, if you retweet these tweets, that will draw attention to you. That will make that other person take notice of you, especially if they're also active on Twitter. And also because it's linked via the algorithms to all the different topics and the hashtags and whatnot, it draws attention to you. Other people, even outside of that one-on-one, whoever you're tweeting or tagging about, it goes beyond, it reaches a much larger audience. So it's a good way to kind of broadcast yourself as well. There's also the option to, of course, direct message people. I say this wisely, to use this wisely, because I think, you don't want to be intrusive when you direct message people, but especially if you've had an opportunity where you had a moment to exchange and it was a good in-depth conversation, for instance, but say you didn't exchange business cards after that, feel free to reach out to them via Twitter, because that might be a more easier way than to find their email through their academic, websites, etc. So, and then reach out and ask them for their email via direct message, for instance, so if there's a basis, or if you just genuinely, there's been a lot of online engagement between the two of you, you can always DM them. So it's about using your judgment when and where to direct message people, I'd say, using social media. Like I said, there are, of course, a few differences in virtual versus live conferences, and we definitely live in digitized times now. And we all know virtual engagement is very different from in-person engagement. What I would say is that in virtual sessions, what often happens is we kind of go quiet. We just listen. And I personally think it's nice if we are actually more active as the audience, where we ask questions. If someone's presenting at the end of it, to applaud the person, to congratulate them, use the icons, the clapping, the hands, to show like a little bit more engagement, because I think you would do that in real life. If you're there in person watching someone, you would do that. So I think it's a nice courtesy, and it's a nice way to encourage the presenters as well, to make it a little bit more two-way rather than so one-way as it often becomes with online platforms. And in that sense, to use the chat box as much as possible, ask your questions, write out your comments, beware that they're not too long, because that can also happen. And then they're just so long and winding that, that your message might get lost. But in virtual conference platforms, it's a good way, again, because you're often, your name is there. It's a way to, again, put yourself out there for others to take notice of you. And like I said, the moderators may notice this. And sometimes, depending on how interactive the session is, moderators may notice that and say, oh, could you please voice your thought or ask your question in person? And it becomes a little bit more engaged and lively. In terms of networking, a lot of these larger conferences have virtual spaces and coffee break spaces where you can meet one another. You can chat to each other in those spaces. And what is useful if you're actively using those is to have, add a photo of yourself, make your profile, create your short bio so that if anyone sees you and then you're chatting in those virtual spaces, they know, okay, yes, Nandini Sarkar. She likes to talk about mental health. Okay, great. So they can ping you for that separately if need be, or that's how people notice you. And that's still another way to network in these virtual modes. So we shouldn't disregard them. In short, there's not really many do's or don'ts. I think prepare in advance. In case you get nervous or overwhelmed, take a moment. And after a conference, for instance, do follow up. If you've had a nice engagement with someone that you think was of value, there's no harm in dropping them an email, especially if you manage to exchange business cards or take their email down. Write to them, tell them it was a pleasure to have spoken to you. Follow up with any valid queries that you may have. I think this is the biggest thing I would tell any early career researchers, don't worry too much about what you say or what you did. And it's not the end of the world, indeed. So I know in the interest of time, we are at 2 o'clock, or not, 2 o'clock for me, sorry, 6:30 for you. I will wrap up shortly, but what I want to tell you guys is a brief opportunity. Perhaps you would be interested. We'll be sharing these slides, I think, with you all. So you can always take a look at that, and you can always drop me an email, of course. That I am part of something called Emerging Voices for Global Health. It's a blended training program, and it's aimed at basically emerging young, promising health policy system researchers, decision makers, global health actors. And it's essentially a network, but also a training program. So you go through a lengthy training program, which is both virtual and then physical, with face-to-face training. And then you become part of a network. It's been going on for the last 10 years. We just had our 10-year anniversary. And it's really global. When I say global, I mean global. And the reason I mention that is that our current call for applications is open. The deadline for application is, of course, the 15th of April, 2022. Different tracks. I would say perhaps you could just, Google Emerging Voices for Global Health, and then you can see the call for 2022 specifically. And if you're interested as well, just please drop me an email. And I hope some of you may consider applying. I know a lot of the IPH alumni are alumni of EV4GH as well. And on that note, thank you very much. And any questions? And also, don't forget, when you're registering for a conference, you're always a student. Always cheaper discounts. You will get the student discount then, but not if you're a researcher. So I'm really sad I no longer qualify and I have to pay full price. It's extortionate. Anyways, thank you so much for your time. And if you have any questions, please go ahead.
Thank you, Nandini, for taking us through this very informative tips about networking. And I really like the way you differentiated between tips for learning and tips to network. And thanks for sharing such practical tips. If there are any questions, please go ahead. We can take 1 or 2 questions. Can have questions, reflections from the session.
Yeah, I don't have a question really, but yeah, more like a reflection about conferences and just, I mean, in virtual conferences these days, it's like even harder to interact and engage, right? So do you have any ideas on that? Like how can we keep ourselves motivated when we are attending a conference virtually and there are these portals that you enter and nobody really knows each other, but it's just a strange place, I feel. So any tips on navigating yourself on a virtual networking, a conference?
Thanks, Aishwarya. I think indeed it's awkward, I think, when you go there and you have no visual of the people who are there, of course, because most of the time we all have our screens, videos turned off or muted, and we just sit there in silence and we just listen. Sometimes what I think there are, I think, a couple of things I would say with virtual conferences that I think are important. One, I think it's even more important than the real life conferences is to choose the sessions you want to attend really carefully. Why are you going to that session? What are you hoping to get out of it? Are you going there really to listen to the oral presentation, for instance, and take that? Or are you going to network? Or if you're going to network, then maybe you shouldn't choose an oral presentation as the best way to network. Maybe you should choose, and that goes back to another mode of presentation. So maybe an online interactive workshop where you have different breakout groups and you have more one-on-one engagement. And so it's the first, I think, is choosing the appropriate session based on what you want to get out of it. And then the second thing I think is we really need to maximize how we use these virtual conference platforms. The platforms are getting better and better every day. I think they're trying to make it more interactive. And, so it's about, like I said earlier, it's, if there are those virtual spaces and coffee break spaces, join them. It's awkward, it's weird, but I think we need to get over that for it to become a little bit normalized. I think we need to start using these platforms more for us to be like, yeah, I went to that conference and I created a profile for myself. I hate doing that. I hate attending and creating a little profile with my face and my bio, but I think it's important. And I think we need to get over any resistance we might have towards that, because otherwise, like you say, it remains awkward and then we're not moving forward. So I think, yeah, it'll hopefully get there, but I think it will take some time. Yeah.
Thanks. Thanks a lot, Nandini.
No worries. Thanks.
Yeah, I see Kranti's hand raised. Kranti, you can come in now.
Yeah, I was just coming in on the whole virtual conference platform. I feel like one nice thing about the virtual platform is when you see somebody who's done a really good presentation or panel discussion or whatever, it doesn't look as creepy at least, to write down their name because you're behind a screen. You can quickly note this down and then you can go looking for them in other sessions, or you can actually find them more easily than you would in a live conference and try to interact virtual. So you can do a few weird things behind the screen, I feel.
So it's better to stalk people. It's more easier to stalk. No, I'm kidding. Do not stalk people in live or virtual. That is not a takeaway from this. Yeah, no, I agree. I think sometimes we are more comfortable behind our screens in a certain way. And like I said earlier, virtual conferences have opened up so much more than was previously, like in terms of logistically feasible for us to attend and whatnot. And the amount that we have access to, I think, is great. We just need to be more selective about it. We just need to be more, not selective, but purposive. Like we need to know why are we, choosing these conferences, and also to avoid burnout, because that's the other thing. You attend so many virtual things one after another that by the end of it, you don't want to engage with anyone online. So I think, to be selective and purposive so that it can be of the most use, to really make the most out of it. I don't know if we have any time for any others. So last plug, I'll say, for anyone interested, please do read up about the Emerging Voices for Global call if you're interested. It's a brilliant network. That's all I'm going to say. I think if you really want to talk about networking, one, it makes you go to a conference. It makes you get to know a whole bunch of other people from all over the world. And it hones all of these skills that we're talking about. It hones these skills of presentation, of comfort, of knowing who you are, of how to, convey your work that you do to others, to be comfortable doing so. So it's a unique training program that may be useful. And there are some funded fellowships for individuals from India as well. So that's always useful. And the conference this year is in Colombia. So if you really want to experience some major jet lag, you're welcome. So please feel free to apply.
Thank you, Nandini. Thank you for taking us through this engaging presentation despite being sick and taking out time to interact with us. And I would also like to reiterate what Nandini said about Emerging Voices for Global Health Program. I was part of the secretariat, and I would really encourage all of you to consider applying for this batch. Thank you.
Indeed. Thank you. Have a good evening, everyone.
Yeah, wish you the same, Nandini.
Bye-bye. Take care. Nice seeing everyone.
So that comes to an end for the first day of our workshop. Thank you, Nandini. Thank you, Kirki, for the wonderful session. And dear participants, it was wonderful having you here for the first day. I'm sure it must have been a very exhaustive day for all of you. So have a good day and good night and take rest. See you tomorrow with energy, a lot of energy. Okay, thank you.